become highly disorganized, and you experience audio hallucinations. You become highly aggressive and frequently assault others. Do you think that's accurate?
Yes.
Okay. So, one of the things I thought was interesting in the report, because if you remember, I've had, I think, the last few hearings with you. If you remember, I conducted the last few hearings. It said that you are a chess player, and I don't think you've ever said that at a hearing. So I was curious, is that something that you find interesting in your free time?
Yes.
Um, Anything else that stood out to you in that report?
Mm.
It provided some diagnoses, sir. Do you remember those?
Yes.
What do you think they're accurate or not accurate?
Accurate.
They're accurate. It also provided some recommendations. I'm just going to go over them to make sure to see what you think, okay? So it said that you present with a severe and persistent mental illness and that you should be identified as what's called MIO, mentally ill offender. It recommended that you remain compliant with your medications, that you be more receptive to trying to participate in mental health therapies, and that it noted placement will be an issue if you're released. It noted that you require some type of long-term residential group or nursing home, nursing type placement. What do you think of that?
Good.
Would you want to do like a nursing
Yes.
home? Okay. Okay. Um, Sir, how would you describe your current attitude towards alcohol?
Just stressful.
Stressful? So does that, can you tell me what you mean by that a little bit?
Just emotional issues.
Do you want to drink?
Yes.
Um, how old are you, sir? How old are you?
I'm 40.
I appreciate you coming to this hearing. We'll go ahead and conclude. Thank you so much.
Okay.
All right, we are on the record. Today's the time and place set for a rehearing for Mr. Gregory Bane, offender number 14326. Is that you, sir?
Yes, it is.
My name is Kelly Perry. I'm a hearing officer with the Board of Pardons and Parole, and I'll be conducting your hearing today. As is an official proceeding, I do need to swear you in, so if you could please raise your right hand. Do you swear or affirm that the testimony about to give is the truth, the whole truth, and nothing but the truth?
Yes, I do.
Did you receive 7 days written notice of today's hearing?
Yes, I did.
Did you receive your blue disclosure packet?
Yes, I did.
And did you have a chance to review that?
Yes, I did.
Do you feel prepared to go forward with today's hearing?
Yes, I am.
Okay. Are there any errors or corrections I should know about in that blue disclosure packet before we begin today?
No, there is not.
Okay. So just to kind of tell you how today's going to go, sir, I'm going to go over procedurally how we got to this hearing. I'm going to ask you for any comments about your offenses. I'll go over your last parole. We'll go over all the assessments and the psychological that was done. If you were released, what that would look like. And then at the end of the hearing, if you have further questions or comments, to let me know, okay?
Okay, thank you.
Additionally, I would note for the record that you have family here. I'll state that for the record. The board will know. And I'll be making notes the whole time, so I don't want you to think I'm not listening, okay?
Okay, thank you.
So it looks like a parole violation hearing occurred in May of 2022. The board noted your denials to allegations 1 through 2, took judicial notice of pending case 2119-00589, and scheduled a paper review. There was subsequent paper reviews. At the PV hearing, parole violation hearing in April of this year, the board accepted your admissions to allegations 1 through 2, took judicial notice of case 2219-00589, which did not result in board jurisdiction, and ordered a rehearing for now with sex offender assessment and contract psychological review. Does that sound procedurally correct, sir?
Yes, sir.
Okay.
I am.
You're fine. In regards to your offense for which you originally incarcerated, I show case number 941901368. I'm not going to go over that offense. Maybe you've done in previous hearings. I'm just going to ask you if you have any comments about that offense.
If there's something that you want me to explain, I'm willing to explain the whole thing to you.
If you want to do that, I mean, obviously this is a hearing where I want to hear what you have
I
to
mean, what I
say.
came back to prison on, because as you know, the charges stayed into the courts, and I got put on felony probation.
And we'll talk about that parole, but I guess, do you have any insight into your original sex offense?
Oh, the original, the very first one?
Yes, about your risks,
The what now?
about your risks.
Oh, no, I don't.
Do you think you have any risk?
Oh, yeah.
Okay, what are your risks?
I would say my risk is, alcohol. Alcohol's always going to be a thing, that's always going to be a risk. Falling back into my old patterns, as, sexualizing people, and stuff like this is always going to be a risk.
How do you plan on dealing with that risk moving forward?
I've set up so much support. The individuals that's behind me is my main support. But I've got all my sisters and brothers. I've got several friends. I've got, I'm going to get into the church sponsor system when I get out. They got a church system on the outside. That's just nothing for parole, parole people that is, sex offenders and stuff like this, where we can go to church, have sponsors, somebody we could, be able to contact if we're having hard times or whatnot. Say I can't get a hold of my brother or any of my other family, siblings or whatnot. I'd be able to contact one of them, I've set up, with my friends, the same thing, so I'm going to have a arsenal of different people that I could turn to. But the main thing about this whole situation is I've got to be the one that takes the steps. I've got to be the one that, asks for the help. That's my biggest downfall is, when I get, into a depressed state of mind and, I fall off and I start, getting into the depressed state of mind. See, I found my son dead.
And I did read that, and I'm sorry.
On
for that.
September 19th. And 2021. And my world got flipped upside down. And I still struggle with that. And so the thing about it is, you know, part of me wanted to live, part of me wanted to die. Because I didn't want to deal with the pain. And I almost went back to doing my old behavior of drinking, but some little voice in my head told me not to. And so I didn't. And I struggled to pull myself back together. So the thing about it, I think I got a better handle on it this time.
And why do you think that?
For the simple fact is that I think that I became complacent. I took the steps since I've been in prison. I've taken the steps to understand what, you know, who I am, where, you know, where I'm doing wrong. I've taken, you know, the classes of, you know, Daring Greatly, Real Transition, God, I got them wrote down. Sorry, I'm really nervous. I'm really
Okay,
stressed.
so I want to make sure I get to talk about your last parole a little bit more. And then obviously I want to get to those other assessments.
Okay, yeah, go ahead. I'm sorry.
No. And I asked you for your insight, so I appreciate that, right? Because this is part of the hearing is for me to hear what you have to say.
I plan on, you know, contacting, you know, my parole officer. See, I did contact my parole officer and I did contact my, you know, my therapist when, you know, I found my, you know, I found my son dead. I'm the one that found my son dead in his apartment. He was face down on his bed, you know, purple and everything. I found him dead. I can't, that would be ignorant to say that it would be as hard if somebody just told me he died, but it probably still would be hard. But I'm the one that found my own son dead on his bed, purple,
And I'm very sorry to hear that, sir.
you know?
But I do want to make sure I get to your last parole, and I don't want to be dismissive of that in any way, right? But there was also behaviors on your last parole that were concerning, right? And
Yes.
I did receive the letter from your defense attorney. I want you to know I reviewed that and I read that. But I show you committed case number 221900589. Obviously, I already went through, it's not board jurisdiction, but the violation of itself is, right? So I show that you went to a hotel, you met the victim, she had diminished mental capacity, and that you were in her room, and that she said that you were triggering her trauma, and then you sexually assaulted her. So tell me about that.
Okay. The thing about it is where I was moving at, I'm going to start with where I was living at first. I was living at the Home Inn, and it's a transitional housing. You could stay up to a year and a half there, and my year and a half was almost up. And even though I was going through my trauma that I was going through, I was trying to pull myself together enough to get, you know, because I knew I had to move. And if I didn't do something, either I was going to, you know, commit suicide, or I was going to, you know, do whatever I have to do to, you know, survive and keep going forward. So I pulled myself together enough to, and somebody told me about it was called the La Pointe Hotel. I went down there and filled out an application and everything, and they contacted my parole officer. He came down, he approved it, you know, on the 6th, that's when, you know, the hotel contacted me and said that I had been approved for the apartment. And I says, okay. And they says, can you come down and fill out the additional papers and stuff like this and get your key and, you know, and stuff like this? And I said, yes, I can. Well, I came down, and that was on the January 6th, and I went up and I asked for the lady that I was told to ask for. God, what was her name? I can't even think of her name. But anyways, they told me if I would have a seat just for a sec, because she's busy for a sec, and she'll come out and talk to me. Well, then I went and sat down, and you know, there was a few people, and plus the you know, person I victimized. And the thing about it is, we introduced ourselves. I said hi, and she said hi, and that's when she, you know, we introduced ourselves, and that's right as far as that got to that point, because they came out and says, Greg, you know, would you come over here and, you know, and they asked me a lot of questions. And then after they give me a tour of the place, anyways, I moved in that night to the Point Hotel, and but the following morning, I've been feeling kind of sick, you know, even at that point in time. And so I went to the next morning to my doctor's, you know, to see if I, you know, had COVID. And of course, I had COVID. So I quarantined myself from the 7th until the 14th. On the 14th is when I, you know, came off the quarantine, and I left and I came back, and I was going up to my place, and I ran into the same lady that I met, you know, out in the lobby on the day I moved in. She asked me, she goes, you know, did you get settled into your place? And do you got a good view out your window? And I says, well, I says, yeah, I got settled in and everything. But I said, if you want to, I said, you could come, you know, see it, you know, for yourself. So she came up and she, you know, came in and looked at, you know, out the window, and, you know, made the comment about the view, and made a comment about the bedspread that was on the bed, because it had lions and stuff like this. And we sat there and talked for, I'd say, maybe 5-10 minutes, and then she left. Well, and then and the next morning is, you know, I decided to go try to find a small round coffee table to put into my apartment so I could have something to eat on, you know, instead of sitting on the bed, you know, and eating. Well, the thing about it is that's when the victim, you know, the person I victimized, or, you know, the victim that, you know, came up and started talking to me. And that's when, you know, we talked back and forth for a second. She asked me, she goes, would you like to be you know, be my friend? I said, sure, I'll be your friend. And she said, would you mind coming to my place and help me move some stuff, you know, that I can't move around? Because as you know, she's on a walker, you know. And I says, yeah, I have no problem. But I says, first of all, I says, I've got some errands that I've got to run. And then I says, when I come back, I says, I'll come down and help you. Well, the next thing you know is that I take off, and you know, I go and do my things, you know. I come back, and, you know, and I throw some clothes into the washer and stuff like this. And then she calls me, and she asks me, are you going to come down? And I says, yeah, but I said, let me finish what I'm doing for a second. I said, then I'll come down. And she mentioned something about a moon out the window and stuff like this. And I says, okay, I says, give me a few minutes, I'll come down. Well, after I got done throwing a batch from the washer into the dryer, and then I put another batch in the wash thing, you asked for the whole thing, so I'm just giving you full.
Well, sorry, and I appreciate you going into detail, but I mean, obviously the thing I'm concerned about is the sexual assault itself, right?
Oh, okay.
So,
Well, it's getting to that point anyways. I went to her place. She showed me out the window at the moon. Anyways, she told me, she says, sit down in this chair. And I figured she just wanted to talk. Well, she started massaging my shoulders and back. I says, what are you doing? And she said, this is what I like to do to people I like. Well, the next thing you know is I dismissed I dismissed it because she's an adult, I'm adult. And I didn't know that at that time, she was mentally diminished. I knew that she had a disability because of the walker, but I didn't know she was mentally diminished. Anyways, the thing about it is that after, her massaging my shoulders and that for about, I'd say about 10 minutes, 10, 15 minutes, she made the comment she likes to have her back, and legs, massaged because it helps with the nerve pain and that she deals with. I told her, I says, okay, you sit either on the edge of the bed, or I said, lay on your belly, and I says, I'll massage your back and your legs. So, I massaged her back, then I went down and massaged her legs, and then I came back up, and, we was talking, and, I started rubbing her back as she was still laid on her belly, and she reached up and pulled her shirt up, and, for me to rub it without the shirt on. And the next thing you know is I thought, Okay, maybe she would like to have, her back and legs massaged without no clothes on. So I, told her, I says, if you want to take off your pants, I says, I'll massage your pants. I mean, your legs without the pants on.
Okay, so I understand that you're telling me that you did not understand her mental condition at the time. That it sounds like what you're saying to me is you thought it was consensual, which is what you maintained in the
Yes,
I think your board packet, and as well as what your defense attorney has stated.
yes.
And I understand that's where you're coming from. But she obviously noted that she said it was not. She felt it was not. How do you plan on dealing with these issues moving forward?
I plan on not getting into any kind of relationship, period. Any kind of, I'm gonna have friends. Don't get me wrong. I'm gonna have friends, but as sexual relationships and stuff like that, it's out. I'm, how do I put this? And I don't want this to sound too forward. I cannot do anything anyways. And so, it's just the thing about it is that I don't plan, at my age, I don't plan on, having a sexual, close relationship with any females anymore.
So, right, we're in limited time, so I want to make sure I get to the contract psychological evaluation. Do you remember meeting with Dr. Mom?
What's that?
Do you remember meeting with Dr. Mom?
Yeah, I do.
Any comments you have about that report?
No, actually, she was pretty thorough. She was really friendly. I mean, she was very patient, There was, several times I had to ask her to repeat, and she did, She was, very professional, I thought.
Okay. You noted at the time that you were taking some medications. Are you still on those same medications?
Yes, I am. It's Depakote, divaric sodium. Yeah, I still take 1,000 in the morning, 1,000 at night. I plan on staying on that the
That's my
rest of
next
my
question.
life. Because I notice when I start taking off my chemical brain chemical starts.
Were you taking those medications when the sexual assault occurred?
No, I fell apart. I fell apart and I stopped everything. I was stopping. I mean, I even stopped, the therapy, and I started, I hadn't went to work for a few days. So I had to pull myself back together, and I at least did pull myself back together to get the place.
So do you see going off of your medications as a risk?
Yes, I do see that, me not taking my medications as a risk. And that would be, when you ask what a risk is, that's a risk.
And I appreciate your insight, right? Because that's part of
Yeah.
this hearing. One of the other things it noted was that you had, quote, thoughts of killing his wife prior to coming to prison, unquote. That's what she said in her report.
Killing who?
You had thoughts of killing your wife, is what it said in the report. And so I was wondering if you could give me insight to that. I'm assuming your
Oh,
ex-wife.
no, that was way, way years back, when I was married, The thing about it is, one of my charges was that assault, was always assaulting, my wife and stuff like this. And I found her, cheating on me 4 different times within a short period of time,
So do you still have those thoughts, sir?
No, I don't. I haven't seen my ex-wife for 20+ years.
Okay. And that's why I'm asking, right? Because that's what
He asked me questions and I was totally honest.
and I appreciate that. But right, so I want to ask so I don't misinterpret anything, right?
Yeah,
And I want to hear what you have to say.
Yeah.
So that's why I'm doing that, right?
okay. Thank
So
you.
it also provided some diagnoses. Do you remember those?
Say that in.
The report provided diagnoses. Do you remember the diagnoses?
Diagnoses. Okay, which ones is that?
Bipolar and alcohol use disorder.
Yeah.
Do you think those are accurate?
Yes.
Okay. And then the recommendations were for ongoing sex offender treatment, ongoing mental health services, and you would benefit from a halfway house. Do you agree with those recommendations?
I do. For the simple fact is that being in here is not beneficial for me in here. For the simple fact is that I'm more productive on the outside. I can go right back to my old job at Serta Mattress. That's what I plan on doing. And my brother even says that he could probably get me hired at his, place of, employment. Yeah,
And then I want to make sure I get to the sex offender assessment because like I said, we're on limited time. So the sex offender assessment, do you remember receiving that, sir?
yes, I do.
Okay. And I'm not going to go into all the specifics of it, but one of the things it recommended was sex offender treatment. Do you think that's accurate? Do you think you need sex offender treatment?
I would hopefully hope that I get back into the aftercare with Vicky Fields, because that's who I plan on getting back into.
So are you saying you would like treatment in the community versus prison? Is that what you're saying?
I would like that.
Would you refuse treatment in the prison?
I would not. I would, be willing for whatever the board decides to do.
All right, sir. Did you have substance use issues on your last parole?
No, I did not. I have not drank any alcohol since I came to prison the very first time. All
right. And then regarding, I noted that I received your attorney's letter. I've reviewed that. And just so you know, I also received your letter and I've reviewed that as well. And the board will have access to it. Okay.
Okay. I was, I sent a copy of the letter to you guys, but I was going to read it. But so I guess I don't have to read it.
I mean, if it's the same letter, I read it in its entirety. So I don't think you need to reread it. If there's something you want to mention to me again, then that's fine. But I've read it in its entirety. The
only thing that I would say that that I did add to this one here is, is that I don't know if they got it down that I have been working at UCI for the last 6 months.
Okay. How's that going?
Been active. What's that?
How's that going?
Oh, I love it.
That's good.
Yeah, I love it. I work at the press shop, I'm the one that does the stickers, the many, many stickers.
For the license or for the cars, right?
No.
You don't.
I'm the one that does like the junior, sheriffs and the, the little stickers that you peel off and that you give to like the sheriffs that you give out,
Gotcha.
like the kids,
Okay.
stuff like that.
Gotcha.
Yeah,
Yes.
but I do when I don't have regular stickers to do, I do the DMV, and I've been doing the 26s, on the DMVs, so the new ones.
Okay. Anything else you want to highlight, sir?
No, actually, like I said, I was going to read the letter. I did mention, a few of the things like, I didn't know what to expect. I mean, I'm so nervous. I just didn't know what to expect. So I just tried to be as prepared possible. I know I should remember all this, but my, being stressed, I use a breathing technique and it helps me calm me down,
Is that something you've learned in one of your treatment programs?
Yes. Yes.
That's good, sir. All right, sir, those are all of my questions from here. I'm a hearing officer. I make recommendations. The board ultimately decides. They're made up of 5 members. 3 of them have to come to one decision. That's the decision of the board. You should get that in writing within 2 to 4 weeks.
Okay, thank
Your
you.
family members, your friends, anyone listening to this hearing via video can go to bop.utah.gov. As soon as we have that decision, we post it on our website. Just so you know, it's not immediate. It still takes some time, but it's faster on the website than the mail, so they can look that up and tell you what that decision is while you're waiting for your written decision. Do you have any closing comments or questions for myself or for the board, sir?
No, I don't. The only thing I would, if they do decide to give me, another chance at parole, I would like to go to the halfway house. Even though I've got, family and stuff like that, that would help me get into a place, I've already decided to go to a halfway house for stabilization. That way I can, get everything taken care of, get back, on my medications. I can get it, have a constructive, environment, and get everything in a row before I just jump out into a place again. You see what I'm saying?
Yes.
And I just want to, that way I can get get a job. I can get everything taken care of. My medical, my mental health, my therapy, everything, put in place. Plus, I've got to also think about paying, I was assessed a $5,000 fine from, the courts that I've got to also, start, thinking about, because it's building up interest right now. And so it's like, that's something I've got to focus on too.
And like, once again, I'm a hearing officer. I don't know what the board will do, but I've made notes of everything you've said today. I appreciate you coming to this hearing. We'll go ahead and conclude. Thank you.
Hey, thank you very much.
As soon as he tells us we're on the record, okay? All right, we are on the record. Today is the time and place set for a rehearing for Mr. Gabriel Sanchez, offender number 238691. Is that you, sir?
Yeah.
My name is Kelly Perry. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. As is an official proceeding, I do need to swear you in, so if you could please raise your right hand to the best of your ability. Do you swear or affirm that the testimony about to give is the truth, the whole truth, and nothing but the truth?
Yeah.
Okay. Do you mind getting a little closer to the microphone? Want to make sure it's being recorded. I want to make sure I hear you.
Yeah.
Okay. Did you receive 7 days written notice of today's hearing?
Yeah.
Okay, and you can put your hand down.
Yeah.
Okay. Did you receive your blue disclosure packet?
Yeah.
And did you have a chance to review that?
Yeah, I did.
Do you feel prepared to go forward with today's hearing?
Yeah.
Are there any errors or corrections I should know about in that blue disclosure packet before we begin today?
No.
So just to kind of tell you how today's going to go, sir, I'm going to go over procedurally how we got to this hearing. I'm going to ask you for any comments about your offenses. We'll go over the contract psychological evaluation. We'll go over if you were released, what that would look like. And then at the end of the hearing, if you have further questions or comments, let me know, okay? So it looks like you had a hearing after a parole violation hearing, original hearing, where a rehearing was ordered for now, with a note that you were expected to keep up your recent disciplinary free conduct, that you should continue to refrain from any disciplinary violations. It also returned case 2219-02135 to the court to determine restitution. A contract psychological and cognitive behavioral therapy were also ordered. Does that sound procedurally correct, sir?
Yeah.
All right, can you give me, tell me any comments you have about your offenses and any insights you have into your risks?
Comments? It was a mistake, if that's what you mean. Or do you,
So when you say it was a mistake, what do you mean by that?
I made a mistake. That was it.
So why do you, because I show assaults, right, and kidnapping, where kids were present. So tell me a little bit more what you mean by a mistake.
I didn't know about just my whole mentality at the time.
So what was your mentality at the time?
Not a street mentality of just not caring about my own future, really.
So do you think that's the same now? Do you think so why do you think things are different?
Corrections time.
Meaning being in prison?
Yeah.
Do you have any contact with any of your victims?
No.
Is there anything you'd like to say about victim impact or victim empathy, sir?
No.
So, sir, obviously some of these are violent offenses, right?
Yeah.
Do you see that as an issue moving forward?
Not anymore.
And why is that?
I don't really get in trouble anymore.
And why do you think that is?
Uh, like I said, it took time, corrections, 6 years,
Do you think you have an anger issue?
pass, yeah.
All right, one of the things that I want to make sure we get to in this hearing is the contract psychological. Do you remember meeting with Dr. Mom? What'd you think of the report?
It was fine.
Anything in particular that you liked, didn't like?
No, it was fine.
Well, there's certain things I'm gonna go over and get your input, right? Because all I have is that report, and I want to hear what you have to say, right? So it said that you report your assaults are mainly self-defense. That you report that you were, quote, doing stuff with food, so he had to stab them. He said he had to do it to make it stop. It's the way to make it stop in prison. Can you elaborate on that a little bit for me?
I took stuff into my own hands out there. But that's how. It was a different time with the mentality. It was what I believed at the time. That's why I think the question was if I got in trouble. I think I can't remember. But it was just wrong, really. At the time, that's just what my mentality was at the time.
Okay. And I appreciate your insight, right? Because I'm just trying to hear what you have to say.
Thank you.
It noted at the time of the report that you were taking Seroquel. Are you still taking that?
Yeah,
And that it was forced medication. Is it still forced medication?
I think that's what they said it was.
Okay.
But
Why is it do you not want to take it?
no, it's mental health. That's just they suggest it's suggestive.
What do you mean it's suggestive?
With therapy and the mental health team. That's what it's just suggestive. It's not really forced. They just asked me if it was forced. They said it was forced, but they let me refuse it or not refuse it if I want to.
So do you want to take it?
Oh, I take it.
But do you want to take it?
Yeah, I take it.
Do you know when your forced medication order is up?
I don't know. I'm not sure. I just take it anyway, whether it's forced or not. But I think it's optional, honestly.
And I'm just making notes of everything we're talking about. I don't want you to think I'm not listening.
Okay, fine.
Do you want to continue it if paroled?
Yeah.
Were you on that medication when you committed your offenses?
Oh, I think I was off it.
You were off of it?
Yeah.
Okay. All right, sir. So obviously Dr. Mom provided some diagnoses. It noted that you have ongoing issues with aggression. First of all, do you think the diagnoses were correct?
Yeah.
Okay. Do you think you have ongoing issues with aggression?
Sometimes.
What causes your aggression?
I let negativity. I think negative things, and then I fall into being negative with what's around me.
Can you say that a little bit louder?
I fall into like negativity, even though it's not present with everyone else around me.
Is there anything that triggers your negativity or?
Just negativity.
Okay.
Even when it's not there, sometimes it's just in my own head, you know?
So when you say even if it's not there, meaning
It's,
you're seeing something that's not there? I'm not trying to put words in your mouth. I'm just trying to make sure I understand, sir.
yeah, you're fine. I'm seeing things that are, just perceiving it negative.
All right, sir. The recommendations were that you need ongoing mental health treatment, that you should be willing to take your medications, and that you eventually need substance use treatment. Do you think those recommendations are accurate?
Treatment as in
Substance use treatment.
like, UAs.
No, like treatment for, because she diagnosed you with having cocaine use disorder, alcohol use disorder, and cannabis use disorder. So treatment for those, either residential or outpatient, some kind of treatment for dealing with your substance use issues.
I don't really necessarily think that's true because parole is enough for.
You don't think you need it?
I don't think I need like a program or anything like that. I think UAs were enough for me on parole.
So why don't you think you need any programming? Because it sounds like it's not just substance use. You're just saying, I don't need any programming at all.
Yeah.
Is that right?
Yeah, I don't really. I just came to the penitentiary. I don't go to programming.
And so is it because, have you taken programming before?
I have. It's the UAs were the parole and the UAs were enough for not like for enough to keep me supervised.
Disciplinaries?
No,
Do you know if you're going to have any criminal charges as a result of them?
I don't think so.
Also, sir, the institutional progress report noted some behavior towards some of the officers where you were requesting sexual acts. Can you tell me about that?
I think it was not intentional.
So and I'm having a little trouble understanding that. So how could it be not intentional?
They perceived it as sexual assault, but I wasn't trying to
Okay.
have any sexual relations with them.
Okay. And so I would note the board received a letter of support. I reviewed that, okay?
Yeah.
In regards to release funds, I show you'd like to live with your grandmother in Salt Lake, and I didn't see what you would like to do for work. Is that still the plan? You want to live with your grandmother?
Yeah. Yeah.
Do you have plans for work or treatment? It sounds like you don't want treatment.
Not really treat except for supervised release. Thought that was enough. And parole and like I was gonna get disability
Okay.
from mental health.
Do you already have you already received it in the past?
Yeah.
All right, so those are all my questions. From here, I'm a hearing officer. I make recommendations. The board ultimately decides. They're made up of 5 members. 3 of them have to come to one decision. That's the decision of the board. You should get that in writing within 2 to 4 weeks. Your family members, your friends, anyone listening to this hearing via video can go to bop.utah.gov. As soon as we have the decision, we post on our website. It still takes some time, just so you know, it's not immediate, but someone can look up that decision and tell you what it is. I know your guideline, sir, is 27 months or October 6, 2024. Obviously that's passed, right? So the board ultimately decides. The CCJJ, Commission on Criminal Justice and Juveniles, issued them. They're based on a number of factors, obviously one of them being your offenses, but the board decides. So they can go past that, and they have. The expiration of your sentence, meaning the longest time the board could have jurisdiction over you, assuming no other offenses, is May 22nd, 2028. Do you have any closing comments or questions for myself or for the board?
No, I know.
Okay, well, I appreciate you attending this hearing. We'll go ahead and conclude. Thank you so much.
Thank you.
All right, we are on the record. Today's the time and place set for a rescission hearing for Mr. Kyle Wooten, offender number 222706. Is that you, sir?
Yes.
My name is Kelly Perry. I'm a hearing officer with the Board of Pardons and Parole, and I'll be conducting your hearing today. This is an official proceeding. I do need to swear you in, so if you could please raise your right hand. Do you swear or affirm that the testimony about to give is the truth, the whole truth, and nothing but the truth?
Yes.
Okay. Did you receive 7 days written notice of today's hearing?
Yes.
Did you receive your blue disclosure packet?
Yes.
And did you have a chance to review that?
Yeah.
Do you feel prepared to go forward with today's hearing?
Yes.
Are there any errors or corrections I should know about in that blue disclosure packet before we begin today?
No.
Okay. So just to kind of tell you how today's going to go, sir, this is a rescission hearing, very condensed, shortened hearing. I basically have a few questions, the reason for the rescission itself, and then I'll give you the final word, okay? I'll also be making notes the whole time. I don't want you to think I'm not listening, okay?
Okay.
So it looks like you had a rescission hearing after a parole violation hearing where parole was granted for September 24th, 2024, with the contingency of no disciplinaries and MHSS, the Mental Health Halfway House. And the special attention of August of this year, it was noted that you were not recommended the program. You had been in a serious altercation, and they provided the case number for that. The Mental Health Halfway House screening team was screening was attached, which noted they had a qualifying diagnosis and you were on involuntary medications. The board rescinded your parole date and scheduled this rescission hearing. Does that sound procedurally correct, sir?
Yeah.
Okay. So, how's your mental health currently?
Good.
Okay. Are you still on mental or involuntary medications?
Yeah.
Okay. And so why is it involuntary?
I don't know. But I'm taking a class to get off of it.
Okay. Do you want to take your medication?
I do take my medication. It's just they prescribed me that.
So what medications are you currently taking?
Zoloft and the Invega is the involuntary.
Invega is the involuntary one. Do you want to take Invega?
No,
Okay. And why not?
because I don't need it.
And I'm just making notes of everything we're talking about, okay?
Yeah.
Kind of going over your offenses. I'm not going to go over them individually, but it seems like substance use, has that been an issue in the past?
Some, not really.
Okay.
Alcohol is the main one.
What's your current attitude towards alcohol?
It's good now that we have a medical marijuana program.
So, and I'm just trying to make sure I understand. So are you saying you want to use alcohol, or are you saying now that there's medical marijuana, that's what you want to use instead?
Well, yeah, I'm saying it would be like parole would be a lot easier because I don't want to have to use. I have a reason for my meds.
So I guess I'm still kind of confused. So are you saying that you want to use alcohol?
No, I would like to use alcohol. Yeah.
Okay. Are you currently in any you mentioned a class you were taking, or any other programming that you're taking right now?
No.
Is there any programming that you think you need or that would be helpful for you?
Well, right now I'm hoping for a chance to get on my feet because I'm homeless. So I don't have anywhere. That's why a program would be good for me because they give me a place to live and I get a job ahead and be able to get by for a little bit.
What do you think of MHSS, the Mental Health Halfway House?
It's good, but I would like a different one because it says any other mental health program. I was hoping for Nuke.
Okay. So is there any reason why, and that's fine, but I'm just wondering, is there any reason why you don't like MHSS?
It's just strict. Just like real strict.
Sir, I do show some disciplinary incidents. I show many actually, and I showed the last one is July this year for assault. Can you tell me about that?
Yeah, that was in like he was yelling.
Who was yelling?
Justin, the other guy.
Okay, somebody else, was it like a cellmate or?
It was a cellmate.
Okay. And then what happened?
Like, he was yelling. I asked him, "Can you please calm down?" And cause like he was waking me up in the middle of the night, just yelling a couple nights, and I was just kind of tired. I was laying down, and I told him if he could stop, please. And then he just like kept yelling. I was like, "Hey, hey," trying to get his attention, and he kept yelling. So then I got up after I called him with a name, and I started fighting him because he kept on yelling, and he was like, "What?" Got in a fighting posture.
So you assaulted him?
Yeah.
Was he taken to the hospital?
No.
Do you know if he was injured?
No, he was fine.
Okay. Do you think you could have handled it differently?
Yeah, just not care, I guess, or leave the cell.
All right, sir. Those are all of my questions. From here, I'm a hearing officer. I make recommendations. The board ultimately decides. They're made up of 5 members. 3 of them have to come to one decision. That's the decision of the board. You should get that in writing within 2 to 4 weeks.
Yeah.
Your family members, your friends, anyone listening to this hearing via video can go to bop.utah.gov. Since we have the decision we posted on our website, still takes some time, but someone can look that decision up for
Okay.
you, okay?
Yeah.
I show the expiration of your sentence, meaning the longest time the board could have jurisdiction over you is June 20th, 2032. Do you have any closing comments or questions for myself or for the board, sir?
For the interstate compact form, how do I go about that?
So if you're given a parole date, talk to your case manager. There's a fee, I believe it's about $50. There's a waiting period because obviously it has to get approval from that state, approval from our state, so it has to be approved. So where are you thinking of going, sir?
Cali.
Do you have family there? Or?
Yeah.
Can you give me you don't have to give me an address. This is being live streamed, but what town are you planning on moving to?
I don't know exactly what town they're in. I think it's Fresno,
Okay.
but I think their prison's Pelican Bay.
And so is it, you said it was a family member or is it that you would live with?
Yeah, my uncle.
Okay. Do you have work out there as well?
Well, yeah, they own a business.
So I would just suggest if you are that is something that you would like to look into if you get a parole date, to start immediately talking to your case manager to fill that application out, because there is a time for has to get approved and everything. And like I said, the fee.
Right. What do they approve exactly?
So they have to approve this. So our state has to approve it. The other state has to accept it, right? They have to accept that you're coming to that state as a
Right.
parolee.
Right.
Probably have to look into the address. Like I said, I don't want you to give it to me. It's being live streamed, but it's a process, right? So if given a parole date, I would start immediately getting that paperwork filled out, okay?
Oh, okay.
Any other closing comments or questions?
No, that's all.
Okay, well, I appreciate you attending the hearing. We'll go ahead and conclude, okay?
All right.
All right, we are on the record. Today is the time and place set for a rehearing for Mr. Emmanuel Hill, offender number 253117. Is that you, sir?
Yes, it is.
My name is Kelly Perry. I'm a hearing officer with the Board of Pardons and Parole, and I'll be conducting your hearing today. As is an official proceeding, I do need to swear you in, so if you could please raise your right hand. Do you swear or affirm that the testimony about to give is the truth, the whole truth, and nothing but the truth?
I do.
Did you receive 7 days written notice of today's hearing?
I did.
Did you receive your plea disclosure packet?
Yes,
And did you have a chance to review that?
I did.
Do you feel prepared to go forward with today's hearing?
Yeah, there's a few things in there that I wanted to discuss, but other than that, yeah.
Okay, tell me about those things that you want to discuss.
I know that I was conditioned by the Board of Pardons to not receive any disciplinaries. I know there's a pending write-up in there that I'm currently fighting because, well, they had now just, they said I was guilty, but then they prefaced it by saying that I was assaulted, but because I got up and defended myself, that counted as mutual combat. I still have the injury. Had I not, I spent 19 days in the hospital because I let the guy hit me so much. And I grabbed him by the shirt and let him punch me 4 more times, and then I couldn't do it no more. You know, I almost died from this injury, from
I'm so sorry.
internal bleeding and going down into my throat. So I just was
So what was your injuries?
a hematoma of the face. It was a traumatic hematoma. So it was a traumatic injury. So this black on my eye has been here for 2 months and it might be permanent. They had to cut my face open, and I got back and they had said they found me guilty on the write-up, but at the same time, they're telling us, you as people have the right to defend yourselves. And had I defended myself sooner and been able to, I probably wouldn't have almost died in the hospital, you know? So they had to drive code in the ambulance about 140 miles an hour because I stopped breathing in the ambulance. But I just wanted the board to know that that is the only write-up I have, and a negative C note for talking through the gun port. Somebody came up to ask a question and I didn't know I couldn't talk through. I didn't touch it, but I talked through it. Other than that, that's what I have right now. And as you can see, I still have the injuries on my face and it's been 2 months. It's supposed to be going a month, but that's just what I wanted to go over.
And I appreciate you telling me that, sir. So thank you for letting me know, okay? Any other comments about the blue disclosure packet?
No, other than that, the substance abuse, I know I read the substance abuse assessment or whatever, I think that's what it's called. They said they were gonna come see me to do it. Nobody came and see me. I did participate in the mental health evaluation. I did do that. There's a couple things on there that they never approached me or signed me up for, so they didn't get them done in time. But other than that, I've been following the requirements pretty closely, been taking my meds every day. But that's, yeah, I really wanted to just touch on the write-up because I was like, yeah, you know.
And I would note that I do see the facial injury
It's
of
been
what
like this
you
for
were.
2 months, you know, and it's probably not gonna go away. It's a traumatic injury. Sorry to interrupt.
No, it's okay. I'm asking for comments, so I appreciate your insight, right? So this happened 2 months ago, you said?
This happened on August 4th. And I spent about 19 to 20 days in the hospital. I actually had to go back and have an emergency surgery because the hematoma was pressing on the nerve in my eye. So I had an overnight surgery. And, you know, I spent multiple days in the hospital and the other guy didn't even get a cut on his face.
Okay.
You know, so it notes in the blue disclosure packet that I was sitting down and an inmate assaulted me. And then from there, it says, oh, then he got up and had mutual combat. And I said, well, you can't say that somebody assaulted me and then it's mutual combat, you know, while I'm sitting down, you know, it wasn't mutual. I stopped and I went until he stopped to protect myself. And I guess because I wouldn't tell on the person, they found it prudent to write me up or whatever. I couldn't, you know what I mean? And risk more retaliation from the person. So they went back after a day and reviewed the camera and was like, oh, since he didn't tell us, we're going to write him up. Or regardless if that's the policy, I just, you know, I felt really confused about that. And then my case manager did write that, you know, it was, you know, that's why I'm repeating myself.
You're fine.
I
And
really tried hard not to get any write-ups to make sure I'd be okay for the board, and I tried to follow it. And then that one really, like, you know, so I have this permanent injury on my face. My face might be like this forever. So,
okay.
you know, and then
All right, sir. Well, just to tell you how today's going to go, I'm going to go over procedurally how we got to this hearing. I'll ask you if you have any comment about your offense. We're going to go over that contract psychological.
Okay.
We'll go over if you were released, what that would look like. And then I'll give you the final word, of course. I'll also be making notes the whole time. I don't want you to think I'm not listening, okay?
okay.
So it looks like you had an original hearing. A rehearing was ordered for now with that contract psychological evaluation, which we'll go over today, okay? Do you have any comments about your offense, sir, for which you're incarcerated?
Yeah, I have some mixed reactions. I feel like compared to what's happened to me in prison since I've been here, it wasn't really, like, the punishment didn't really fit the crime. You know, and it tears me up because, like, I came here and, you know, it was a hard situation for me, and I get that you gotta draw a line at some point. But I've grasped the fact that I'm over my matrix by a lot. And you know what I mean? Like, and every time I'm come back, like, you know, it doesn't really fit. You know what I mean? Like, I don't personally think it fits. I'm not trying to downplay my crime. I know I committed a crime. But right now, as much time as I've been in here or as much time I've done on my matrix, I feel like it's being a little unjust to me. My crime is not being downplayed, just the punishment is, it's getting a little to where it's like, where I'm like, okay, is this really fair? I know last time I came, I said I was grateful that I came to prison to learn a few things, but my reaction, my mental health is drastically changed after this, you know?
Okay.
So this has changed my mind because I'm like, I look in the mirror and I'm like, I didn't deserve that, you know? You know what I mean? And I get it, it's prison, but at the end of the day, it changed your mind. And it really messed me up to like almost die in that ambulance, you know, it really messed me up. Like, you know, it's hard to talk about because I had to have the people in the ambulance play some music just to chill me out. Cause, you know, like that's just my reaction to it. I don't think it was deserved.
And I am sorry to hear about what you went through, sir, okay? And I appreciate you telling me about it, okay? I want to make sure I get to that evaluation by Dr. Mom.
Yeah.
Do you remember meeting with Dr. Mom?
You,
What'd you think of her report?
I trust her.
Okay. Anything in particular you liked, didn't like about it?
No, she was very like straightforward with me. You know, she remembered me from when I was a kid in the RISE program.
You noted that in the report.
Knew me, so it was easy to talk to her. I appreciate actually them using Care Mom. She was really easy to talk to, and she knew how to work with me a little bit, you know, like just touch on things. She wasn't too aggressive. She wasn't, I say robotic when you sound like you're reading from a script. It doesn't sound like a genuine, you know, from a social worker perspective. I don't mind. I don't like talking to real therapists that sound like they're reading from like a script because it doesn't, to me, it just seems like, you know, it's like, oh, it seems, it's not easy for me to talk to people like that, but she was great.
Good, that's good, sir. It noted that you were on some medications. Are you still on those same medications, sir?
Yes, I took them today.
Do you like them, not like them?
I like them. They help.
Do you plan on continuing them if moving forward, or if you're paroled, I should say?
Yes, there's a lot more stress for me on the streets, just regardless, so I tend to change them a little bit, but I do plan on continuing them.
Okay. All right, sir. It provided some diagnoses. Did you agree with those diagnoses?
I haven't had a chance to read them.
Oh, okay. So her diagnoses, and I'm just saying them, not trying to be rude, I'm just going over them to see your insight, okay? Or what you think of them, right? So it said bipolar, other specified trauma and stress-related disorder, PTSD, post-traumatic stress disorder, unspecified neurodevelopmental disorder with mild cognitive deficits, unspecified personality disorder, with paranoid and narcissistic traits. What do you think of those, sir?
I want to say the narcissistic traits. I care too much about people more than myself. I wouldn't agree with that. Maybe back in the day, a little bit I used to, but I don't agree with the fact with being a narcissist. I help too many. I care more about people than I do myself, and I think that's the opposite of a narcissist. You
What
know,
about the other one, sir?
I agree with those. The narcissistic one, I can't really take that one in because that's just not me.
Okay.
You know,
And it
but-
could be, you know, it's with the unspecified personality disorder, it gave different types of what it could be, so it might not have been specifically the narcissistic
Okay.
traits. Okay. In regard to the recommendations, it noted that you have a long history of mental health interventions, and that you've had some trauma, and the report went over that. And it noted that you need a stable placement, so that you can engage in trauma-informed therapy.
Yeah.
That you would benefit from intensive outpatient to address your mental health needs, and DBT was suggested. that you need ongoing medication management and a supported living environment. What do you think of those recommendations, sir?
Sure, that's what she told me in the evaluation that I needed. I agree.
Okay.
I think we kind of agreed on the fact that most of my issues have come from being homeless on the streets. And so just definitely we agreed just a stable place. She told me that I wasn't a risk to the community, more or less a risk to myself when I'm homeless. And I think I agree with that. She was, you know what I mean?
Okay.
She didn't, I know I have, a past with admitted substance abuse, but she said that wasn't an issue because.
And she didn't diagnose you as
Of course.
such.
Yeah, I know she didn't. She didn't because, and I told her about my past. I was very honest, but going forward, and I want to be honest with the board, I used to have an issue with substances. And that is what played into the issues that I was having on the streets, was just staying up and using methamphetamine. But now, since it's been 3 or 4 years since I've used, she didn't see it as an ongoing issue.
Okay.
But I want to be honest with the board, you know what I mean, even if it's not in there.
And I'm asking you for your insight, so I appreciate that,
Of
sir.
course.
All right, sir. So you said that you don't see it as an issue moving forward, substance use. Okay. How would you describe your mental health currently, sir?
I think it's pretty stable. Just little depression here and there, just from
Was that something you're interested in then? Okay.
anything really. Just, and I'm not really picky. I just want to try something different. So
And it sounds like that might help you maybe save up and then get your own place.
I have disability. I receive Social Security. So
So you have disability.
yeah. So income's not a problem. I just have to turn it back on.
Okay.
I have survivor benefits and stuff like that.
Okay. But maybe that health boy house just kind of as a transition might be,
Yeah.
and like I said, it deals with mental health related needs, therapy, those kind of things.
Yeah.
Okay. All right, sir. Those are all of my questions. From here, I'm a hearing officer. I make recommendations. The board ultimately decides. They're made up of 5 members. 3 of them have to come to one decision. That's the decision of the board. You should get that in writing within 2 to 4 weeks.
Okay.
Anyone listening to this hearing via video can go to bop.utah.gov. As soon as we have the decision, we post on our website. Obviously, you can have someone look up that decision while you're waiting for the written one. Still takes some time, not immediate, but it's faster on the website than the mail, obviously.
Okay.
You noted, and you are correct, that your guideline has passed, but the board ultimately decides what happens moving forward. I show the expiration of your sentence, meaning the longest time the board could have jurisdiction over you, assuming no other offenses, is, February 16th, 2028. Do you have any closing comments or questions for myself or for the board?
No, I would like personally out of this to just have the board just really evaluate if the punishment so far does fit my crime. You know, I'm not criticizing the board in any way, but the stuff that's happened to me in prison so far has been pretty traumatic for me. And I think that I've kind of learned my lesson in a way. I'm not gonna downplay my crime. I shouldn't have committed the crime. But at the time I was not in a very good state, and now I am. But I'm just experiencing a lot more trauma being here. And it's not really teaching me a lesson or anything like that. It's not teaching me in the way that you don't, with somebody that's had trauma and pain, adding pain to that doesn't really, and I'm not saying that the prison or it's the people here, a lot of the people here I don't mesh with because I'm not that type of person, that type of, I'm here with people that have committed murders and stuff like that. And I get it, it's prison, but it's not really working in terms of like, it's just adding a lot more pain for me. But that's just what I wanted to say. I know last time I came, I said it's teaching me well, but in those short period of 5 months, I've gone from that to, and it's in no way the board's fault or the prison's fault. I just need to get out of here. It's really hurting me
Okay.
right now at the moment, but that's all I wanted to say.
Well, I appreciate all of your comments today, sir. I've made notes of all of them. We'll go ahead and conclude. Thank you so much.
Did anybody happen to catch what his name was? So right now I'm adding all the names of the individuals that came on today. I'm adding it onto the description just in case anybody wants to pull them up while you guys are watching. I wonder what happened to his face. I mean, obviously it looks like somebody tried to put something in his face. All right, so I'll try to figure out right now as soon as I'm not sure if you guys were able to hear my wife, but that was my wife in the background. What do you guys think this guy did?
All right, we are on the record. Today is the time and place set for a rehearing for Mr. Leon Boone, offender number 177817. Is that you, sir?
Yes.
My name is Kelly Perry. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today.
Okay.
As is an official proceeding, I do need to swear you in, so if you could please raise your right hand to the best of your ability. Do you swear or affirm that the testimony about to give is the truth, the whole truth, and nothing but the truth?
I do.
Did you receive 7 days written notice of today's hearing, sir?
Yes.
Did you receive your blue disclosure packet?
Yes.
And did you have a chance to review that?
I did.
Do you feel prepared to go forward with today's hearing?
Yes.
Okay. Are there any errors or corrections I should know about in that blue disclosure packet before we begin today?
No.
So just to kind of tell you how today's going to go, sir, I'm going to go over procedurally how we got to this hearing. I'm going to ask you if you have any comment about your offense. I'll go over the sex offender assessment, any background questions I have, institutional behavior and programming, if you were released, what that would look like. And then at the end of the hearing, if you have further questions or comments, to let me know, okay?
Okay.
Okay. So it looks like a special attention happened in January of 2023. APMP noted they searched your phone and found you had several YouTube videos for sexual gratification, excuse me. The board noted the violation and continued you on parole. Jail room request was approved in February of this year. At the parole violation hearing in June of this year, the board accepted your admission to allegations 2, 5, 6, and 8. And your no contest plea to allegations 7 and denials to allegations 1, 3, and 4. The board revoked your parole and scheduled this rehearing with a sex offender assessment. Is that correct, sir, procedurally?
Yes.
Okay. All right, sir. In regards to your original offense for which you are incarcerated, do you have any comments about your offense?
No.
Do you have any insight into why or your risks for your offense? Why your offense occurred? What do you think your risks are?
At the time, I caught my wife and my little brother in bed together, and I just lost control of my emotions for a while. So I was depressed and.
Okay. And so obviously this is, sexual assault of children, right? So that's very concerning. And how do you plan on dealing with your risks moving forward? You mentioned depression. How do you,
Yeah, I've been doing good. I've been taking therapy, I graduated from the program in 2020. And I've been taking therapy and I'm so sick right now. I'm terminally ill, so that's the farthest thing from my mind now.
can you, and I appreciate you talking to me about that. Can you tell me about, the report noted some, I think, cancer, is that right, sir?
Yeah, I have, excuse me. I have stage 4 lung cancer and I also have severe Parkinson's.
And you said you were given a terminal diagnosis, is
Yeah.
that right? Okay. And I'm not asking to be rude, I'm just making sure I'm understanding correctly, okay? Okay, sir. So I want to make sure I get to the sex offender assessment. That's kind of part of the, one of the main reasons for this hearing, right? Do you remember that assessment being completed?
Yeah, we just did it Friday.
Okay. Any comments you have about the assessment before I ask you about specifics?
No.
So, it did note the Parkinson's. It also assessed you with your risk level.
Mhm.
It provided a above average risk. It noted that, that they were recommending, the sex offender treatment program was recommending the building resilience portion of the sex offender treatment program, which would be about 12 weeks of group and individual therapy. It noted that you had repeatedly engaged in accessing adult pornography through an electronic device, and and that you had declining health. What do you think about completing that program?
Well, I got severe Parkinson's and I can't write. I've been locked up for 6 months and haven't even been able to write a letter home. If I could at least get to a halfway house and do it there where I could get because my sister has power of attorney for me, she'd come and help me.
Okay. And sir, and I don't want to be dismissive of your health issues at all, okay? But going over your paroles, you've had 3 paroles, right? And this issue has continued. So appearing to access pornography and being evasive.
Can I explain what happened? That was an old Facebook page from when I came back the first time. It was an old Facebook page and I tried to explain that to my people.
Sir,
Yeah, I know that, I should have been more diligent, but some of that was for self-gratification. But like I said, and it was an old Facebook account. And every time that he would check my phone, an old Facebook account would come up.
so, and I'm just gonna let you know what I have, right? Because I want to hear what you have to say. It said that they asked you about that, and you told them it was a new phone, so they asked you how it could possibly be a Facebook thing, if it was a new phone. And my other concern is on your last parole that you went to a residence where your 3-year-old granddaughter was living.
I
What-
didn't go to the house. I stayed in the car.
Do you see a concern with that, though?
Where I stayed in the car, I was but I didn't have any place to stay, so I slept in my car. I didn't go in the house where she was in the house.
Okay.
I stayed in my car on the street.
Is this your sister? Is that her house?
My stepdaughter?
Okay.
And I understand where your concern comes from, but at this point, I mean, and a lot of it is, I was going to say goodbye to my family because like I said, I'm terminal,
When were you given that diagnosis, sir?
in April.
Of this year?
Yeah. Before I came back to prison. Yeah, they referred me to home health and hospice and everything.
You were referred to hospice, is that
Yeah.
what? Do you know, do you have any hospice care already set up?
No, I don't.
Have you looked into any of that or anything?
No, I'm trying to get it in here anyway.
Okay. Where are you currently housed in the prison?
Barefoot.
Okay. All right, sir, were you drinking during your last parole?
No,
Okay, 'cause that's been an issue in the past, right?
no.
No, it's never been an
No,
issue?
no drugs, no alcohol. I did everything I was supposed to on my parole. I went and got the drug and alcohol assessment and I passed that. I went and got the domestic violence, but at the time I just got diagnosed with cancer and my sister came and got me and I went and got it through Blair Counseling, but I didn't have the $150 that he wanted to pay for him to send the evaluation to my PO.
All right, sir. In regards to release plans, I showed that you'd like to go to a halfway house. And you
Yeah.
kind of already mentioned that.
Yeah.
Any other things that you would like the board to know? I don't have any other questions for you. Those are my last questions. I would note you have a life top, right?
Yeah.
As your expiration of sentence. But is there anything else you think the board needs to know in regards to your offense, in regards to moving forward, regards to your risk, anything else the board needs to know?
I'm just hoping that the board will have some compassion and at least just send me to a halfway house. And I'm willing to do all the programming I need to do at the halfway house.
Any other comments, sir?
No.
Well, I appreciate you attending this hearing. We'll go ahead and, I made notes of everything you've said. We'll go ahead and conclude. Thank you, okay?
Okay.
All right, we are on the record. Today is the time and place set for a rehearing for Mr. Chevron Baptiste. Am I saying that correctly, sir?
Javon.
Siobhan, I apologize. Offender number 165192, is that you, sir?
Yes, ma'am.
My name is Kelly Perry. I'm a hearing officer with the Board of Pardons and Parole, and I'll be conducting your hearing today. As this is an official proceeding, I do need to swear you in, so if you could please raise your right hand. Do you swear or affirm that the testimony about to give is the truth, the whole truth, and nothing but the truth?
Yes, ma'am.
Okay. Did you receive 7 days written notice of today's hearing, sir?
Yes.
Did you receive your blue disclosure packet?
Yes.
And did you have a chance to review that?
Yes.
Do you feel prepared to go forward with today's hearing?
Yes, ma'am.
Are there any errors or corrections I should know about in that blue disclosure packet before we begin today?
No, it was the initial packet had quite a few things missing, but with the help of my caseworker, we were able to get that and include it, and then, you know, sent it to the board. And as we send it to the board, then the board sends me a blue copy, so I know for sure. But he even came and gave me a white copy of the board, sending him his copy to, you know, tell me that it is in. It was just some other things that I'm assuming the board would have that weren't in it from past blue packets.
So yeah, so if it's already been disclosed to you in a prior hearing, they're not going to redisclose it. So like, for example, if you've had an original hearing, so they're not going to redisclose your pre-sentence investigation. If you ever need anything, you're welcome to write the board, but anything else that you were concerned about wasn't there?
Oh, no, it was just like just past education and work and stuff that wasn't in this current packet that, you know, like I have it from the old packet,
Okay.
but, you know, and it wasn't in the new packet to, you know, as far as like collectively to make a judgment on based on, you know, in a whole timeline from beginning to end to see what I've been doing to, you know, understand my crime and education as a whole, and you know.
All right, sir. Well, if there's anything that comes up during the hearing that you want to mention, of course, mention that, sir. So just so you know, how today's going to go, we're going to go over procedurally how we got to this hearing. I'm going to ask you if you have any comments about your offense. I'm not going to go over in details, just if you have any comments. We'll go over the sex offender treatment memo. We'll go over any programming, if you were released, what that would look like. And then at the end of the hearing, if you have further questions or comments, to let me know, okay?
Yes, ma'am.
So it looks like you had no rehearing after an original hearing, where rehearing was ordered for now with sex offender treatment memo. And special attention in September of last year, it was noted that restitution in case number 131905494 was converted to civil judgment and referred to the Office of State Debt Collection. Does that sound procedurally correct, sir?
Yeah, I mean, nobody never explained to me like what the transfer. I'm just assuming by the words what it means, but you know, no matter what, it's something that I know I have to pay. You know, even if it is reopened and I have to pay more, I understand where it comes from what I've done.
Okay. Yeah, if you have any questions about that amount or how it's paid to, yeah, then you just.
No.
Okay.
No.
Okay.
It's just I received a bunch of notices to like a change in some procedure or something,
Oh, okay.
and so, you know.
All right, sir, in regards to your offense, do you have any comments for which you are currently incarcerated?
Initially, I'd just like to say, you know, I accept all responsibility for what I've done, and I'm extremely remorseful at what I've done and lifelong continue to do to the victim, because I understand that this is something she's going to live with for the rest of her life. And I've taken this prison time very seriously, and I've not taken the education that's available here and initially in Gunnison or in the county jails that I've been in. everywhere I've been. I've looked to study even way before the SOTP program is available to me. I've studied with people that have took it and passed it from the beginning of my time. And I've went to all the I mean, not all, but as many life skill classes that I can to understand all different aspects of life and how I came to this point to, you know, as a human being, to feel that I could do what I did and understand why and
So kind of give me some insight, and sorry, I didn't mean to interrupt. Try to start, kind of give me some insight. You're talking about you've taken classes, you've been teaching yourself, why you came to this. So give me insight into what you learned about your risks and how you plan on dealing with those issues.
Well, I understand that, you know, so I had to, and I'm going to go through this in the SOTP program deeper, but as a precursor, I understand that I had to start to dig deeper into myself to understand where I came up with these, you know, thinking errors or behaviors, and what I can start to do to try to, you know, cognitively reprogram myself to not have those behaviors just in life as it is, no matter where I am in prison or let back into society, and prepare myself for SOTP program, and one day maybe to re-enter society. And I mean, anger management, thinking errors, thinking for change, communications, critical thinking, and understanding what to do at the you know, at the split second, and all of these different things that they constantly have classes in here for. And I've taken it to a point where, like, with repetition, I mean, you could see, and this is one of the things I was telling you, like, it's in my blue packet, where you could see, like, some of the classes, I just take them over and over. And I had teachers tell me, like, why are you coming to the same class? And I'm like, I really want to get it. And I really want to understand. I want to understand better than, you know, because this is for me, it's for my life, you know, and the people that I'm around. And, you know, I understand that as a older person, to a point of, I don't need to be around anybody younger than 40s. You know, I've gone over certain things, like what, you know, in the future, what situations would I have to be around a minor, and there's none. I have no kids, and at this age, I don't plan to going forward, and just all of these different things that will lead me to a possible successful reintegration into society. I've studied a lot. I've taken an extra effort to study quite a bit of financial literacy, because I also understand the financial stability in a person, how that affects other things. Because I don't have alcohol or drug problems, but when I could see how financial instability led me to feel certain ways, the same way where, like, drugs could make people feel a certain way to excuse themselves to do certain things, or to feel a certain way, or to be in a certain mindset. So I've even studied financial literacy to the point where I'm helping other people, which is one of my jobs, which, again, my whole job and or volunteer history while I've been in prison isn't in my new blue packet, which, like I said, I studied so much. I started getting jobs in the library and to help people, and then onto I worked in the education corridor in Gunnison for a couple of years, because I wanted to further my education and help people with their education. And that's something I kind of hope to plan to do in upon release is help others like myself, you know, in certain education levels and stuff like that. Because, you know, I just learned a lot. I don't know. I study a lot, and you know, I think a lot about what I've done, and
That's,
you know,
that's good, sir. And I appreciate you.
sorry, I don't mean to go
No,
on
no.
so.
No, I appreciate you telling me the classes that you've taken, your insights, right? Regarding children, obviously, given your offense, the board decides. But if you are paroled, I think it is very likely that you have what are called sex offender A conditions, which mean no contact with children, which it sounds like you've already thought would be advantageous not to be around children, which is very good, sir. All right, so I want to make sure I get to the sex offender treatment memo. Do you remember receiving that, sir?
The which
The sex offender treatment, it might have been
To-
called summary or
to
memo.
accepted into the sex offender program?
I have that, yeah, not that, this is the actual memo itself.
Yeah, I think the
Like
initial
where it
memo.
assesses your risk and everything, your risk level.
No, so I just took a reassessment
Okay.
and they didn't get that back to me because it just happened about a week ago.
So this, okay, so I showed this was completed on September 30th. So,
Yeah,
it's-
okay, okay,
so it sounds, are you saying like you have
of
not?
24?
2024.
Right, so that would be there. So I haven't got a chance, they haven't come back to me
You haven't
and
received
talked
it?
to, no, I haven't received it, and they haven't got a chance to get back to me to talk about it.
Okay, so, sir, because of that, you have two options, completely up to you. Obviously, one of the reasons for this hearing is that memorandum. So because you have not received it prior to this hearing, we can stop this hearing right now and have it continued to a different date. So you can have that memorandum, review it, and and then talk about it at the next hearing. Or we can go forward and I can ask you questions about it and you can waive your right to having received it. What would you like to do, sir?
No, I like to go forward.
So
I
you
like to
waive
go-
your right to having received it?
Yes.
Okay.
Because I know eventually I'm gonna get a copy of it and things will proceed however, without me having seen it or
Okay.
what have you.
So,
I'm cool with waiving my right to have it in front of me.
okay, so I'm going to go over some specifics about it. It noted that you enrolled in sex offender pre-treatment on February 28, 2022, and you completed that portion of the sex offender treatment program.
The pre?
Yes, the pre.
Mhm.
It noted that you were removed from the core program waitlist on March 7, 2023 for, quote, repeatedly failing to complete learning experiences, unquote. That you were readmitted to the waitlist on July 27th of 2023, but on October 31st, 2023, you were removed from the list for being on several probations and causing negative situations. You were available to be placed on the sex offender treatment waitlist again on January 31st, 2024, but there was no record of you reapplying. So can you kind of tell me about that? What happened with not going back into the program?
The mix up with them not reapplying me, so when you get removed, they put you in a different part of a different building, and I'm supposed to write to come back. They brought me back in the program before I wrote them, and as I'm back, then they told me you still have a letter. I was in the program, Resolve, and they said you still have to write a letter. So I wrote a letter, and I think I had to write it twice because the first one got lost. And I mean, and ultimately, like you could see here, I wouldn't have this acceptance accepted to the tracking list. They wouldn't issue this unless they officially get the letter, because they have to have an official record of you asking to come back and explaining certain things.
Do you know
So-
when you'll start it then, sir?
Okay, so as far as I've seen how things have been going now, when I got assessed, the last assessment that I have, usually once you get that assessment, not too long after that, I would start with a therapist, which other program leaders in my section have kind of come tell me, like they heard them talking about I I might be going with this therapist, or, you know, and
So it sounds like soon.
yes,
Okay.
yes. As far as I know, very soon.
Okay. And I'm making
Very-
notes of everything you're saying. I don't want you to.
Very soon, and since I already completed if I start within a month or two, which quite a few groups are going to start within a month or two, and I should most likely be in one of them. And then each group takes, I mean, you would notice, but it has been taken anywhere from 6 to 8 months to complete the core part of it. Also, I'm currently it's in my documentation, plus I sent the board a progress report. I'm in college now. I'm in Davis Tech College, taking business administration.
It's good. When do you finish that, sir?
That I just got them to print me out, which you do not have a copy of this.
And I can have the officer make a copy of it for me.
Great. So the board has this one where it just shows my progress, but I just recently, like yesterday, actually had them print out this one, and up in the corner, it says an estimated completion of April of next year
Okay.
to finish this.
Program.
Yes.
Okay. All right, sir.
First.
One of the other, I want to make sure it gets to the rest of the report. The report also assessed your risk level. It said above average risk. It said due to that risk level, that we're recommending the program, which you've kind of already discussed. And that you completed several life skills classes while being incarcerated. It recommended that you continue to enroll in those classes. Some classes he has yet to complete that are recommended include MRT, Escape Your Prison, and Time Out for Men. What do you think about that, sir?
I'm fine. I always heavily communicate with any casework I have and go over my cap, ask for copies of my cap, and ask them to sign me up for whatever I need, like mandatory, and other stuff that's just available. And with a lot of other gentlemen that might need a class ahead of me, you know, I just get into groups where I can, or classes that is, where I can, because other people might have been needed more. They kind of change things, how instead of us signing up for class, because they notice like people that like are really pro education will sign up for classes, and other guys that might need it even more don't. So they switched it to our caseworker will sign us up, and then when a class comes, they'll just pick.
Who's on that
They
list?
pick who's on the list and stuff like that. But I'm open to getting in to any classes, and the school works with us where if we have other stuff like the SOTP program coming up, where I'm full-time right now in school and I could go half-time, and even they will just let me go half-time on the 2 days that we have to do SOTP. And also the 1 day. They're very flexible because they know a lot of the programming in a way supersedes the college, where college is just as important, but programming might outweigh it by all means.
Okay, sir. And I would note you have no disciplinary violations since January 2023, which is good. What do you think that changes? Why do you think that has been a change? Because you had some disciplinaries right before then, and then since then you had
Yes.
none. So why do you think there's a change
Yeah,
there?
well, partly from being in the Resolve programming and just understanding a heavier structure, and of not to let the small things also get you in trouble. Because I like it to be noted that, you know, not to minimize, but my disciplinaries, they were write-ups, but when you review them, it was smaller fractions of write-ups instead of like the more violent ones or the more serious ones, where mines might have been like I fell asleep during count, and I didn't wake up, and that's like serious, you know, or I pushed a button to talk to an officer when I wasn't supposed to, and that turned to a write-up, communications. But either way, you know, I had people around me that had graduated the program in this Resolve program that could tell me like even the small things matter, and they would give an example to the streets to say, well, you know, if you was in a job and that might be serious with safety hazard, but this is serious too, being 5 minutes late from lunch, you know, it's very serious, you know, because the whole production line could go down. So, you know, just having more structure or closer people to talk to me and teach me different ways of living life.
In regards to release plan, sir, I showed that you'd like to go to a halfway house and work in customer service or telemarketing. Is that still the plan, sir?
Yes.
Okay.
Very much.
All right, so those are all of my questions. From here, I'm a hearing officer. I make recommendations. The board ultimately decides. They're made up of 5 members. 3 of them have to come to one decision. That's the decision of the board. You should get that in writing within 2 to 4 weeks. Your family members or friends, anyone listening to this hearing via video can go to our website, bop.utah.gov. As soon as we have the decision, we post on our website, just so you know it's not immediate. It still takes a while.
Yeah.
Obviously faster on the website than the mail, so someone can look that up for you. I show your guideline was 100 months or October 26, 2021. Obviously, that's passed, and the board ultimately decides. Do you have any closing comments or questions for myself or for the board, sir?
I just I really understand the gravity of my offense, and it's been a long time, and I'm completely a different person. Not just by the time, or by the age, but by the mind frame and understanding, and I'm way more humbled, and you know, ultimately I accept all responsibility for what I've done. You know, and I continue to learn to better myself, and I really like helping people learn to better themselves as well as others have taught me. That's why I try to stay in a teaching position, because I learned the best way to know that you know a subject is if you can teach it. And so, I mean, ultimately, I'm sorry.
All right, sir. Well, I've made notes of everything you've said today. I appreciate you coming to this hearing. We'll go ahead and conclude. Thank you so much.
All right. What?
Oh,
copy?
just hand that to Sergeant Scott or Green, and they'll make a copy. Can you scan and make a copy of that? Thanks, guys.
Will I get back? Okay.
Yeah, they'll just make a copy for the file.
All right. Thank you
Mhm.
for your time.
All right, we are on the record. Today's the time and place set for a rehearing for Mr. William Hart, offender number 56015. Is that you, sir?
Yes.
My name is Kelly Perry. I'm a hearing officer with the Board of Pardons and Parole, and I'll be conducting your hearing today. As this is an official proceeding, I do need to swear you in, so if you could please raise your right hand. Do you swear or affirm that the testimony about to give is the truth, the whole truth, and nothing but the truth?
Yes.
Okay. Did you receive 7 days written notice of today's hearing?
Yes.
Did you receive your blue disclosure packet?
Yes.
Okay. And I would note that you just received that sex offender assessment, right? Okay, so I know that you just reviewed it prior to this hearing, but I still need to afford you two opportunities of how you would like to proceed, okay? And it's totally up to you. Because you have not received 7 days notice of that assessment, we can either stop this hearing, and you can have it continued to a different day. I don't know the exact day. It'll be put on the next available calendar to give you more time to review that assessment. Or you can waive your right to 7 days notice of that sex offender assessment. It is completely up to you, and we will proceed with today. What would you like to do, sir?
Waive the right.
Okay, so you waive your right to receiving 7 days notice. Okay. All right, sir. But did you you did get to review it, right? And you did get to review the rest of your blue disclosure packet.
Yes.
Okay. Do you have any errors or corrections I should know about before we begin today?
No.
Okay. So just to kind of tell you how today's going to go, sir, I'm going to go over procedurally how we got to this hearing. I'm going to ask you for any comments about your offenses. I'm not going to go over them individually, just if you have any comments. We'll go over that sex offender assessment, any background questions I have, institutional behavior and programming, if you were released, what that would look like. And at the end of the hearing, if you have closing comments or questions, let me know, okay? I would also note you have support here I'll state that for the record, the board will know, and I'll be making notes the whole time. I'm making notes of everything we're saying, okay? So it looks like you had a rehearing after some other rehearings in an original hearing. A rehearing was ordered for now, where the board noted they expected you to enroll and participate in building resiliency prior to the next hearing as evaluated to be appropriate. A contract psychological and sex offender assessment were also ordered, which we'll be talking about today. Does that sound procedurally correct, sir?
Yes.
Okay. I'm not going to go over individually your offenses, but do you have any comments about your offenses for which you are currently incarcerated?
Just that I'm very sorry for offending them, for causing that harm and fear in the community and the victims.
Do you have any insight into your risks of why these offenses occurred?
Yes.
What do you think your risks are, sir?
The risks were uncontrolled thoughts,
Can you expand on what you mean on that for me? So I make sure I understand.
I would have thoughts of committing the offense.
Okay.
It would run through my head all day long, and I'd act on them.
So they would kind of repeat.
I didn't know how to discipline my thoughts, to stop the thoughts.
So, and I appreciate, right, you talking about some of this stuff, and I'm sure it's not easy. But if you're talking about something repeating, I'm assuming that's something that could continue, right?
Well, yeah, it continues to this day. Sometimes I have thoughts that run through my head, parts of songs that run through my head. And I've learned how to stop that.
And how do you stop that?
It's a breathing exercise I learned, where I breathe very slowly in, very slowly out. So my brain is screaming for air. I tell it, I'm going to breathe for you. You'll get another breath. When it realizes that I will breathe for it, it stops.
That's good.
Then the thoughts are stopped. For the first time in my life, I can go through the day with a silent mind.
Okay, that's good, sir. It sounds like you've
problem
processed
was-
some of your risks and learned some techniques to deal with those.
Yeah, the problem was the thoughts were out of control. I didn't know how to control my thoughts. So when I learned
You
how
mean now or then?
then,
Okay.
now I can control my thoughts. I choose the thoughts I pick. I choose the thoughts I want to entertain. And I don't choose to entertain thoughts that'll be criminal.
Because obviously these offenses are concerning, right? They're against children, right? Any other risks do you see moving forward
Risks of,
of the offense occurring again?
as long as I control my thoughts, control my actions, I discovered the what I call a precious pause between the thought and an action. You gotta pause 30 seconds, a minute, before you act, before you say anything, before you do anything. That changes the whole outcome sometimes.
All right, so I want to make sure I get to that sex offender assessment. Like I said at the beginning of the hearing, I know you just reviewed it. Did you have any initial thoughts about it before I get into specifics?
No,
So I'm going to ask you some stuff that it went into the report about, okay? It noted your risk level. It said well above average risk. It also noted that you suffered from a TBI or traumatic brain injury during your childhood, and you were diagnosed with Parkinson's. Can you tell me about the TBI?
I was a farm accident. I was 16, well, the week before my 16th birthday. And I tipped the tractor over.
Someone else tipped it?
No, I was driving it,
Oh, okay.
and it tipped over. And it broke my head all around. And all the brain, spinal fluid leaked out.
Okay. And
And-
thank you for sharing that with me.
And I went to the hospital and I was there for 2 months. And I never received any therapy, any counseling, anything. Had to work on learning how to walk again, how to talk again, how to read again.
Do you have residual effects from that incident going forward? Have you had them your
The
whole
only
life?
residual effects I know of is the thoughts that would continue.
Okay.
I didn't know how to take care of them then. I know how to take care of them now.
All right, sir. It had some recommendations in that sex offender assessment. It did recommend engaging in building resilience, which should last about 10 to 12 weeks. It recommended that you enroll in Time Out for Men life skills class, and that you focus, an area of focus that may include accepting responsibility and accountability, as well as building self-esteem. What do you think of those recommendations?
Those are all good recommendations. I tried to find a resiliency class from the last hearing board that they said to find resiliency. And what I found was the emotional resiliency from the LDS church. I took that, completed that.
Okay, so I would write the sex offender treatment program, right? So you can get into this specific it's good that you're taking programming, right? Or classes that you want to take, but in regards to this, if you are ordered by the board to complete this program, make sure that you get into that specific program, right? So, because that's what's been recommended, and if that's what the board orders, of course. Okay.
Could I take that to the halfway house?
Are you, so this is recommending within the prison. Are you asking if you could do sex offender treatment in the community instead?
Yes.
And I don't know what the board will do, right? But I can make note that that's what you would like to do. Why would you like to take it in the community versus in prison?
I've spent 15 years in here. And in 15 years, I've learned how to discipline my thoughts, to separate my thoughts from actions, to control my actions, to control my thoughts. And I feel that I'm ready to re-enter society and go to a halfway house for stabilization so that I can slowly get back into society while being watched and being mentored by other people.
And right, and part of this, this hearing is obviously I have that information that I just discussed, but I want to hear your thoughts, right? And because obviously we don't want the offenses, you don't want the offenses to occur again. So I'm trying to get as much insight into how you think you can identify your risks, what you think would benefit you in regards to treatment. So that's why I'm asking those things, okay? So sir, I appreciate the insight you've given me so far, but I would note you have a history of sex offenses, right? So this is not something this didn't happen, these offenses, you've had prior ones to this, right?
Yes.
So why do you think they have continued? Is it because of that thought processing? You've never really identified that before? Why do you think
After the accident,
with
I-
the tractor?
the tractor accident,
Okay.
I lived with these thoughts, and I'd fight with them day and day. I'd fight not to act on them.
Okay.
I didn't know how to stop them. I didn't know that they were obsessional thoughts.
You didn't know what, sir?
I
I'm sorry.
didn't know they were, that everybody else didn't think this way.
Okay.
I didn't know that they were just directing my life. I just knew that I was fighting them. And I'd fight them and fight them and fight them and then give in and act on them. I didn't know how to discipline my thoughts, to stop the thoughts. I didn't know it was possible. And therefore I have a string of exposure, exposure, exposure. Because I would act on the thoughts, I didn't know how to stop them. I didn't know how to discipline my mind to choose the thoughts I want to entertain. And now I've gone through therapy, and when I realized, I thought,
Sorry.
in my thinking back then was that these acts were innocuous. They didn't hurt anybody. Somebody saw something. I didn't touch anybody. And when I was going through the sex offender therapy, I saw it through somebody else's eyes, through your eyes, through the community's eyes. And I was horrified of what I was doing. This guy out of control. What's he gonna do next? Nobody had any clue what I was gonna do next. And it horrified me. And that's the major turning point for me. When I could see through somebody else's eyes and see how I affected them. And I don't want to be that person. So I learned how to discipline my thoughts, to shut them down. I finally found the breathing exercise. I can shut my mind down.
Sounds like you've thought a lot about it and you've utilized it, which is really good, right? Okay, sir. And I would note you have no disciplinary incidents since 2017. So, right, that's many years
Yeah.
without disciplinary incidents, which is really good. So it sounds like some of the stuff you're talking about seems like you've been utilizing it. I would note the board received a letter of support. I have read that letter and the board will have access to it, okay? In regards to release plans, you've kind of already talked about it, but I showed that you'd like to go to a halfway house and work with cabinets. Is that right?
I'm a cabinet maker.
Okay. Is that something that you still
I could,
want to pursue or?
yeah, I'd like to pursue it when I get out.
And sir, I would note, obviously, based on your offense, if you are paroled, once again, I'm the hearing officer, I make recommendations, the board decides, but I think it's very likely that based on your offense that you have what are called sex offender A conditions, meaning that you're not allowed to have contact with children. Would you abide by that, sir?
Yes.
Okay.
I'm familiar with the A categories and where places you can't go. You can't go to parks. You can't go to places where children congregate.
Okay,
You
so
can't
it
have any contact with children.
sounds like you already are aware of the conditions, which is good. Okay. All right, sir. Those are all my questions. From here, I'm a hearing officer. I make recommendations. The board ultimately decides. They're made up of 5 members. 3 of them have to come to one decision. That's the decision of the board. You should get that in writing within 2 to 4 weeks. Your family members, your friends, anyone listening to this hearing via video can go to bop.utah.gov. As soon as we have the decision, we post it on our website. It's not immediate, just so you know. It still takes some time. It's faster on the website than the mail, so someone can look that decision up for you and tell you what that is, okay? I would note your guideline was 182 months or May 28th, 2024. That date has obviously passed, right? And the board decide what happens moving forward. Do you have any closing comments or questions for myself or for the board, sir?
Yes. I wrote a letter to the board
Okay.
that I'd like to read into the record.
Go for it.
In the 15 years that I've been incarcerated, I've used my time to discover the core of my deviant behavior and to make much needed modifications. While in sex offender treatment program, which I successfully completed, I was startled when I saw my behavior through the eyes of society. I was horrified. I am so sorry to have been the cause of fear and anxiety for those I victimized. I have no excuse for my actions. I damaged the trust and peace of society.
My behavior was unacceptable. I know that the way I was living and believing and behaving was wrong. And I know that I know what I need and want to be mentored and guided in my thoughts and actions as I re-enter society. I've gained an understanding of the gift of self. One way I perform service is by going to chapel. Currently, I spend about 10 hours a week indexing names for the family search. And in the 15 years of incarceration, I've spent around 7,800 hours indexing and doing family history work. I know how important this work is to the people around the world who are trying to connect with their ancestors. It's gratifying to me to be able to serve others in this way. I've been blessed with a family who loves me and stands by me even in difficult times like being incarcerated. I'm blessed with the ability to adjust to and adapt to difficult circumstances. I also have disabilities that I struggle with, living with Parkinson's disease. For 20 years now, I have lived with my body falling apart. Some days when I go to the chapel to index, I have to use my wheelchair. But I go anyway because I know what the benefits of the work are to me and my fellow men. Even though it is difficult and it would be easy to lay in my bunk, I go because I know how to work through hard things. I get out of my bunk even when my body rebels because I know from personal experience that after I do all I can, a higher power steps in to help. I have learned to be grateful for the disability I have because they have taught me how to ask for help. When I imagine the future, I see myself serving in the community, working to help others as a way of paying back the debt I incurred by my crimes. There's a community garden project that grows produce for the food pantries. I would love to be a part of that work, growing food to give to those in need. If I'm granted parole, I plan to attend the LDS reentry branch where I can find a mentor who I can talk to when I need help to remain successful. Because more than just preventing a reoccurrence of my crime, I will proactively seek help and follow the guidance of my mentors, parole officers, therapists, and I'll do everything required to continue my changed behavior and become one who lifts up those around me. As a result of all I've learned here, my character has been refined and improved. I have learned to put a pause between impulse and acting on that impulse. I discovered that when feeling angry, if I spend 30 seconds entertaining other options, the anger fades. The space between impulse and action is precious to me, helping me in many areas of my life. 10 seconds of pause helps me live a much more healthy life and make much better and wiser decisions. I feel that I'm finally ready to enter society and to continue practicing the valuable skills I've learned here while incarcerated. I am a level 2 inmate community member in the successful Learning Individual Development, the SOLID program. I have attended more than 90 seminars, taught more than 10 seminars to the members of the SOLID community, and continue to grow daily. I enjoy living in a place where all who are there are actively gaining new helpful skills like being assertive in challenging situations or to argue a point without taking the argument personal and becoming angry. I'm also in the Captain Your Story program where I am understanding the value of having a passionate vision to guide me in decisions in my life. I'm enrolled in the Associate of Applied Science Paralegal Studies program at Salt Lake Community College. I've chosen the paralegal program because as the Parkinson's disease progresses, my career as a cabinet maker will require too much physical labor. I'm also an active member of the LDS Bear Creek branch, attending institute and indexing during the week and conducting the music for Sunday worship service. I'm becoming a better person every day in preparation for reentry into society. Can you find it in your heart to help me put into practice the healthy life skills I am learning by granting me parole? I've used my time while incarcerated to change and if granted parole, I will continue growing in character and wisdom. Thank you for taking the time to consider my request.
Sir, I appreciate you preparing that. It shows really that you've thought a lot about this hearing and that you've thought a lot about how things have changed, right? And the insight into what you would like to see moving forward, right? So I appreciate you preparing that, okay?
Thank you.
Any other closing comments or questions, sir?
No.
Okay, well, I appreciate you attending this hearing. I've made notes of everything we've talked about today. We'll go to conclude. Thank you.
Thank you.
This is the time and place set for a rehearing for Gregory. Tell me your last name.
CLENDENIN.
Thank you. Inmate 79047, is that you, sir?
It is.
I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath. Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
It is.
Thank you, sir. Sir, did you receive 7 days' notice of this hearing along with your blue packet?
I did.
Did you have a chance to review that? Do you have any questions on it? Okay, I do want to make note that you do have some supports here. We just ask that you guys remain quiet while we're going through this process. They'll give you a couple minutes afterward to kind of talk after the hearing, okay? So it looks like at your last hearing, the board wanted you to complete a psychological evaluation as well as domestic violence, substance abuse programming, and to remain CAP compliant. Is that accurate, sir?
It is.
Tell me how you've been doing as far as the programming comes.
Everything but the conquest. I was removed from that so I was going to medical in the morning and I work out. I work out with these two fellers and one of them was going to BT's and they asked me, his name is Minor, is Minor going to be with us today? I said, no, he's went to BT's, he's done. There was an officer behind me, Faulkner, and he took that as making a hit call.
Okay.
And he's my best friend, you know what I mean? I've been living with this dude and everything. The two dudes that I said that to ain't even gang members or anything. And anyway, so I was removed for that. I was devastated, really. I was in there doing amazing. Miss Evans and Wanamaker were amazing people. They were helping me You know what I mean? With everything. I was doing extremely good, happy about the program, talked to my woman about it every time on the phone, how excited I was, and they removed me for that. I was devastated. I don't know. But no, so everything else I've taken care of, the domestic violence classes, all that, everything else I've been doing. Absolutely. But they did remove me from conquest because of that.
Okay. Did you receive a copy of your psychological evaluation?
I did.
Did you have a chance to review that?
I did.
What were your thoughts on that?
It was all right. Yeah, I mean, it's fairly accurate, I guess.
Okay.
That, what did it say? Disorder or the antisocial disorder. So I don't know how they got that. I guess, in here I kind of am. I don't want, you know what I mean? I'm in sections where it's, you know, pretty active and what have you. And I kind of try to keep to myself and stay out of trouble. So I don't know how they saying I'm an active, you know what I mean? Antisocial over that, but, either way, yeah, it was pretty accurate.
Okay. And as far as the recommendations go, do you feel like those are pretty accurate as well?
Yes.
Okay. And it really looks like as far as mental health diagnoses, it's the antisocial personality. They give you the stimulant, cannabis, and alcohol use disorder as well, but tell me your current gang status, sir.
So, I'm active SAC.
Okay.
It's just basically, ma'am, it's safer at this point for myself to remain in SAC, you know.
While incarcerated?
Yes, ma'am.
Tell me what that looks like out in the community.
In the community, it's there is none, you know what I mean? I've never, ever, on the streets, I don't communicate, I don't hang out with, I work, ma'am. I'm a boilermaker, iron worker. I go to work and take care of my family on the streets.
Okay.
I'm non-active on the streets in any way,
Okay.
shape, or form.
In regard to the programming that you've completed and your committing offense, tell me how you feel like programming has helped you gain insight into things, if anything.
Absolutely, yeah. So, well, I learned that anger is a secondary emotion, you know what I mean? And that there's tools to use. So instead of acting out, there's tools such as breathing, you know what I mean? Taking time out, thinking of your consequences, things of that nature. And it's all repetitive. It's things I've been doing to remain not, you know, right up free and staying out of trouble in the units. You know what I mean? So, and I've been doing an amazing job at that, I would have to say. So yeah, I did. I learned, and like I say, once again, Miss Evans and Miss Wanamaker, they were amazing. They taught me those tools to use, and we practiced them and practiced them and practiced them. We had little skits we'd get up and do and everything. So
Like role play stuff?
yeah, yep,
Okay.
yeah. It was kind of a trip, but yeah, I mean, I took to it. I did well. So yeah, yep. I learned quite a bit and was doing extremely well in it. So I was bummed out when I got removed.
Okay. What do you feel like overall has changed for you so that if you are paroled at some point that you
Everything.
don't end up coming back here?
Everything. Yes, ma'am. I know I've just, since I've been incarcerated, I've found out that I have a son, amazing son, and it's came into my life, and we've gotten to know each other through visits and stuff like that. But man, he's 13 going on 14 years old and needs a father out there, you know what I mean? And that's pretty much all I'm focused and dedicated to at this point in my life,
Okay.
is taking care of my family,
Okay.
providing for them.
I do show that you had a disciplinary in March, unauthorized possession or use of property. Can you tell me about that?
Yeah. So, yeah, the MP3 player, ma'am, they don't sell them anymore. You know, it's music. There's MP3 players. It's just a thing. And somebody went home and I received it from them. It wasn't mine. It absolutely wasn't mine. I knew better, but it had music on it. And when I work out and do my workout, it was amazing to have to kind of just tune out and focus and do my workouts and stuff with. Also, I had a power supply, a 5-plug GFCI thing that they sell to you. I received it with there was no scratch out on it, no nothing. It came to me with no name on it. I had the receipt for it and everything else. And I showed them the receipt, they didn't even care about that. But the MP3 player, that was absolutely, yeah.
Okay. Sir, if there is restitution owing in your case, are you willing to pay that?
I did. So I did. The last hearing, they brought that up. It's $3 and I paid that off. I have proof of that.
And I always just ask regardless,
Okay,
even
yeah.
if I don't show any listed, because if it ends up that restitution comes through, then we'd have to have another hearing. And so I try and avoid that in these situations. So you may have already paid it. It may have been, in other cases, sent to the Office of State Debt Collections, things like that. But I always ask just in case.
Yes, ma'am. But I would absolutely take care of that. I try
Okay.
to always take care of my bills. Yes, ma'am.
If your victim were listening, what would you say, sir?
Pardon me?
If your victim were listening, what would you say to make them feel comfortable that you're ready to parole?
I'm so sorry for, yeah, you know what I mean? Wow, that's a good one. I apologize for my actions, regardless of what happened, the situation or whatever. I completely handled it wrong. I can't take back what I did. I would want to know if there's anything I could do to help them progress, you know what I mean, better help themselves or help me help them or anything, you know what I mean? But mainly just apologize for my actions and let them know it was not their fault. It was my actions that led to this road, you know what I mean? So, yep.
And there will more than likely be a no contact between the two of you. Is that a problem?
No, it wouldn't be a problem in any way, shape or form. We haven't, so she kept writing me while I was here and I cut off. I stopped writing and just told her to please have a great life and, you know, what have you, and be a great mother that she is and what have you. So I terminated that relationship a few years into
Okay.
my sentence. But yeah, if there was, you know what I mean, that would absolutely not be a issue in any way, shape or form.
Okay. And then as far as if you are paroled in your plans, I see here from your last hearing that you were planning on living with your son and the child's mother in American Fork, and that you have a strong support family and friends system, and that you plan to, it says you're experienced in welding and working on broiler systems.
Yes, ma'am. Absolutely. Been doing it for 20 years now. I'm known through my occupation, you
Okay.
know, well known and liked, so
Is this still the plan? And then doing safety training for power plants?
it is. It
Is
is.
it power plants?
Yes. Oh, yep.
It says plans on here, so, and it's from the previous report, so I just want to make sure.
Yeah, plants.
Like
ma'am.
that doesn't make sense. Okay. So this is still accurate.
Yes.
Sir, at this point, is there anything you would like the board to know or feel like the board needs to know?
Well, yeah, I apologize. You know what I mean? I'm sorry for what I did. You know what I mean? There's no ifs, ands, or buts about that. It would never happen again. I didn't do that type of behavior. I've never, ever that been an issue. I walked in on my wife on my anniversary and I wish there would have been some type of training or whatever I would have known at the time, but I reacted completely like an idiot. And those actions would never, ever happen again. I'm not an issue to society. I work hard. I take care of my family. You know what I mean? I've been staying out of trouble. I've completed parole before in the past. And that if granted the access of parole, I would never, ever be in this predicament again. I promise you that.
Okay. Well, sir, what I plan on doing is taking the information we discussed today, compiling that into a report and submitting that to the board. You're well aware the board is the one that makes the final decision in these cases. They're made up of 5 members and it takes a majority vote for them to make that decision. It usually takes about 2 to 4 weeks for them to get that decision out to you. You currently have a 75-month guideline, which puts you at February 13th, 2024, which we've clearly passed. So you are also well aware that guideline is what it is. It's just a guideline, meaning the board can go past that if they still want you to complete something such as the residential substance abuse program prior to a parole, which is a possibility. You do have, you were given 150 days credit for time served, and you do have a 100-year top, which means that the board will have jurisdiction over your case until November 21/17. Do you have any other questions for me?
I do not.
If you have any friends or family listening to this via video, or these guys that are here today, they can go to bop.utah.gov. When that decision is made, it will be posted on our website, which means they will probably see it before you did and be able to tell you the information. Because as you're also well aware, you get the paper copy, which takes longer to get to you. If there are no other comments, sir, we'll go ahead and conclude this hearing. Thank you. Good luck to you and have a good day.
You're the same.
Thanks, Edith,
This is the time and place set for a rescission hearing for Jose Ramora, inmate 229646. Is that you, sir?
Yes.
I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath. Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
Yes.
Thank you, sir. Sir, did you receive 7 days' notice of this hearing along with your blue packet?
Yes.
Did you have a chance to review that?
Yes.
Do you have any questions on it?
No.
Okay, so it looks like the board had granted you a parole date with some contingencies. However, you recently received, guess it was probably back in June, a assault charge, disciplinary, that they're now looking at filing charges on. As of Monday or Tuesday, when we reached out to them to see the status on that, they are still planning on filing charges on this case. What I did want to ask you real quick, though, is you had a disciplinary on August 31st for substance abuse. Can you tell me about that one?
Okay, so they called me for a UA, and then I went out there, and then I couldn't pee. I couldn't pee for him at that time. So I told him, look, I can't pee right now. And then he's like, oh, okay. And then he's like, well, just go back in then. So I went back in, and then like not even 20 minutes later, I was like, hey, I could. You mean you still need that piss test? I could do it. And he's like, oh no, you denied it. And I was like, well, how did I deny it? He's like, because you went back in. I was like, well, you told me to go back in. And he's like, well, it doesn't matter. He's like, you can't come back out and piss now. He's like, you're pretty much, you mean, gonna get a write-up. And I was like, what the heck? But I even had a witness that heard everything, like him telling me that, like to go back in. He didn't tell me I was refusing it because I didn't, you know? And pretty much that's just what happened.
Okay. And then I'm not going to talk to you about the fight because it is going to be filed more than likely in the courts. So your attorney, if you have one, probably would not appreciate you talking about that at this hearing because it is being recorded. Do you have any other questions for me at this point?
No, man.
Okay, we'll go ahead and affirm the rescission for that September 3rd, 2024 parole date. And then what will more than likely happen with this is this will be put on a paper review so that the board follows that case. So more than likely it'll be a 60 or 90-day review to check the status on that. If within that time this case is resolved, you're more than welcome to write the board, let them know that it has been resolved so we can get you back on the calendar sooner rather than later, okay?
Okay,
With that, sir, we will go ahead and conclude this hearing. Thank you. Good luck to you.
Okay.
Have a good day.
thank you.
This is the time and place set for a rehearing for Michael Ray, inmate 138775. Is that you, sir?
Yes, it is, ma'am.
I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today.
Okay.
Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath. Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
Yes, ma'am.
Thank you, sir. Sir, did you receive 7 days' notice of this hearing along with your blue packet?
Yes, I did, ma'am.
Did you have a chance to review that?
Yes.
Did you have any questions on it?
Not really. I mean, I understand most of it, I guess.
When you say it, what are you talking about the blue packet?
Yes.
Because I know you have 2 assessments, the psychological and the sex offender assessment as well, that were conducted, and you should have received copies of both of those. Is that correct?
I got the psychological, the one from Chandler, the psychological eval. I did get that packet. That was part of what was, I don't know about the SOTP one.
So the sex offender assessment one, I think, was given to you just before this hearing.
Oh.
And that was probably from Chandler.
All right.
And then the second one is the psychological evaluation that was completed last month that you should have received a copy of as well.
Yes, I did.
And that would have been by Dr. Peck. Did you have a chance to review both of those?
Yes, I did.
Do you feel like you've had enough time to review both of those that you can move forward with this case? Usually you get 7 days prior, but we got the sex offender assessment late. So do you feel like you reviewed it enough that you're okay to go forward, or would you like to stop this hearing and put it for a different date?
No, we can go forward.
Okay. So let's start with the psychological evaluation really quick. How did you feel about that assessment?
My family disagrees with some of it. I talked to my family, my mom, my whole family I talked to regularly. I turned myself in and came to prison, and you know, I wanted to turn my life around. I wanted to make better choices and do things. I've been working with my family to make sure that I can do that. They disagree with some of it.
What do they disagree with?
The schizophrenic,
Schizoaffective?
schizoaffective. Yeah,
Okay.
excuse me. They disagreed a lot with that. They don't believe it. I mean, I'm not too sure about the autism spectrum disorder that I was diagnosed with, but they disagree with some of it. I do have some problems. I've had some head injuries, so I have problems with memory
Okay.
and some with comprehension. But for the most part, I don't 100% agree with it, but yeah, I'm willing to move on.
Okay. When you say you've had head injuries, what were those from?
Well, I was life flighted when I was 5 years old. I crawled into a grandfather clock box and it tipped over, and I fell and hit the corner of the edge of the coffee table and got a V on my forehead. I've had that since I was 5 years old, and I was in speech therapy and had problems with memory ever since I was a child.
Okay. And then what about, have you had other head injuries?
Yeah, car accidents. I hit the windshield, my face filled with blood. I was in a car accident. There was an ATV where I flipped an ATV. I was laying on top of it. My brother came over and realized I was staring up at the sky, just rolling over in pain. There's been a couple of other ones where I have just mainly fights and different things. But
So have you been diagnosed with a TBI,
what was the TBI?
traumatic brain injury?
No, I have not.
Are you currently on any medication, sir?
I'm on the Vega, which is for my mental health. I take that. It works a lot better because I have a phobia to pills and certain medications. I don't like mind altering substances.
Okay.
So I try to stay away from those. But the Vega is a shot, a 6-month shot, and I take it every 6 months, and I'm okay with that.
Do you feel like it does help then?
Well, yeah, it does, and I'm willing to continue that. I don't find any problem with it, ma'am.
And as far as the recommendation goes for the psychological, what are your thoughts on that? Do you agree with them?
Well, I don't 100% agree with it. You know, there's a lot of things like, I had my family do some things with, where they contacted Arrow Point and Associates down St. George, which is an SOTP treatment facility. And they have said that they'd be more than welcome to have me. I do believe that I can complete the SOTP, but I don't agree with their recommendations that I, you know, for here. I'm currently, I've ever since April been in a therapeutic community setting, waiting to find out what they're going to do with the SOTP.
Is this on
And-
current? Is
Yes,
this in, okay,
yeah. No, it's not in current. No,
okay.
no, this is in green.
Okay, so you're currently in green.
No, I'm in green facility. Yes, ma'am.
Okay.
I'm not in current right now doing it. I've been here in green since April. I've been active as an energizer lead, which I get everybody going in the morning for our energizers, which gets our blood pumping and our brains thinking. And so I help organize those events, and I've done quite well. I haven't been on probation or dorm restriction on any of them.
Okay. So are you saying that you feel like you're fine staying in green to do the sex offender programming? Because I think
Well,
in one
I
of them
don't
it's saying
feel
to go to
that
current, right?
she doesn't think that I will do it very well with it. I mean, everyone that I talk to pretty much tells me the same thing when it comes to the therapist, that they think that because of my mental health and everything that I would struggle doing it there. Which I don't know how much of a struggle. I mean, I try to do what I can, you know, I try to make sure, I mean, I'm really trying to get through it because I want to get parole. You know, I was hoping that maybe a parole arrangement would be able to come to on this one. My family has got arrangements. My brother has a job for me and a place to live.
Is that down in St. George?
Yes, well, it's in Hurricane.
Yeah.
And he has his own company, setting doors and windows in homes. I would do bookkeeping and answer the phones and other things like that, as well as probably getting a second job, which would help me pay for the SOTP courses. I'd be willing to do AA and even have a therapist, a mental health therapist that I see regularly, weekly. So between the weekly therapist and the weekly SOTP courses and Alcoholics Anonymous, which was one of the problems that they mental health or the psychologist reported on, was one of my problems. I figured if I was attending AA regularly, it would help me maintain not only sobriety, but I would be attending, you know, having the religious services come over and do family home evenings and church things with me that would keep me not only active in a religious environment, but as well as attending AA to stay away from
Okay.
those kind of.
Do you plan on remaining compliant with the psychotropic medications that they're currently on throughout your life or throughout parole?
Yeah, most definitely. I mean, I don't see any problems with the Vegas shot that they gave me.
Okay.
It works out. Like I said, I have a real hard time with taking medications because I mean, it just psychologically, it doesn't really, I mean, I have worries about it. So
Okay.
there's stresses involved. So, but the Vega is just a shot. It's a shot that they put in me and it lasts for 6 months. And I don't have any problem with that, man,
Okay.
at all. There's nothing that.
How's your physical health?
Well, my physical health's okay. I probably need to work on my diet a little more. I probably should get a little bit more active, but I figure if I was able to get parole, I would have to get some exercise equipment. My brother is pretty good about things. He has his own place, and there's another place that's right by his that he has that I would stay in. It's a modular home,
Okay.
and so I would have my own place of stay, and it's on the property, and he has spent quite a bit of money getting that arranged. So, and
Is there anything you feel physically that would prevent you from being able to complete a parole?
No, I think I would do very well on parole. My family's very supportive. I have a lot of family support. I have 2 brothers, 2 sisters, and my mom. My brother and my dad passed away last year. One of my brothers and my dad, and my sister recently, my mom's sister recently passed away. So I've had some deaths, and I'm really trying to move past that. I told my dad when I turned myself in and came to prison that I wanted to turn my life around and I wanted to do something better with it. And I didn't get a chance to show him before he passed away, but my mom's still around, and I'm hoping that if I got parole, that I can show her that I can turn my life around and do something with it. You know, my brother's got his own business, and it's a perfect opportunity. I don't know if I'll ever come across this opportunity, at least get out and show one of my parents that I am much capable than much more than a sin or a crime, that I could do something with my life and be productive. And I got lots of family support, man. And I'm really hoping that I can get out and show them that I can do something, that I am strong, that I can handle this, and I can do this, and I can become successful and complete everything that you guys asked me to on parole.
What do you feel like for you has changed the most since you've been here that's going to help you moving forward so you don't end up coming back here?
Well, there's been a lot of communication. There's been a lot of things that I haven't done before. I was bottled up as a child because of my head injuries, and I wet the bed for 36 years. There was a lot of things that I didn't understand about me or other people. Being inside the program, it has taught me a lot about other people, about communication, about passive, aggressive, and assertive behaviors, and how to make sure that I'm getting my needs met as well as other people's needs getting met as well. And along with that, and all the information that I've obtained through the program, the therapeutic community, which I've been in since April, even in promontory, which I was in a year before that. I feel that I have gained a lot of knowledge in the different classes that we have on communication and different types of things within the community. Even, you know, we've even had seminars on camping and doing things together is communicating with people in society. And so I think I've learned a lot about that. I learned a lot about people, a lot of things that I was maybe scared to or too bottled up to experience before. I've learned a little bit about this, and I've grown a lot from it.
Sir, after going through some of this programming, have you been able to kind of figure out what led you to your committing offense?
I was involved in alcohol and other things. I got a DUI and I'd never got my license back. I told myself I wouldn't get my license back because I was a truck driver at one point in my life. And I didn't feel that I was responsible enough to get that license back, man. So I never got it back. But I still continued to drink alcohol, and I knew I wasn't responsible enough to drive a car. You know, that I would be putting other people in harm's way. And even to this point, even if I get out, I may have to have, my family even agreed that they make sure I got to my SOTP and all my classes and everything. But I believe I could be responsible enough to maybe even get that license back today.
And what led you to the sexual offense in regard to all of that?
Well, it was just a lot of misassociation, ma'am. I wasn't thinking. I was depressed. There was a lot of real down moments of depression, and I was in and out of like vocational rehab and workforce services and different things, trying to get my life situated to where I could find something that would work out. I even went to Wasatch Mental Health, and I just was in a real bad moment of depression because I was wetting the bed and I didn't understand why. And when it came to other people, everybody just kind of avoided me because I smelled like pee. And so I wasn't myself. I don't wet the bed today. And so I've become really strong at that now. I'm really confident about not wetting the bed. I'm really confident about getting out and finishing and doing parole and finishing the SOTP. Confident about my therapy and having a therapist, and about maintaining AA that will help keep me in a reminder that mind altering substances are not something I can handle at all.
If your victim were here, sir, what would you say to her?
Well, I would tell her that I'm sorry that I had made the mistake that I made. You know, I wasn't myself. And that if I could get the second job and put money away for her, into account for her schooling through investments or other things that my family are into, I would definitely do so to improve her life and to tell her how sorry I truly am. Uh, whether doing it through investment or supplying her with her educational college funding or whatever I could do to help her, to show her how sorry, truly sorry I am for the mistake that I have made.
Sir, is there anything else you feel like the board needs to know at this point, or you would like the board to know at this point?
Just that I have a lot of family support. That I'm really hoping that they can come to an arrangement on parole. My family has made done a lot of effort to try to arrange things so that I can get parole, a place to live, a job. They're gonna make sure that I have ways to get to and from, even when they can't, that I do have an alternative to transportation to get to and from the places that I need to go. They've gone through a lot to make sure that these things are provided for me so that if given the chance for parole, if given that opportunity, as I'm hoping that it will work out and we will be able to be successful at it.
So you have a disciplinary for August 29th of last year. Can you tell me about that? It's for the unauthorized possession use of property.
That was somebody else's. It was an alarm clock. I had,
For a broken tablet.
was it, oh,
Sorry, it says here that an
Property.
offender handed me a broken tablet. I took possession of the tablet and the offender went back to his room without explaining to me what had happened. Do you remember that?
yeah, there was some times I was listening to some religious music and I was going through some real bad, episodes of my psychosis and different things. And, I was just under a lot of pressure from my dad dying. I felt like my life had fallen apart and, I got into an argument and the tablet broke. I kind of slammed it down a little too hard. Got a little upset at life because it was a struggle. I didn't know what to do with my dad being gone. He was the strongest point in my life. You know, the one that always helped me to make sure that I was on the right track. The one that always made sure that, you know, I was doing the things that I should be doing in life, not the things I shouldn't be doing.
Yeah.
And without him there and everything, it was a weak point. I had a real break in my spine. You know, I felt that I kind of lost it a little bit. I believe that if I had support or even a therapist to talk to about it, that could have handled that a lot better.
Well, sir, what I plan on doing is taking the information we discussed today, compiling that into a report and submitting that to the board. You're well aware the board is the one that makes the final decision in your case. They're made up of 5 members and it takes a majority vote for them to make that decision. It usually takes about 2 to 4 weeks for that decision to get out to you. You currently have a 100-year top, which puts you at August 2115, which is the length of time the board will have jurisdiction over your case. We have passed your guideline, which was back in August of 2022. You're well aware that guideline is just a guideline. The board can continue to go past that if they feel like you need to complete something such as the sex offender program prior to the opportunity of parole. It will be up to them on what they decide.
Yes, ma'am.
With that, sir, we will go ahead and conclude this hearing. Thank you. Good luck to you and have a good day.
Thank you.
This one?
This is the time and place set for an original hearing for Stephanie Leyba, inmate 255979. Is that you, ma'am?
Yes, ma'am.
I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath. Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
Yes, ma'am.
Thank you. Ma'am, did you receive 7 days' notice of this hearing along with your blue packet?
Yes.
Did you have a chance to review that?
Yes, ma'am.
Did you have any questions on it?
No.
Okay. It looks like prior to this hearing, the board wanted you to stay and remain CAP compliant and have no disciplinary violations. Is that accurate, ma'am?
Yes.
Okay. What I plan on doing is going over your current committing offenses, and then we'll kind of see what you've been up to since you've been here, all right?
Yes, ma'am.
In case 211700583, you were convicted of a Class A misdemeanor aggravated assault, as well as a criminal mischief, intentional damage to face, destroy property. This occurred around when officers were dispatched to a residence where it looks like your ex-husband was residing, and stated that you had threatened him with a knife and damaged his residence with a rock. When officers located you, you denied having any involvement in the alleged assault with a knife, but the knife was in question was located in your purse following the arrest, along with substances as well as drug paraphernalia. Is that accurate, ma'am?
Yes, ma'am.
Anything you wanted to add to that?
Yes, I believe I served my time for that in county, right?
No, you were committed to prison on these charges.
On those charges.
So you may have been on, it looks
Probation.
like you were on probation at one point, and these charges had a suspended prison sentence.
Yes.
So when you got your last offense, which we'll go over at the very end, they lifted those prison stays on these convictions.
Right.
And sent you to prison on them. So now we're addressing them again.
Yes, ma'am.
So they are a couple of years old for sure.
Okay.
In case 211700640, you were convicted of a third-degree felony assault by prisoner. This one occurred around November 16th, 2021, where officers were made aware of an assault that was in progress. After reviewing video footage, they indicated ultimately that you ended up assaulting another individual by attacking, grabbing the back of her head, causing her to hit her head on the wall, and threw a couple of punches to her side. Is that accurate, sir? Or ma'am?
Yes, ma'am.
Anything you wanted to add to that?
It was in yeah, no, I don't. I already pled guilty to it, so no, ma'am.
In case 221700060, you were convicted of an assault by prisoner, third degree, or an aggravated assault, third degree felony, and then a failure to stop at the command of law enforcement, Class A misdemeanor. This one occurred around January 27th, 2022, where officers received a report of an aggravated assault and stalking violation. You were found, let me see. You found the victim of the incident at a male's residence and confronted her in person and threatened to kill her. You eventually followed her home at some point. Noticed the victim noticed the defendant got into a newer white pickup. The victim got into her friend's vehicle and went home. After that friend went home, the victim exited the vehicle. The white pickup pulled up. You jumped out of the vehicle. And started to run after the victim. The defendant cornered the victim and tried to assault the victim. The victim stated that she was being threatened by the defendant and feared for her safety. She ended up pulling a knife on you to stop the assault from happening. You then went and got a shovel to attack the victim. The victim took that opportunity to run. You eventually threw the shovel and left. Officers discovered that you had several warrants for your arrest. When they attempted to apprehend you, you ignored the commands of the officers, continued to flee from law enforcement until you were caught, and then so you were charged with the failed to stop at the command of law enforcement officers. Is that accurate, ma'am?
Yes, ma'am.
Anything you wanted to add to that?
No, ma'am.
Okay. In case 231-700-570, you were convicted of a Class A misdemeanor, property damage destruction less than $500. This occurred around September 18th, 2023, where officers were dispatched to a residence regarding a threat complaint. This again involved your ex-husband, where he stated that you had come over to his house late last night and were acting strangely. In the morning, you and he began arguing. You went out to the back porch, grabbed a mop bucket, and threw the plastic mop bucket and shattered it by throwing it against the wall. Officers observed that was destroyed when they came to investigate the situation. Your ex-husband stated that you had left the residence, and as you walked away, you told him that you would be back to break all the windows in his house. Is that accurate, ma'am?
Yes,
Anything you wanted to add to that?
yes.
Okay, go ahead.
I was charged for those and then I went to court for them while I was here. Hold on, I'm just trying to remember. And it was, I pled guilty to, okay, so, okay, I just wanted to make sure that that was, what happened. Okay, that's everything.
What was going on during this time?
In my life,
Well, it seems like just taking the information from your charges, it makes you out to be a highly aggressive person.
it's the, meth.
Okay. How long have you been using meth?
Well, I just started, using meth late in life. Like, I'm 45 now. I started like maybe when I was 42, 41, when I moved to a small town. That's where you could see that all those charges even, happened. I started using meth in that small town. I never used it before. So if you look at my, history, criminal history, I've never been a violent person. So it had a lot to do with the drugs.
Okay. And what got you into the methamphetamine?
Ex-boyfriend,
What were you using before?
heroin.
How long had you been using heroin?
I was probably on heroin for 10 plus years.
Okay.
But heroin, I'm a functioning heroin addict. I'm not violent on it. It's when I started doing meth is when I started becoming violent. And then I feel like I got into somewhat of a meth psychosis. I came to the prison and I feel like I'm doing better though when it comes to my mental.
Okay.
Like I could think more, have more healthier thoughts, stronger thoughts. I'm doing things differently. I'm in a program that just got done with the preseason book on the hustle program. So I'm able to focus.
So tell me, as far as your criminal history goes, because your criminal history dates back to 1991, right?
Yeah, when I was a juvenile.
So tell me what got you into this lifestyle overall.
Probably when I was younger, probably just getting in trouble in junior high. I remember that.
Okay.
I have older brothers, so I remember trying to follow their lead.
Because that continues until 1996, and then you continue on even in your adult record, right?
1986.
Sorry, 1996.
1996. So I was still a juvenile.
Yeah, so your juvenile record goes from 91 to 96, and then you start getting your adult record 2000 to now. So what do you think is going to help you moving forward if you're wanting to get out of this lifestyle that's going to be beneficial for you?
Staying sober.
Okay. And is that something you're wanting to do?
Oh, yes, I have to. Because like I said, I believe I got stuck in somewhat of a meth psychosis because then I was really paranoid when I came to the prison and I couldn't focus and I couldn't think straight.
Okay.
But I am now.
Okay.
I feel much better.
And the reason I ask as far as the staying sober, because you mentioned that you were a functional heroin user for 10 years. So it almost is like you're kind of downplaying that. Tell me how that affected your life, the heroin.
The heroin, well, I was able to function off of it. Like I was able to get up, get ready, stay, have a job, keep up with myself. And I wasn't violent. It was when I started doing the meth is when I became.
And I understand that, but do you feel like heroin is an issue for you?
It could be, yeah,
Okay. And so that's why I'm wondering, are you wanting to stay sober from heroin as well?
yes.
Okay.
Because heroin only opened the door to another drug.
Okay. Has there ever been a time where you were sober outside of incarceration?
Yeah. When I got out of prison in Arizona, I was sober.
Okay. What were you in prison for in Arizona?
Money laundering?
Okay. Is that the only other place you have a history?
Yes. I was completed parole successfully, and I was clean. I had a job. I bought a house.
How long were you clean for?
I was clean for almost, let's see, so I got out and I was 31, and my husband got probably like maybe 10 years.
Okay. And so that was clean from heroin and meth, right?
Yes.
Because you didn't start using meth till you.
Until recently, a few years ago.
So you say you're clean probably from 31 to 41?
Yes, ma'am.
Ma'am, do you have any mental health diagnoses?
I don't believe so. I don't take any meds in here. I've been doing it all by myself, without the help of any kind of meds.
Were you on meds in the community?
Yeah,
Okay, what were you on?
I was on Depakote, Seroquel, and gabapentin.
What were you using those for?
Bipolar disorder
Okay.
and borderline schizophrenia. I have schizophrenia in my family. I just I'm not on anything in here.
Yeah. Tell me what the schizophrenia, how you're dealing with that while you're in here.
I work out a lot.
Do you hear voices?
Not anymore.
Okay.
Yeah, that's why I said I know that I could stay focused now because I'm not hearing the voices anymore, but I do believe I was in a mess psychosis.
So with the schizophrenia and the hearing voices, how long had you been hearing the voices prior to coming to prison?
When I started doing the meth, probably a couple
Okay.
years ago.
So you feel like that was induced solely by the meth, the
Sure.
schizophrenia?
And then slowly but surely, when I got here, I wasn't feeling well at all. And I had a devastation and my mom passed 2 months before I came to prison. So I came depressed already.
Okay.
And withdrawing off of meth. So, but as the months and the days passed, I feel much better.
Okay.
I know that because I'm focusing better. I could read a book. I'm completing the hustle program, and I'm interacting with the police officers differently.
How have you dealt with your mom's passing?
I haven't.
Okay. Is that something that you're trying to work on while you're here?
No,
Okay. Is there a reason for that?
I don't think this is the place.
Okay. And the only reason I ask is because a lot of times when I get people who relapse and end up coming back to prison, a lot of the times it's because somebody has passed and that triggers them. And then when they go out, they go back to using because then they want to suppress the emotion, I guess
Right.
you could say.
Well, I'm back with my ex-husband. He takes my phone calls every day, and we breed and train Rottweilers. So I have a job waiting, and as long as I stay clean, we'll have a successful marriage.
Okay. And that's fine. I'm just concerned of you not dealing with mom's passing.
I believe he's gonna try to help me through it.
Okay. How's your physical health?
It's good. I'm in real good shape. I'm 45 years old, and I work out every day in the pod.
Anything you feel like would prevent you from being able to have a successful parole?
No.
Okay.
Am I gonna have the same parole officer? Because he was really good with me.
So we don't do anything with that. That's all through APMP. So
Okay.
they're the ones who decide all that
Yes,
information.
ma'am.
What have you done since you've been incarcerated? I know you said you're working on the hustle program. How much longer do you have in that?
It just depends because I have a problem reading. I can read, I just can't comprehend. It's hard for me to comprehend a full sentence, so I have to keep going back. So it's taken me a long time to finish the preseason one, but I'm doing pretty good. I passed that one, 98%.
Okay.
And I got my certificate. So Lieutenant Gaiman just gave me my first preseason book, and I have already started that. I'm halfway in.
Do you have a learning disability then?
Yes, when it comes to reading.
Okay. You've had several disciplinaries since you've been here. The first two are aggravated assault. So you have one from December 9th, 2023, aggravated assault. Two inmates were seen fighting in the section. IMS was activated. Tell me about that.
I believe it had to do with my paranoid schizophrenia. Both of them did. But it was also triggered by other people's behavior. Like if I feel threatened or in fear for my life, that's what happened. I told the officers about it. They're really good with putting keep separates on the people that did that to me. So I didn't just go after them. It was something that was said to me, and then it triggered my paranoia.
Okay. And then in February 2024, you have another aggravated assault. Tell me about that one.
That was the same thing. The gentleman, well, not gentleman, it's a transgender, and he comes off very aggressive. I'm not gay, so he scared me, and we got into a fight because I was afraid.
And then in February 20th, 2024, you also have unauthorized possession or use of property. Tell me about that.
Oh, wait, hold on. Unauthorized use of possession of property?
Contraband items were found. The item was confiscated.
That was my, am I okay to speak freely about it? It was something that I used, that was made for
what?
For sex.
Okay.
For myself, just me.
Okay. And then in May 16th, 2024, you have refuse, resist, arrest, movement, do command. Do you remember that one?
Oh, yes, I was sitting on the table watching TV with my music on, and they told all the girls to lock down, but I didn't know because none of the girls were moving.
Okay.
So I had my earphones on. I tried to talk to Sergeant Hardy about it, but he seems to think that I didn't have my music on my ears.
Okay.
But I wouldn't do that purposely. But I still got written up.
So on this one, it was about being on the wrong bed.
Oh,
Oh, yes. Okay, that
yeah.
situation is hard because if one girl has your bed and she won't get out of it, you're forced to go to another bed. And then the other person is bullying that person for their bed. It's hard to fight the whole dorm for your bed. And it's hard to tell the cop, hey, this person's, and then you look like it's a snitch. And then, so somebody was in my bed and I wasn't able to lay there.
Okay. And so then I'm assuming the June 26, 2024 refuse, resist, arrest is the one you just talked about,
Yes,
correct?
ma'am.
And then in June 15th, 2024, you had a substance use incident. Can you tell me about that?
Yes, they said that there was some medications taken off of the med cart.
Okay.
And they said that they watched the camera and that it looked like me, and I pled not guilty. I talked to Garlock about it. She found me not guilty because I told her, please watch the cameras closer. I don't even believe I was on my timeout. How could I rob the med cart when I'm a max inmate?
Yeah.
good point.
So it's still showing on mine, so you may want to check with them on that.
Okay.
And then July 13th, 2024, you had disorderly conduct, reckless endangerment. Tell me about that.
Oh, somebody was getting shot at because CERT came to shoot at them. And when they was shooting at the person, it triggered me emotionally and I started screaming and crying, leave her alone. And I threw the chair.
Okay.
Through a chair.
And I told the girl, please, to just lock down. I think it just affected me because of the violent part of it.
Okay. And then you have a pending one that I'm not going to talk to you about because it is pending. It's an inappropriate relationship or bribery. But just know that they will see that as well. But again, because it's pending, I'm not going to have you talk about it at this time.
Okay.
What do you feel like has changed for you so that you won't end up coming back here?
A lot has changed with my relationship with my husband.
I thought it was your ex-husband.
And me being sober. I feel like that my meth psychosis has passed some. I'm not gonna lie, I'm still a little cloudy.
Okay.
but I stay in contact with him every day. He puts money on my books. Him being there plays a big part in me being able to get through this. Knowing that I have going home to him because I have an address to parole to and a job, which is one of our businesses that we run. We run 3 successful businesses.
Three.
Knowing that that's going to be there and I'm not going to stray away to, another man doing drugs. I think that has a lot to do with it. I've been with my husband 26 years. So I do feel like I'm still to him. If we're doing good together, I feel like we do good for each other as one.
What businesses do you guys have? You said you have the braiding Rottweilers. What else do you have?
A car dealership, L&J Auto, and Revitalizing Homes, where we sell and flip houses in Price,
Brilliant.
Utah.
Price. Price.
And then is that where you'll be? Is Price or Helper?
It's actually in Wellington,
Okay.
which is 10 minutes out of Price.
I've been to Price before.
And then as far as programming, what are your plans?
Well, when it comes to programming, I want to see what they have programmings out in Price, Utah at the probation office. I can't remember what it's called, but it's required for me to go every Wednesday.
Okay.
And then I would like for them to make sure that I do UAs randomly, just to keep me on track.
Okay. Ma'am, is there anything else you'd like the board to know or feel like the board needs to know at this point?
I'd just like to apologize for my crimes. I do feel terrible about them. I know that what got me here, and that's the meth. And I know and I feel in my heart that I'm going to go out there and do better with my husband.
Okay. What I plan on doing is taking the information we discussed today, compiling that into a report and submitting that to the board.
Okay.
The board is the one who makes the final decision. They're made up of 5 members. It takes a majority vote for them to make a decision.
Okay.
It usually takes about 2 to 4 weeks for them to get that decision out to you.
Okay.
You currently have a 24-month guideline, which puts you at September 16th of 2024, which we've clearly passed.
Yes, ma'am.
One of the reasons we've passed that is because you were given 405 days credit for time served.
Yes.
So that put us past the guideline. That guideline is what it is. The board can continue to go past that guideline if they feel that you need to complete something prior to a parole, such as residential substance abuse programming or something like that.
Okay.
That is a possibility. You do have a 5-year top, which puts you at September 16th of 2027. That is the length of time the board will have jurisdiction over your case, given there are no other further offenses.
Okay.
Do you have any questions for me, ma'am?
No.
All right, with that,
I
we'll go
do.
ahead and conclude this hearing. Thank you, good luck to you, and have a good day.
I want to
Thank
know.
you.
I want to know about that toy she was manufacturing in prison. Definitely interested in listening to that. Anyhow, I'm gonna stop being a maniaco, and what I'm gonna do is I'm gonna start the stream up again because they restricted me. So I'll be back in a moment or two. All right, so I'll be back, and if you haven't subscribed, please do so. I'll be back. All right, so how is everybody doing out there today? I'm not sure how many people are watching over here on this side. Let me double check. Oh, let me take her name off of the screen right there. There is gone, and let me see how many we got. Oops. No bueno. No bueno. Let me see here. We got 19 people? Hey, that's what's up. How come you guys ain't posting in the chat? You guys are just, you guys are being very, very quiet, if you will. All right.
This is the time and place set for an original hearing for Ruth Allen, inmate 260870. Is that you, ma'am?
Yes.
I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath. Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
Yes, ma'am.
Thank you. Ma'am, did you receive 7 days notice of this hearing along with your blue packet?
Yes.
Did you have a chance to review that?
Yes.
Did you have any questions on it?
Not really. I mean, it was pretty straightforward. I had nothing required of me, nothing but positive remarks all the way around.
Okay. What I plan on doing is going over your current committing offenses, and then we'll kind of see what you've been up to since you've been here, all right?
All right.
In case 231-800-338, you were convicted of a third-degree felony possession or use of a controlled substance. This occurred around May 27, 2023, where officers observed a small pickup truck traveling with several large cracks in the windshield. They also discovered that you'd had a suspended driver's license. It did not have proof of insurance of the vehicle. You were also found to have an active no bail warrant. When officers made contact with you, a search of your person was done. A small pink bag was found on you in your front pocket. You stated inside the bag was a glass pipe that you'd recently relapsed on methamphetamine. It was also found that there was a white powdery substance inside the glass pipe that was methamphetamine. Is that accurate, ma'am?
Yes.
Anything you wanted to add to that?
I was dumb and I shouldn't have done it.
Okay. In case 231-800-504, you were convicted of a third-degree felony, possession or use of a controlled substance. This one occurred on August 10th, 2023, where officers observed a truck driving, recognized the individual was known to not possess a valid driver's license. Additionally, the passenger did not have a seatbelt on while the vehicle was in motion. Officers initiated a traffic stop. The individual driving had a Montana driver's license, which records show had been denied, and it showed that you had a no bail warrant. When conducting a search, in your purse was found a container with a glass pipe, burnt marks, and a white crystal substance, which was methamphetamine. Another bag inside the purse had several other glass pipes with burnt marks and a clear plastic bag with methamphetamine. Is that accurate, ma'am?
Yes.
Anything you wanted to add to that?
I wish I was able to put my addiction down at that time.
Okay. Tell me about your substance use history.
Well, originally, after my father died, I turned to drugs to numb myself.
Okay.
It started with painkillers,
How long ago was that?
back in 2008.
Okay.
I smoked weed occasionally and just one mistake after another. And then I turned 21 and my friends, of course, wanted to take their turns going, hey, let's go party for your birthday. I spent so much time hung over that I was just like, no, I'm good. I can't drink. No. And I pulled myself together and I ended up with a very stable job and income and I wanted to make my life better.
Okay.
And I did that for so long. Then I got with my soon-to-be ex-husband who brought the methamphetamines into my life and was doing a bunch of, let's say, heinous things that are not at all what I would wish upon anybody in this world.
So trauma for you.
Extreme trauma,
Okay.
which continued my use. And I fought with myself and I could put it down for months on end and then something would just trigger me and it was my go-to.
Okay.
Like someone that starts smoking cigarettes out of stress. You know, it's just you do it for a minute and then you put it down and you get that trigger of stress or whatever and then you start smoking again. And
How long did you use for? Or how long have you been using meth?
from June of 2018 until April 10th of this year.
June 28th.
she's
Both of
aged
them
bad.
2024?
June of 2018,
2018. Okay.
yeah, and then April 10th of this year.
How long were you sober for prior to that June date?
The longest I had maintained sobriety was 1.5 years.
Was that outside of incarceration?
Outside of incarceration, yes.
You know, I don't even
That's
think
when
she
you
has
said things
teeth.
were going well for you and everything.
Things were, my health had started to get better because I'd recently quit. Then I found out I was pregnant with my 4th son. And I stayed sober. And then my husband was breaking into my house, planting drugs and destroying my home and he kidnapped our son
from my home and refused to let me see him, got me arrested for disorderly conduct at the time, took advantage of that and went to my home and trashed it. Removed things from the home, planted drugs and all kinds of paraphernalia
I
of
hate
the
when that
kind,
happens.
and called DCFS and told them that that's how he found my home and he was concerned for our son, and they took my son from me. And of course, the trauma triggered me to use, and I struggled again. And I could put it down for 2 to 3 months at a time, but all that trauma would start coming back because the longer you're sober, the more you have to face what you've done. And I just had a hard time handling it and coming to grips with my life
Okay.
and things that I had been put through.
I feel like it's gonna help you moving forward.
I have been in 3 or 4 programs currently since I've been incarcerated
Okay.
that are basically different 12-step programs. One with the primary focus of trauma and substance use. That course was called Seeking Safety, and I feel that I benefited greatly from it because a lot of people don't understand that most of us addicts do have some kind of a history or a past or traumatic experience that we have a hard time living with or coping with. And so we just don't want to feel it. We want to be numb to it. And well, street drugs are, what you're easy to get a hold of, and it's not the best thing in the world. And I've gotten back on my medications and I take them religiously.
Okay.
I can't go without them. And they take care of my mental and emotional health disorders, which my seizures are triggered by my mental and emotional health disorders. That is how much trauma I have been through in my life. Mental and emotional distress just trigger me into seizures. And so if I don't take my mental and emotional health medication, I can end up having seizures. And so
Diagnoses.
Hmm?
What are your diagnoses?
PTSD, various anxiety disorders. I have massive depressive disorder. And those are the big ones.
I feel like your medications are helping.
Yes, they do.
And then you said you suffer from seizures as well.
Yes, they are neurological seizures. They are non-epileptic, um, non-epileptic psychogenic seizures.
Do you have any other physical health issues?
My right hand was severely degloved in a semi-accident in 2016. I was a passenger and 52-mile-an-hour wind gust picked up the empty semi-trailer to the truck and flipped it. And my hand got shredded all the way down to the bone. And so I do have problems with my hand. My thumb is pretty limited. I work in commissary here at the prison, and I had to go to the doctor and get a brace so that I don't have to worry about overextending my thumb or snapping the tendons or having it dislocate because I can't have any more surgeries. What I got is what I got. Once it's tore up, I can't have any more seizures, or not seizures, surgeries, because I don't have enough good tissue.
Is there anything you feel like that would prevent you from being able to complete a parole?
No.
Okay.
Honestly, I think parole would be very good for me. It would set a standard and an expectation and give me structure on the outs. And because I'm from Missouri, I'm not even from Utah. And I've maintained a dual residence this entire time because I do go back home and visit my family. But having the stability or expectation of stability gives me something to strive for, something to work on. And I think doing so would give me a sense of pride and go, you know what? I can do this. What was I wasting my time on with the drugs? Because I could have had myself together and I could have had all of this instead of being out on the streets and not always knowing where my next meal's coming from, or trying to figure out where I'm going to put my head at night, because I've had that kind of an addiction problem, and I'm ashamed of it, truly. But at the same time, it's been a learning experience, and everything happens for a reason. And obviously, coming here to the prison was to show me that I can turn my life around, and that that woman I was before does still exist. I'm not just a drug addict,
Okay.
and I am better than that.
Where do you feel like you are when it comes to dealing with your trauma? Like you'd mentioned, you've been working on it through your 12 steps.
I am at a very good place with it, truly. I wake up every day and I don't feel like I'm a worthless person in the world. I feel like I can make it through the day. I know I can make it through the day. And I don't have nearly as many struggles as I used to have. I can face myself in the mirror every day and go, you know what? I've been through all of this, and you know what? It's made me stronger. And it allows me to be there for some of the other girls in section, because they struggle and they've had problems. And it's like, oh man, you wouldn't believe the things I've been put through in life. And, you know, I'm able to relate to them and help them out. So I feel that not only by me coming here, teaching myself a lesson and helping me find myself and getting reconnected with my Heavenly Father, that I'm able to help others and do so with guidance from the Lord. I mean, it helps.
Okay. I do show you don't have any disciplinaries. Is that still accurate?
Yes, ma'am.
If you were to be paroled, what would that look like? What are your plans? Do you have a place to go, programming, all that?
I have a place to go. I have a therapist that I see in Northeastern Counseling in Vernal, Utah. I have a residence to go to in Roosevelt, Utah. I plan on going to the vocational rehab services to get assistance. I plan on going to the UBAG office for assistance, getting myself on Medicaid and finding employment. And once I have employment, I'm going to start looking for a place of my own so that I don't have to be reliant on anyone else. Because the place I have to stay in Roosevelt would be a roommate situation, which is better than the street. So can't complain too much about that.
Have you ever had a problem finding work?
I did, because of my addiction problems. Before I got incarcerated, though, I was self-employed, going up in the mountains, cutting down trees, doing firewood and logging. I'd go and do random jobs for people. A lot of my boyfriend at the time and I would go and clean up property and haul off all the metal and scrap it and stuff like that. I mean, we just found little odd jobs to do to get by.
Is that what you're planning on doing when you go back, or are you wanting to find something else?
I'm gonna find something else, something that's definitely more stable.
Okay. What do you feel like overall for you has changed? You talked some about it, like addressing your trauma and things like that. Do you feel like there's anything else that's changed that's going to help you from coming back here?
This experience. I have found out why a lot of people don't talk about their prison experiences, because it's not always nice. And people can be mean. Like, they don't even know you, and like, so I'm not from here, and this is my first time ever to prison. I don't have family in this state. I'm basically a nobody, and I'm a new number, and apparently that makes a load of difference in prison, because, well, people that are here a lot longer, they're not always the nicest. I mean, because, well, this is their home, and they feel like you're invading, and it's not quite nice or correct, but it is what it is. And it's definitely not an experience I would ever care to repeat. I know I'm better than this, and I can do better, and I want to do better more than anything.
Okay. Well, ma'am, what I plan on doing is taking the information we discussed today, compiling that into a report, submitting that to the board. The board is the one who makes the final decision in your case. They're made up of 5 members, and it takes a majority vote for them to make that decision. It usually takes about 2 to 4 weeks for them to get that decision out to you once it's been made. You currently have a 7-month guideline, which puts you at August 17th, 2024, which we've clearly passed. That guideline is what it is. It's just a guideline, meaning that they can continue to go past that if they feel like you need to complete something prior to the opportunity to parole. You do have a 5-year top, which puts you at January 29th, 2029. That is the length of time the board will have jurisdiction over your case, given there are no other further offenses. Do you have any other questions for me, ma'am?
No, I can't think of any.
All right. Well, ma'am, with that, we'll go ahead and conclude this hearing. Thank you. Good luck to you and have a good day.
Thank you, you as well.
Thanks. This is the time and place set for an original hearing for Abel Martinez, inmate 258925. Is that you, sir?
Yes.
I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath. Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
Yes.
Thank you, sir. Sir, did you receive 7 days' notice of this hearing along with your blue packet?
Yes.
Did you have a chance to review that?
Yes.
Do you have any questions on it?
No.
Okay. What I plan on doing is going over your current committing offense, and then we'll kind of see what you've been up to. Just so you are aware, my head is turned to the left because the monitor for me to be able to see you is to my left. So I am paying attention to you, just so you're aware, okay?
That's fine.
In case 221900033, you were convicted of a 3rd-degree felony, DUI, drugs and alcohol. This occurred November 14th, 2021, where officers were dispatched to a DUI involving a 3-vehicle accident. The officers were told that the driver of the vehicle had fled. When officers arrived, the passengers and victims of the accident pointed out to where you were walking and stated that you were the one who was the occupant of the vehicle that had fled. The officers observed the vehicle had several empty beer cans in the bed of the truck. There was no interlock device in the vehicle, which state records showed that you had a suspended license and was an ignition interlock restricted driver. At the time, you blew a .241 alcohol level on the intoxilizer. Is that accurate, sir?
On the driving, yes, but on the interlock and the license, I was working here from California. My license was legal in California, but for some reason, they told me here when I got arrested that my license was no good. I had no knowledge of that because I had already done the program in California to get my license back.
Okay.
They told me I didn't need an interlock in my car when I was living in California.
Okay.
I was just out here working.
And that's not what you were charged with, so that may have been why that's not listed on your court case.
Okay.
But you were convicted of the DUI, correct?
Yes.
Tell me a little bit about what was going on. In this report, it states that this is your 8th DUI conviction since 1987, correct?
Yes.
So tell me a little bit about that.
Well, when I was young, I did a lot of drinking. Wasn't thinking at the time when I was driving. I was thinking, okay, I'm gonna get to my destination. I'm gonna be fine. I had no knowledge of that. And when I got the DUI out here in Utah, I panicked when the car got in front of me. I didn't really crash into him. I just like bumped them. And I panicked because they started yelling at me and I just took off walking. And I sat behind the building near the crash to where when I was found, I was just sitting there. So, I mean, I didn't really resist or anything like that. I knew I had committed a crime and it was just a matter of time when they were going to find me there.
Do you feel like you have a substance use problem, sir?
I didn't ever think I did have a problem because I was a functional person. You know, I'd go to work every day, come home, you know, pay the bills and take care of what I needed to do at my house. I didn't think I had a problem until when I really sobered up. That's when I realized, like, dang, what am I doing? What happened? And I
Was
had
this
a
while
lot
you've
of,
been in the program?
yeah, and I realized, yeah, I do got a problem. And I'm glad I did get locked up because it sobered me up. And I had been drunk for like maybe 30 years. And yeah, I realized that, yeah, it's not a joke.
How do you feel, how confident do you feel that you're going to be able to abstain from alcohol?
Oh, this is an eye opener right here. I'm done with alcohol. I'm not even thinking about it.
Sir, if there's restitution owing in your case, are you willing to pay that?
Yes.
If your victims were here, sir, what would you say to the people that were involved in the accident?
That I apologize to them for my actions. I take full responsibility for it.
You said you were here from California working. What do you do?
Build trusses.
Is that what you're planning on doing when you are eventually paroled?
Yes. Eventually I want to parole back to California, but like my wife lost the place we were living at because of my incarceration, so she's forced to live in with my kids, and they got a full house right now. So my plans are to stay here and work for 6 months and then ask for an interstate compact with money. That way I can rent me and her a house out there in California.
Okay. I have here that you're listed as a Sureño. Is that accurate?
I was listed as that because of my address. I live in Southern California, so I guess somebody in the prison system must have put me down as that.
Have you ever been a gang member?
Well, when I was young, I always hung around with the people that I grew up with, and that's considered like Southern California. So I've just been labeled at that.
Was it the Sureños or was it a different sect of the Sureños?
Sureños, yeah, Southern California.
Okay. How long has it been since you've been inactive? Were you ever active?
When
Or
I was
just
a kid-
associated?
When I was a kid, I was participating because I thought it was something that, you know, I was supposed to do. But as I got older and became a family man, I just realized, hey, you know what? There's more to life than just hanging out with the fellas and doing bad, you know?
So how long have you been disassociated with them?
Like probably 30, 35 years.
Okay. Sir, do you have any mental health diagnoses?
No,
How's your physical health?
I feel good.
Okay, anything that you feel like would prevent you from being able to complete a successful parole?
No.
Now, I do show that you've completed the substance abuse program since you've been down in Beaver, as well as MRT and some anger management. Tell me how you feel like those have helped you moving forward so that you won't end up coming back here or coming back to prison, I guess, if you're planning on going back to California.
It made me realize a lot of things like what I was doing wrong and how to correct myself and don't let peer pressure come and play and just focus on what I'm doing. I'm also taking Inside Out Dad. I should be done with that Monday. And
Okay,
then I'm also doing the relationship class also.
when are you gonna be done with the relationship class?
3 more classes
Okay. Are those weekly or?
weekly.
Okay. What do you feel like, moving forward is, aside from the programming, do you feel is going to help you from coming back to a situation like this as well? Anything else that may contribute to that?
I just gotta focus on my family, you know, my kids, my grandkids, my wife. I put her in a bad situation where she became homeless. Because I was a supporter there. I took care of her and I left her, you know?
And I
And-
do show that you don't have any disciplinaries, correct?
Correct.
Okay. So is there anything else you want the board to know or feel like the board needs to know at this point?
I just said I apologize for my actions and hope to never see you guys again.
Okay. What I plan on doing is taking the information we discussed today, compiling that into a report and submitting that to the board. Prior to this hearing, the board had sent out some recommendations for you to complete, such as the residential substance abuse program, as well as to remain case action plans. So when they make a decision, they will take into consideration everything that you have completed prior to this hearing and the things that you are continuing to work on. They're made up of 5 members. It takes a majority vote for them to make a decision in your case, and it usually takes about 2 to 4 weeks for them to get that decision out to you. You have a 20-month guideline, which puts you at January 16th, 2025, which is just a guideline. The board can continue to go past that if they feel like they want you to complete something else. However, like I mentioned before, they will take into consideration everything you've completed thus far. You have a 5-year top, which puts you at May 16th, 2018. This is the length of time the board will have jurisdiction over your case, given there are no other further offenses. Do you plan on doing programming treatment when you are back into the community, sir, when you go back to California?
If necessary, yes.
Anything else you would like the board to know at this point, sir?
I was told to ask to go to a halfway house that can help me with transportation, like to and from work, because I don't really know my way where I'm gonna be at it, wherever you guys send me to. So, is it gonna be, or you guys are gonna help me like get transportation and clothes and?
So the board has nothing to do with that. That will go through the transition prison department as well as adult parole and probation. They're the ones that'll help you out with all of that stuff. We don't dictate what halfway houses or things you go to, but if you don't have an address or a place to go, they will put you at some halfway house. So you can ask that. You can ask the transition team that you'll start to work with when your parole date comes closer.
Okay,
Okay, any other questions for me, sir?
no, that'll be all.
All right, with that, we'll go ahead and conclude this hearing. Thank you, good luck to you, and have a good day.
All right, thank you.
Oh, you're good to go back.
This is the time and place set for an original hearing for Israel ARRIAGA-BANKHEAD, inmate 260465. Is that you, sir?
Yes, ma'am.
Did I say your last name correctly?
Yeah.
Okay. I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath.
All right.
Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
Yes.
Thank you. Sir, did you receive 7 days' notice of this hearing along with your blue packet?
Yes.
Did you have a chance to review that?
Yes.
Did you have any questions on it?
No, I don't.
Just so you know, my head is turned to the left because the monitor for me to be able to see you is to my left, so I'm not ignoring you, all right?
All right.
All right, so prior to this hearing, the board wanted you to remain case action plan compliant as well as remain disciplinary free. Is that accurate, sir?
Yes.
Okay. What I plan on doing is going over your current committing offenses, and then we'll kind of see what you've been up to since you've been here.
All
In
right.
case 231100355, you were convicted of 3 third-degree felonies. 1 for possession with intent to distribute a controlled substance, 1 for an endangerment of a child or vulnerable adult, and 1 unlawful acquisition, possession, transfer of a financial card. These occurred around June 13th, 2023, where officers were made aware that you had possession of drugs and paraphernalia at your residence. There were also some credit cards with names on them that were not yours that were turned over as well, as well as a pill bottle containing controlled substance that were not prescribed to you. You also, it looks like, had some arrest warrants that were issued. And at one point, you had mentioned to somebody that you were selling pills, Adderall pills as well. When officers responded to the residence, you were found to be inside a bathroom that had marijuana as well as paraphernalia. There were 4 children under the age of 18 also at the residence when you were taken into custody. Is that accurate, sir?
Yes.
Anything you wanted to add to that?
No, everything seems that's what happened.
Hey, tell me what was going on, sir.
During the time I wasn't working. I didn't have any means of job, and I was just not really thinking about the things I was doing. I was just trying to do anything to make money instead of trying to work. And so that's how I ended up being in those possessions. I was staying at my mother's house, and she kept on trying to urge me to go work and find a job, but I decided not to and just chose the easier route.
Okay. How long have you been dealing substances, sir?
Not long. I never really been able to sell. I was just I was trying to, but they were just in my possession.
How long have you had a substance use issue?
Since 11.
Since you were 11 or 2011?
Since I was 11.
What got you into it?
Marijuana.
What were the things that got you into it? Friends, family?
Friends.
And what is your drug of choice?
Marijuana and opioids.
Okay. What got you into the opioids?
Friends too. Friends I was around with.
Has there ever been a time since you've been using in the last 9 years where you've been able to maintain sobriety outside of incarceration?
I stayed away from opioids for a while, but marijuana always has been a problem for me.
How long were you off the opioids?
For about 2 years.
Okay. What was going on during those 2 years?
I just wasn't really into it because when I just had a bad experience with them, and so I let them be for a while.
When was that?
When I was 15.
So from 15 to 17, you were off of the opioids?
Yeah.
Okay. What usually keeps you coming back to the opioids and the marijuana?
It's just something easy for me to get my hands on.
Okay. Do you feel like you have any triggers to them? Like what triggers you to use?
Just when I feel like things aren't going my way, or I just want to
know myself and not deal with my problems.
Okay. Are you wanting to stay off substances?
Yeah,
What do you feel like is going to help you to stay sober?
my surroundings. I feel like I always put myself in surroundings where if I'm not feeling like I'm succeeding in the better parts of my life, that I turn to those surroundings that aren't as good as for me.
Okay.
Is I like to get in, like to involved in it and what comes with it,
Say that last part again.
and what comes with it.
Okay. Excuse me. I have you listed as a Sureño. Is that accurate, sir?
Yes, ma'am.
Are you active?
Yes.
Is that, tell me what that looks like. Are you active in prison? Is it an issue for you in the community, or is it a thing for you in the community as well?
It's a thing for me being in prison and it's just where I've been, but I've been trying to just live a normal life.
When did you become a Sureño?
In my teen years.
Okay, so you joined out in the community.
Yeah.
So are these people you still hang out with when you are in the community at home?
Yes. This last time, yes.
Okay. Are they individuals that contribute to the delinquent behaviors you have?
I would say no.
Okay. What do you have any mental health diagnoses, sir?
No.
How's your physical health?
Good.
Anything that you feel like would prevent you from completing parole?
No.
Okay. Since you've been incarcerated, it looks like you are currently involved in MRT. What have you been up to?
MRT, I also been trying to get into anger management, but those classes haven't started yet. But so far, MRT is the only thing that I've been able to be involved to. When I was over at
Okay.
Gun, I was trying to be.
Okay. Is that okay?
Yeah.
Have they come to you to do a substance abuse assessment at all?
No, I don't think they. No, I don't remember doing one.
All right. You have a disciplinary from June 24th, 2024 for refuse, resist, arrest, movement, do, or command. Tell me about that.
I was in someone else's cell that wasn't assigned to me.
Okay. What was the purpose of you being in the other person's cell?
I was just talking to them.
What do you feel like for you has changed, if anything, that's going to help prevent you from coming back here?
I would say just the fact that I see that I have a good support system out there. This time around, I've been able to talk with my grandfather and my mother. One thing I was ignorant to before, but so far they've been the only ones that have been sticking by my side, while everyone else at the beginning, when I first started doing my time, has fallen off. But they've been continuing support and helping me just with conversations to put my mindset on trying to do these things. And I just don't want to accept them for the fact that I see how much time they've been investing into me during the time I've been down.
Sir, if you are paroled, what is that going to look like? Do you have an address to parole to?
No, but I plan to most likely a halfway house.
Okay.
You know, everyone would accept me.
Do you have a job lined up, or is that something you're going to have to find as well?
It's actually something I've been looking at having my mother help me with, because I have certification in welding. That's the job field I'm trying to get into.
Okay. As far as programming, what are your plans?
My plan is to complete MRT while I'm here. If not able to do it while I'm out there, and just therapy too.
And more than likely, you'll have substance abuse conditions Are you willing to comply with those
Yes, ma'am.
as well as any other parole conditions?
Yes.
Sir, is there anything else you feel like the board needs to know or you would like the board to know at this point?
No, just that basically what I said so far is that I have a plan to go out there and just keep myself out of trouble. You know, I'm already thinking ahead of trying to get a job out there, trying to figure out a place lined up. Just anything to help me to not put myself in the same position as I have been in before.
Okay. Well, sir, what I plan on doing is taking the information we discussed today, compiling that into a report and submitting that to the board. The board is made up of 5 members. It takes a majority vote for them to make a decision in your case. You currently have a 16-month guideline, which puts you at February 28th, 2025. That is the length of time, or that is the time that guideline is what it is, it's just a guideline. Meaning that they can go below that, on that, or past that, depending on if they want to see you complete something prior to a parole. You have a 5-year top, which puts you at October 31st, 2028. That is the length of time the board will have jurisdiction over your case, given there are no other further offenses. It usually takes about 2 to 4 weeks for the board to come to a decision and get that sent out to you. Do you have any other questions for me, sir?
No, ma'am.
All right, with that, we'll go ahead and conclude this hearing. Thank you, good luck to you, and have a good day.
Thank you.
All right, this is the time and place set for a parole violation original hearing for Donald Duncan, inmate 191885. Is that you, sir?
Yes, it is.
I'm Kathleen. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting your hearing today. Because I'll be taking testimony from you, I'm going to have you raise your right hand for me so I can place you under oath. Do you swear and affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth?
I do.
Thank you, sir. Sir, did you receive 7 days' notice of this hearing along with your blue packet?
Yes,
Did you have a chance to review that?
I have.
Do you have any questions on it?
I do not, it's, I think it's saying I'm gonna do parole, which I would prefer not to, because I'm actually trying to get over to Colorado to, with my niece over in Denver and work at her car rental business for a little while until I can get a job and get on my feet. I mean,
Okay.
I
You're
haven't.
saying you would refuse a parole?
Yeah, I don't want parole. You don't want me coming over there on parole, and I don't want to be on parole. So.
Okay. Just so you know, the reason my head is turned to the left is because the monitor for me to be able to see you is to my left. So just so you're aware of that. And it looks like back in August, the board sent out a smart scheduling for you, then wanted you to remain case action planned as well as disciplinary free, correct?
Yes.
So what I plan on doing is going over your current committing offense, and then we'll go over your parole violations, okay?
Okay.
In case 231-700-505, you were convicted of a third-degree felony possession of a dangerous weapon by a restricted person. This occurred around April 27th, 2023, where officers responded to your residence as you were a fugitive from APMP at the time. They located you in the attic of the residence, and after several commands for you to come out, you eventually did. And you were found to be in possession of a 3 5/8 inch blade knife, as well as a glass pipe with a brown residue in the bowl. Is that accurate, sir?
Yeah,
Anything you wanted to add to this?
I do not. That sounds about right.
Okay. Gonna go over your parole violations real quick so I don't forget about those as well. As we go through these, I'm gonna ask if you would admit, deny, or no contest. Some of these coincide with your current committing offense. I'm still gonna ask if you admit, deny, or no contest, okay, for the parole violation purposes.
Okay.
On allegation 1, by having absconded or fled from parole supervision on or about December 7th, 2022, in violation of your standard condition of your parole agreement, do you admit, deny, or no contest?
I admit.
On allegation 2, by having committed or by having been convicted of a new criminal offense or violated a court order, possession of drug paraphernalia on or about April 25th, 2023, in violation of your parole agreement, do you admit, deny, or no contest?
I admit.
On allegation 4, by having committed or by having been convicted of a new criminal offense or violated a court order, possession of a dangerous weapon by a restricted person on or about April 25th, 2023, in violation of your parole agreement, do you admit, deny, or no contest?
Admit.
Go ahead and accept admissions to all allegations, as well as take judicial notice of allegation 3, as it is your current committing offense in case 231-700-505. Will revoke your parole from July 26, 2022. Sir, tell me how parole was going.
It really was not going very good. I couldn't get to my classes or anything. I had no transportation, and my PO was threatening to throw me in a halfway house, and I got scared. So I ran.
Okay. How long were you on parole before you went AWOL?
From July 26th to December. So
6 months?
yeah, about 6 months.
5 or 6 months. Now, you've got a pretty long history stemming from your juvenile record. I show that you have a couple of failure to register as a sex offender. What is the sex offense that you're on the registry for, sir?
It was an unlawful sexual contact in Colorado.
Okay.
And I don't know if you can tell or not, but I don't do well on parole. I've never once completed parole or probation.
Okay. And I do see that.
I mean, I'm just I'm over trying to do everything that they want. I mean, I just want to live my life, you know, and I want to move to Colorado so I can, because over there nobody really knows me. So, and my hometown is not if I can say no, it's if I can say no as many times as I have to, because everybody there offers me drugs for free, you know, and it's not if I can afford it or not, it's if I can say no enough, you know. So
Well, and here's my concern in regard to, aside from your probation and your paroles, you have a pretty consistent criminal history in general.
Yeah.
And you're well aware that regardless of where you go in the world, it's easy for you to access substances. So are you planning on stopping using, or you're going to plan on continue using? What's that going to look like for you?
I'm going to get out, and my niece is she's going to help me find a sponsor. I'm going to start, you know, just going to meetings and just try doing me, you know. I'm going to just, I don't know. I've got a different mindset, and if I'm in a different area, I have a better chance of staying clean and sober. She's been on substance before, and she's gotten clean and stuff. So, I mean, and she don't like drugs. So, I mean, I don't know. I'm hoping that would be a better environment for me, because my hometown, I cannot do it in my hometown. There's just no way of doing it.
What's your mindset change?
I don't want drugs. I don't need drugs, because nowadays it's not if I can get high, it's if I cannot die, because they're full of wow, fentanyl now. And yeah, I don't want fentanyl. I don't want that stuff. I don't need that stuff.
What is your drug of choice, sir?
Methamphetamines.
How long have you had substance use issues?
Since before teen.
Okay. Has there ever been a time outside of incarceration where you've been able to maintain sobriety for a period of time?
Yeah, I've done it for about 3 years. I would say.
What was going on in that 3 years?
I was kind of helping raise my nieces and nephews, and
When was that?
Early
Roughly.
2000s.
Say that again.
Early 2000s.
What usually causes you to relapse?
Old associates.
And is it always in the Carbon County area?
Yeah.
Okay. Do you have any mental health diagnoses, sir?
Not that I can think of.
How's your physical health?
It's pretty good. I've got pinch sciatic in my left side. Other than that, I mean, it's okay.
I usually ask if there's anything that would prevent you from being able to complete a parole, but you're planning on refusing parole.
Yeah. I just want to get terminated or expirated, because I can't do parole. I don't know. I don't want to do parole.
Now, there are times where you may be telling me this, and I may recommend this, and the board may still offer you the opportunity to parole, just so you are aware. And sometimes it takes you refusing that parole and having a rescission hearing moving forward, because at times people will often tell this to us, and then when they get that opportunity to parole, they'll go ahead and take it. So just so you're aware, that may happen. But I also ask more questions in the sense of, you are planning on refusing, you're not gonna sign the parole in hopes to kind of avoid that. So then we can put you on that expiration or termination situation. Have you ever completed a substance abuse program successfully, sir?
Yes, I done Conquest and I done Hope. And, them are the only substance abuse programs I know of.
So the last time you did Hope, it looks like was in 2022, correct?
Yes. And it didn't really do anything for me because honestly, a drug addict, you quit when you're ready. You know, there ain't really much you can do until then. So, and I found I'm to the age to where I need to settle down and live a clean, sober life.
So if you've gotten to the point where you feel like you're ready to quit, are you planning on taking the substance abuse program down in Beaver since you're there?
There is no, I cannot do substance abuse program here because I am an SO.
Okay.
But I mean, if you send me to like Kane or somewhere like that, I could do it.
Okay.
But I kind of don't want it because I've got a job here. I've been a painter since June, so. But I don't know. I just don't feel like the substance abuse programs do anything for me.
Okay. Sir, is there anything else you feel like the board needs to know or you'd like the board to know at this point?
Well, I haven't set idle in here. I've got 2 certificates for completion of MRT and anger management.
I saw those.
And I've got a job, so I'm working and I'm ready to get out and be a active part of the community, you know,
Okay.
society. I want to get out and do my part to do better. To show I
And
can.
you're aware that if the board chooses to expirate your sentence, that is going to be anywhere from now to 2028 when your expiration date is, correct?
Yes, I do. I do know that.
Okay.
And I'm willing to do what I have to do. I would like to get earlier, but I mean, if that's what it is, then that's what it is. But
Well, sir, what I plan on doing is taking the information we discussed today, compiling that into a report and submitting that to the board. You're well aware of how this whole thing works. The board is the one that makes the final decision in your case. It usually takes about 2 to 4 weeks for them to get that decision out to you. You do have a 16-month guideline, which we are past as of August 24th, 2024. You're also well aware that that guideline is what it is. It's just the guideline. They can go below that on that or past that if they want to see you complete something, whereas you are refusing parole. That means that your date that you would be terminated or expirated could be anywhere from now until September 14th, 2028. I don't see the board giving you an or a termination of earlier than that date unless you complete some type of residential substance abuse program or something like that, which may be an option depending on what they want to see.
okay.
That 2028 date is the length of time the board will have jurisdiction over your case, given there are no other further offenses. Sir, at this time, do you have any other questions for me?
I do not.
All right, with that, we'll go ahead and conclude this hearing. Thank you. Good luck to you and have a good day.
Thank you.
What do you guys think this gentleman's name is right here? Let me check the list here. And so Duncan was the last one. Let's see right here. Is this gonna be Charles? Charles, does he look like a Charles to you guys? Charles Jacob. Fillmore. Oh no. Charles Jacob. Let's see what it is right here. Ladies and gentlemen, I mean, whatever floats your boat. I believe he might be single, ready to mingle. So don't be shy. Feel free to reach out. Nah, I'm just messing with you guys. I know nothing about this guy. Let me do a little Google search right here. Check if anything comes up on this name here. And let me see. Utah arrest. Let's see. Right here. Fillmore. Nope. Man, like the guys that I've been looking up lately. Stormy's laughing. Let me see if I could find anybody right here that matches this name right here. We'll start off with $1 right here. $1. And he could be all yours. Look at that right there. Yeah, no, I can't find anything on this guy here. What time is it? It's 12:22. Still early. And let me set this up over here. Hey, Lorraine, how's it going? Welcome back. Let me see over here. Hey, Stormy, thank you. Hey, where's everybody tuning in from? If you guys don't mind sharing, city, state, country, whatever, street name, feel free to drop that in the comments. So let me see. For those of you that are interested in knowing, we have 1, 2, 3, 4, 5, 6, 7, 8. So we have 7. Oh, that's right, Covina. We got Lorraine from Covina. We got Parker from Fresno, California. We got D from Savannah, Georgia. We got is it Renee? New Jersey or Nueva Jersey? Let's see, who else do we got? I think that's it right there. Anyhow, so anybody that's interested, these are actually those two ends really threw me off right there. Really threw me in for a loop right there. We got the _ Stormy. She's coming in from Australia. She's coming down from down under. Let me see who else do we got. Oh, we got Betty Boop coming in from Palmdale, California. We got JPay coming in from Michigan. Romulus. All right. We got Hey. We got Philly. That's right. So for anybody who's interested, these are live. They're not pre-recorded. We're actually looking at them right now as is. Normally when I do run them and they've already been it's a little bit later in the day, I'll let you guys know. But this one's actually happening in real time. And if you feel like watching it on the comfort of your own home without me speaking and whatnot, you're more than welcome to go directly to the source. If you go to the Board of Parole in Utah, you'll find the link. It's really easy. You just click on it, boom, boom, and that's it. You don't have to register or nothing, and you'll be on there yourself. All right, looks like they're about to get started. What do you guys think this guy did? What do you guys? Let's see if this is Charles right here. Charles Jacob. Do you guys think he was hitting the pipa? Do you guys think he was maybe a car, stolen car, GTA? Maybe he did like a 3 or 4 stars on Grand Theft Auto 4 or 5. I don't know, no sé. We're about to find out. But cast your vote. What do you guys think? Lolly puts, love your stream. I highly appreciate it. I'm glad you enjoy it. Gives me something to do throughout my day while I wait for my daughter to get off of school. And then I know my wife appreciates it because then I'm harassing her at work, and then she starts complaining. Thank you for the like. I didn't catch the name on that one. It started with a D. GTA, Rugs, Pew Pew, Stormy. All right, I heard the little. What was that little clicky noise? Was that me or them? No sé. I don't know. All right, gotta move my shoulder a little bit so like that we don't block the view. Unfortunately, my screen's a little bit bright. I gotta next time I do it like this, I'm gonna try to adjust the brightness, or maybe I'll try my other phone.
This is an original hearing for Charles Fillmore, number 245476. Is that you, sir?
Yes, sir.
My name's Scott Manning. I'm a hearing officer with the Utah Board of Pardons and Parole. I'll be conducting today's hearing. I am going to be taking testimony from you. If you'd raise your right hand, I'll swear you in. Do you swear that the testimony you provide today will be truthful and accurate?
Yes, sir, I do.
Thank you. Did you receive at least 7 days written notice of today's hearing along with your blue disclosure packet?
Yes, sir.
So that disclosure packet contains the information that the Board of Pardons will be considering as they make a decision in your case. I have reviewed that. I'm familiar with all of that. I've prepared some questions of things that I thought maybe were relevant and I'm interested in, but the primary purpose of today's hearing is for you to be able to speak on that information and talk about it. Are there any errors or inaccuracies from that information you'd like to point out at this time?
I don't believe so, no.
Okay, I do note we sent to you some late disclosure. For my review, there were 3 documents. I think we sent it to you yesterday. So first, there was a letter of support from your mother discussing programming you've done, discussing love for you and support for you and encouraging the board to grant a release. There was a document that documented the BRT graduation, and then there was also the entry of the earned time credit that I've noted. So did you get those documents? We sent them to you?
Yes, I did get them.
Okay.
I got one yesterday, and I got one days ago as well, of the same thing.
Okay. We do generally, people you can have more time to receive these things since it is late. Are you comfortable moving forward and waiving further disclosure of that, or?
What does that mean?
So really, you have the right to receive all documents the board will consider. Generally, we want you to have that for 7 days so you can review it and prepare to respond. Since you got it just yesterday, if you want to review things for more time, we can postpone today's hearing if you'd like to, or we can proceed today if you feel comfortable with what you've reviewed.
I prefer to continue today, sir.
Okay, so I'll note your waiver of that and we'll continue. So what I'd like to do, I'm going to start by giving an overview of your case. So your conviction, sentence, guideline date. From there, I think there's 5 cases in which you were committed to prison. I'm going to briefly talk with you about what happened in each of those 5 cases. From there, I have some questions for you about the period of time leading to prison. I think you were on probation for a period of time, what you've been doing recently, insight that you've gained, and then also your plans moving forward. And then at the end of the hearing, I'll let you have the final word and you can state anything else that you'd like to on the record, okay?
All right, thank you, sir.
Your commitment offenses are distribute, offer, or arrange the distribution of a controlled substance, felony 3, robbery, felony 3, theft by receiving stolen property, felony 3, 2 counts of possession or use of a controlled substance, felony 3, attempted distribute, offer, arrange the distribution of a controlled substance, felony 3, failure to respond at the command of police, felony 3, and possession of a dangerous weapon by a restricted person, misdemeanor A. You're serving a maximum aggregate sentence of between 0 and up to 20 years in prison. I think 4 of the cases, 0 to 5s, were entered consecutively, leading to the maximum 20-year sentence. That will expire as of now on September 20th of 2042. So that's the longest period of time that the board can retain jurisdiction over your case and your sentence. Your parole guideline calls for 28 months incarceration. That would lead to you being released on February 5th of 2025. Obviously, the board is not bound by that guideline. They'll consider all relevant factors in your case, mitigating and aggravating, to decide what's appropriate after today's hearing. I do note that in November of 2023, when the board scheduled today's hearing, They noted an expectation that you complete substance use treatment and comply with your case action plan. And in October, so just this month, the board acknowledged an earned time credit because you completed the substance use treatment program. So that's where we stand as of today. So the first case is case 191700840. In this case, I believe in March or April of 2019, you sold marijuana to a confidential informant. I think it's your residence. Officers found cocaine, marijuana, and drug paraphernalia. Is that accurate?
Yes, sir, it is accurate.
You were selling marijuana. Were you selling other drugs as well?
At that time, I was selling marijuana, sir.
Just marijuana?
Yeah, I was using other drugs recreationally.
Okay. Thank you for your comments. That's really kind of the point of today, is to discuss these things. I will relay all information in your statements to the board members so that they consider those things. They can consider those things. The next case, case 201700103, January of 2020, you entered the victim's residence unlawfully, brandished a stolen firearm, and pointed it at the victim. The pre-sentence report notes that at the time you denied pointing the gun at the victim, but it does state a witness saw you pointing the gun at the victim, and you did at that time tell the victim to give you all the money that he had. You told officers that you went to that residence to collect, I think it said, a $40 debt. Is that accurate as to what happened?
Yes, sir, that is accurate.
How did you obtain the stolen firearm?
I bought it from a friend. He told me that it was stolen. I didn't know that it would enhance the charges if I got caught with the firearm.
Okay. And did you, is it still your statement that you did not point the firearm at the victim or threaten the victim with the firearm?
I did point the weapon at the victim. I don't want to lie.
Okay. Thank you for your comments on that case. The next case is case 201600015, February 2020. You were a passenger during a traffic stop. I think you had marijuana stems on your person, and there was LSD, marijuana, a pipe, and I believe 6 grams of methamphetamine, 2 grams of heroin in the car. I think there was the driver admitted some of the drugs were hers, but I think she said that you had given them to her. Is that accurate?
Yeah, that's accurate.
Okay. Case 211700667, March 2021. Around 3 in the morning, you were driving with your lights off. You were pulled over. You showed signs of intoxication. You admitted that to police you had used Xanax, and you, quote, might have cocaine in your system. I think in the vehicle, officers found methamphetamine, loose alprazolam pills without a prescription bottle, and drug paraphernalia. I've read your statements as well in the pre-sentence report about what happened here, the situation that led to you driving under the influence of these substances. Is that accurate as to what happened?
Yes, sir, that is accurate.
What had you been using at that time?
I had Xanax in my system. I had cocaine. I had methamphetamines, and I think marijuana, sir.
Okay. Thank you for your comments on that case. Next case, 231701051, May 2023. I think the victim called the police. You were at the house, quote, banging on the door. It said threatening her boyfriend. You left in a vehicle. Officers attempted to stop your vehicle, but you fled. I think you initially evaded police. Officers located you, parked at your residence, and you were in the driver's seat reclined. You submitted to arrest, and I think on your person or in your possession, you had a 4-inch switchblade knife, drug paraphernalia, cocaine, and a prazolam, THC wax, and something that officers suspected was fentanyl. I've also reviewed your written submissions on this case as well, so I've included those in my report. But is that accurate as to what happened?
No. I was not at my residence. I parked in someone else's driveway. My residence was in Layton. I had an apartment.
It may be that the official report said a residence, and I just misread that. But I'll note your statement. Thank you for that.
Yeah.
And were you under the influence during this incident?
No, I was not.
Okay.
But I did have drugs in my possession, yes.
You had them possessed. I know there wasn't a DUI conviction in this case, but I just wanted your statement on that, so I'll note it.
Okay.
So the reports discuss as far as your history, probation from about May of 2020 until July 2023 when you were committed to prison. I think age of 20 to 23 at that time. They were unsuccessful. The final two cases occurred while on probation, and then after that most recent case, you were committed to prison. The reports I reviewed suggested you had periods of about a year of compliance. I think you completed your GED. You completed successfully an intensive outpatient program with reflections, but then obviously fell back into negative behavior patterns, resulting in the continued behavior. And there's discussions as well of working a job for periods of time, living with family, etc. So what do you think prevented you from changing your behavior while you were on these opportunities at probation?
Can you say that again, please?
Yeah, so just while you were on probation, it seemed like there were periods of time where you were doing what you were supposed to do. You got your GED, things were going well. What led to you falling back into the behaviors that led us here?
So when I got my GED and I completed that intensive outpatient with reflections, I was sober. I was doing what I needed to do. I got back into college. Well, not back into. I started college through vocational rehab. I was trying to get my SUD-C and my social degree, but I ended up getting hit by a car. They put me on Dilaudid for getting hit by a car, and it just put me back into my addiction. And after that, I just spiraled back down. I couldn't get a handle on my sobriety. I didn't like myself, so I just continued using through means of anything,
Okay. When was that, the car accident?
It was October 1st of 2022 or 2021.
Okay.
It was 2022.
2022?
Yeah.
So about 9, so right before the year before prison, so the year before that. Okay.
Yes, sir.
So, since you've arrived at the prison, you successfully completed the Beaver Substance Use Treatment Program, MRT, anger management. You're in a Inside Out Dad class. You've been engaging in programming. Role is similar to probation, right? There's conditions that are meant to hold you accountable, meant to help you, provide resources to address these things. Also, to react appropriately and deal with the risk factors or the risky situations that do occur, like an accident. Thinking about the treatment that you've done, if you're granted a chance at parole, what do you plan to do differently so that you can have a better outcome?
My cousin said that I could go live at his house with him. He's about my age. We have some of the same ambitions and goals. He's sober. He's said he's willing to help me to be successful in my life. So I think my environment being changed up from like the places that I've been, I think it'll be really beneficial for me. Plus being on parole, I think that now that I've gone to prison, that they offer us a little bit more benefits than probation did to like help me be successful in life and get set up for the future. And I plan to take advantage of all those opportunities that are offered to me to make my life successful.
Okay. Where were you living while you were on probation? Were you with your parents?
I just recently,
or before prison, while these cases were occurring, where were you living at that time?
I had my own apartment.
You had your own apartment? Okay.
Yes, sir.
I think I read in the reports, let's see, I may be confused, but I think it said you were living, quote, with your parents in Syracuse, Utah. Is that were you in Syracuse?
That was before I got my apartment, yes.
Before the apartment, so,
Yeah.
okay. It was a 3-year period of probation, so there was quite a bit of time. Okay,
Yes.
so at that time you got your own apartment, and that's when the accident happened and the behaviors resulted from there. Am I understanding that correctly?
No, I was living in sober living when the accident happened.
Oh, okay.
I was living in Pleasant Grove.
What sober living?
Rock Solid.
Okay.
Yeah. That was after I completed outpatient through reflections.
Okay.
Yeah. That might have been 2021. I may be getting things confused myself, sir.
Okay. I know you don't have any disciplinaries, housing staff. gives a positive report of your behavior and attitude as well. So I'll note that for the board. As far as your release plan, I've taken some notes. I guess at this time, I've received and read the letters of support from cousins, your grandmother, your mother, describing, your life, struggles with addiction, your past behaviors, their thoughts on that, also discussing your positive character traits, release plans, obviously the verification of plan to live with your cousin and what that environment will look like. So I've read those. I have some notes on what you submitted in writing, but wanted to give you an opportunity today. If you are granted parole, what would your release plan look like, and how do you plan to be successful?
So I have written down I got a 1-year plan and like a 3-year plan right here. My 1-year plan would be steady employment, stay sober. I want to get back into vocational rehab and start college again. I want to get my CEC, and I want to work in group homes, or maybe like with kids that are like locked up in like Mill Creek, and like I want to help them like get a better future, man. Because like I've been in this stuff, like I know how it is, and I feel like it would help me, like help them. Does that make sense? I want to be financially stable, and I want to get back into my own apartment. My 3-year plan would be hopefully a successful termination, interning at treatment centers or group homes, start a family, get into my own home, sober and financially stable. I feel like it's for sure possible and obtainable. I think goals and plans are a good thing because I have things to work for and look forward to.
Thank you for preparing that, and encouraging that you've looked into the details of that. I think certainly having a solid, realistic, achievable release plan that you're committed to is an important aspect of parole, and that's something the board will consider. So I'll note your comments that you've made today, as well as thank you for the written submissions leading up to today's hearing. Also are detailed and thorough and helpful. So thank you for being prepared in that way.
Yes, sir.
Some of the past reports discuss previous diagnoses of bipolar and major depressive disorder. I think so. Diagnoses. So I understand your written submissions correctly. Major depressive disorder and then generalized anxiety. Are those your 2 past diagnoses?
Yes,
Did
sir.
you? Let's see. Did you take medications at any point in time for those diagnoses? Yeah. What did you take?
Zoloft and Valium.
Okay. Did the medication help?
Yes, it did. When I was on it, yeah, it did.
Okay. And did you do like treatment, therapy, counseling, anything like that?
Yeah, I did therapy for a little bit.
What did that look like?
It was when I was doing inpatient and outpatient, sir.
Okay. And how's your mental health right now?
It's great. I feel like now that I've been sober for the last 18 months, that it's really like helped me put like myself in perspective, like my whole life and stuff. And like I've been able to like take situations and deal with them as they come, those adversities while you're in prison,
Okay. How do you plan to apply that, on parole when the roadblocks occur, if there's mental health symptoms that are there or risk factors? What do you think you can apply in the community?
I think I need to reach out to people like my support system and maybe get back into treatment if it gets too bad and out of control, because I don't want to relapse and start using drugs again, because then my life just goes downhill from there.
Those are the questions I have for you. Now's the time. Anything else? That's really why we're here, is for you to express what you'd like the board to know. What else would you like the Board of Pardons to know?
I have it written down right here, sir. It says, during my time in prison, I've learned a lot of things. For one, that I'm accountable for all the choices I've made, good and poor, that those actions have consequences, whether I want them or not. They come, and you have to make the best out of the adversity you put yourself in. It may suck at first, but it might just be the thing to save your life and get you ready to face the world again. I'm glad I got to get treatment while in prison so I could get more tools to help me be successful in my life. While here, my cousin and I have really connected. He's given me the chance to have a fresh start in my life and really make a beautiful life for myself. He's going to let me parole to his house. He's going to help me get the life that I want and know I can have. It's the support and accountability I need and want in my life. I really just want to be happy and live a productive and successful life. I would also like the board to know that I did complete CBI and RDAP, and I do have the certificate for CBI right here.
Let me see if I've got,
It was not put into my OTRAC. I think MRT, anger management, and inside out are the only ones. But I also did do RDAT.
was the CBI and RDAT, was that part of the Beaver program?
Yes, sir, it was.
Okay, yeah, so the board's familiar with, right? They'll know when we see that you've successfully completed the Beaver program. We're familiar with the details of, okay, that's RDAT, CBISU, the different phases of it. So, but thank you for mentioning that. I'll note that you, one sec. I'll note that you had those certificates today at the hearing.
Okay.
Anything else you'd like to know?
With that time cut for the Beaver program, will I still get that even though I completed the program before I saw you guys?
So that'll be after, so this is kind of what I'm going to do. I'm going to take your case under advisement. I've created a report that from what I reviewed before today, I'll include what you and I talked about today into that report, and then I'll submit that to the members of the board, hopefully tomorrow. They'll vote and make a decision. It takes a majority vote to decide what to do. And their decision will incorporate that 4-month time cut. So, if they were to decide a parole is appropriate, whatever that date is, 4 months would come off as they're making today's decision. So does that make sense to you?
Yeah.
So I've got it noted for them, and when they're voting, that will be something that is incorporated.
Okay, that makes sense.
Okay. Anything else you'd like to know?
No, sir.
Well, Mr. Fillmore, thank you for being here today, coming prepared and discussing these things with me. I wish you the best of luck, and we'll go ahead and conclude.
Okay, thank you. Have a good rest of your day.
The rehearing for Isaiah Weaver, number 238327. Is that you, sir?
Yes.
My name's Scott Manning. I'm a hearing officer with the Utah Board of Pardons and Parole. I'll be conducting today's hearing. I am going to be taking testimony from you today. If you'd raise your right hand, I'll swear you in. Do you swear that the testimony you provide today will be truthful and accurate?
I swear.
Thank you. Did you receive at least 7 days written notice of today's hearing along with your blue disclosure packet?
Yes.
I don't imagine there's a whole lot in that new disclosure packet. I'm kind of going to go over what's in there. Obviously, that's the new information since your last hearing, and I'm going to give a summary here in just a minute. But part of today's, really one of the main purposes of today's hearing is to allow you to speak on that new information or any other information that you'd like to make a statement about. Are there any errors or inaccuracies that you've seen or any other statements you'd like to make about that information?
Yes, the only thing that I've seen in the institutional progress report, I'm showing on here that I did not complete anger management. I did complete anger management here in Beaver. I was just never given a certificate for it.
Let me look and see what I show.
Okay.
Yeah, so I show that you were in anger management from July until November of 2023. So that was before is your statement you've been in anger management since you came back in May?
No, this is just from last time I was here. I'm just showing that it's
so you completed anger management prior to parole. Is that your statement? Okay.
Yeah. And then the only other thing in the same report, starting at housing unit report, it seems to have someone's name on here that isn't mine. Because it says
Jet has not received any disciplinaries. Beaver County Jail staff state Jet is not a problem. And then on the summary recommendation underneath that, it starts with offender Weaver and again ends up as offender Jet. And I'm not sure if something just got crossed.
What page is that?
Page 4 of 11 in the
Yeah.
institutional progress report.
Okay, I'll note that. I think that probably is some sort of typo. But yeah, I'll note that you've brought that up at today's hearing for the board.
Okay, and that's the only thing that I noticed out of there.
Okay. Well, thank you for bringing that up as well. I'll note that, and if there's anything internally we can do with that, I'll take a look at it. So thanks for bringing those up. I'll note your statement that you completed anger management prior to parole. Obviously, that is inconsistent with the documents we have, but I'll note your comments on it. So what I'd like to do, I'm going to first quickly review what's happened leading to today's hearing. I have some questions for you from after that, and then at the end of the hearing, I'll let you state on the record anything you'd like the board to know.
Okay.
So you returned from parole, your first and only parole in May of 2024. The violations were for having a sexual relationship with a 17-year-old female. I think you were living at the halfway house and doing the SOTP program at that time for previous pornography violations, and it said you met this individual in the community and had, quote, repeated sexual encounters with this minor while you were living at the halfway house, obviously when you were in the community having left. You had a parole violation hearing in July of 2024. At that hearing, you admitted to the allegations related to the sexual relationship with the minor. I think you stated at that time she, quote, lied about her age. I think you said you suspected that she maybe was underage, but you did not verify that. Yeah. The allegations were accepted as technical violations because prosecutors decided to not file charges. After that hearing, the board scheduled today's hearing with a sex offender treatment assessment that we requested. The board at that time invoked a public safety exception to the parole violation cap, and also the need for additional information as an exception to the parole violation cap. As of today, let me just update this and see if this has changed. As of today, we have not received a sex offender treatment assessment that was requested. Obviously, that's really the reason today's hearing was scheduled, to discuss that assessment. It's possible that the board could wait and to make a decision on that until they have received one assessment. It's also possible, the board could make a decision with the information they have. I do know, so 3 days ago, just to let you know what's happened, we checked to see the status of that assessment. A representative from the sex offender treatment program in the Department of Corrections sent an email to the Board of Pardons. This email said that the assessment had, quote, been missed, and they did state at that time they would, quote, get a basic assessment to the board. So they were planning to get us an assessment for today's hearing. We've not received that as of now. The email did state, I'm quoting here, since he reoffended, we would likely want him to do treatment while incarcerated. We do not have the assessment assigned to anyone at that time 3 days ago. So if the board needs an official letter, they could draft one up with the static assessment tools. But they said at that time, they wouldn't be able to have someone sit down with you and do the assessment. So that's the communication I've received. So my question for you with that, if the board does receive an assessment, would you like me to request that the board reschedule a hearing so that you can review that information and have a hearing to discuss it with us? You have the right to receive these things. So would you, at that point, if we did receive one in a future time, like tomorrow or whenever we do receive it, would you like me to postpone the hearing so that you could receive and review that assessment? Does that make sense to you?
Somewhat. I don't understand why they've said that it was missed.
And so there was a miscommunication. They just didn't do it, right? That's for whatever reason. I don't know the reason, but it didn't happen. The assessment was not done. So I don't know the details of that, but they haven't done it. They were planning to get something to us by today, but that hasn't happened either. So it could be coming. I don't really know what we will be receiving. So if you'd like to, but then again, I'm not sure that we will receive anything. So we could continue with today's hearing, give the board an option to make a decision without the assessment. But what I'm asking you is, let's say tomorrow an assessment comes in, okay? You would have the right to receive and review that document because the board would consider that as they're making their decision. If we do receive one tomorrow, would you like me to postpone the hearing so we can get it to you and have another hearing at a future date? Or would you be comfortable moving forward without reviewing that?
I'd be comfortable moving forward.
So you'd like to waive any disclosure of any documentation that we receive from the sex offender treatment people?
Yes.
Okay. But that's the general input that I received is they said, since he reoffended, we would likely want him to do treatment while incarcerated. Obviously, the board will consider what happened on this most recent parole thoroughly with all reports, and I will assure them that they know exactly what happened with that. They will also consider that input that the sex offender treatment program people provide. Those will all be factors, but ultimately the board will make a decision on any treatment that's needed. Does that all make sense to you?
Yes.
Okay, so we'll proceed with today's hearing. We'll talk about all the questions I have. You've waived disclosure of any assessment, and then we'll move forward with that. So just to review, your maximum expiration of sentence date is August 3rd of 2035. That's the 1-15 from 2018. The applicable parole violation cap or guideline is 180 days because this was the first violation. That will pass on November 4th of 2024. Of course, the board is not bound by that guideline. They can invoke various exceptions to deviate from that time frame. They previously did invoke the public safety exception and the need for future information. So it's possible that they could do that as well. I did want to ask, so you've been given multiple opportunities to complete treatment in the community. So I think you did high school and MRT, and I guess you've said anger management prior to parole. You had chances to do sex offender treatment on probation prior to prison, and then you had an opportunity to do it on your first parole. If you're given another chance to do programming treatment in the community, what do you plan to do differently so that you can have a better result or you can be successful?
So one thing I want to do, and I've talked with my girlfriend about this, is I want to hold myself a little bit more accountable because when I was in the halfway house to start with, I wasn't required to do anything in the halfway house. And so it was left up to me to go and find therapy through an outside provider outside of the halfway house. And one thing that I've discussed with my girlfriend recently was that we want to have, I guess, more regular check-ins with probation or with parole. So instead of saying, we're going to see him, next month, see what's happened next month. If I go in that next month and I haven't found anything yet, then it's kind of just okay, get it to me by next time I see you.
You essentially have check-ins every day while you're at the halfway house. Am I misunderstanding that?
No, so when I was at the halfway house, I think I was seeing my PO every 2 weeks, but we weren't keeping to anything like a checklist, I guess you could say. Talk to me about what you've looked for therapy this week, or talk to me about what you've looked for employment this week. And I think I want to set something up like that. And I also want to have more contact with my girlfriend and my case manager or parole officer, because currently there's a complete disconnect and they have no idea about each other.
Okay, thank you for explaining that. I think I'm understanding what you said that second time. But I guess my question, so I guess if you're allowed to do sex offender treatment in the community, you would be more involved, put more of an effort into checking in, holding yourself accountable in those programs. What from the treatment that you've done, because you've done some, you've never successfully completed sex offense treatment, you've done some. What are your risk factors that you've identified?
I have a very large problem with pornography. That has always been a struggle for me. I think it's because I get too much time alone, and I start thinking deviant behavior again, and I've just got no contact with anybody, so I just go ahead and decide to do that, barring the risks.
Okay. And there, because you had on this last, I think about 3 months before the violations that led to you being returned, you had violations for pornography use. The report we received was quite general as to what that included. It seemed like for a number of weeks prior to getting a job, you had viewed and accessed different types of pornography. Did you access child abuse, sexual material, or child pornography during this time?
No. So what I explained to my PO when he had caught me for looking at pornography, there had been getting onto my old Google account again with a smartphone, because when I was on probation originally, I had a smartphone and then moved to having a flip phone.
Okay.
And getting back onto the smartphone again, there was still old material from when I had that smartphone originally, because it was linked to my Google account.
Mm-hmm.
And so I
Damn you,
prove
from
that
before prison that time.
there. What?
That was a smartphone from before you were sentenced to prison. Is that what you're stating?
It was the same account, not the same phone, but it was the same account.
Okay. Gotcha.
So your
Okay.
phone got synced
Sorry
to
to
your old,
interrupt. I just want to
your
make
old
sure I
Google
understand.
account.
Yeah, that account
Please
has
continue.
deleted, and I have created a new email.
Okay.
What happened to your Yahoo account?
So you were using pornography for a period of weeks during that time. What do you think prevented you from dealing with that risk factor, that behavior appropriately?
I think I have a very hard time actually accepting the fact that it's something wrong.
Yeah.
And that's in regards to like sitting down with my PO and actually, bearing the truth and telling them what's been going on. I have a very hard time doing that. I was getting better doing that while in the halfway house, obviously not 100%, but it was something that I've been working on myself, and not only with parole, but with my family as well.
Okay.
Because it's been a long time where I've just held on to a lot of things and not told them anything.
Okay. And at your previous hearing, you said you did not know how old the minor was with whom you were having a sexual relationship. Is that still your statement, that you did not know this person's age?
Yeah, so when I originally had talked to her, when I originally met her, she told me she was 19, and I believed her off of that. Mostly because while I was out in the community, she was not, attending school and was going to a job. So I kind of just assumed what she was telling me was the truth. And then when I was arrested, I think it was Detective Buck out of Ogden. I think it's Ogden PD. Even told me that in her statement to me, or to him, that she had lied to me about her age.
Okay.
I hate the old line
But I
about
also
the age
didn't
thing.
investigate at all. I didn't check and make sure. I didn't ask any questions. I went with it.
Okay.
You know what it was.
And then, so as far as I know you don't have any disciplinaries. Housing staff gives a positive report of your behavior and attitude in the institutional progress report. As far as your release plan and the written submission that you gave to us, it said you plan to live with your girlfriend in Ogden. Is that still the plan? Is this the same person, or is this a different person?
This is a different person. That me and this girl, her name is Rebecca. We started this relationship while I was incarcerated in Weber County, and I had known her before that. She's the same age as I am. She's 25 years old. I don't think I'm going to be able to live with her initially, just because I don't know how her landlord feels about it, and me being on the registry and a felon.
Yeah.
We don't know 100% if he's adverse to the idea. I still need to talk to him.
Okay.
But if anything, I would probably have to go to a halfway house first for reason.
Yeah, and that just to on that note, considering the circumstances here, I don't know. It's ultimately up to the board, but I would imagine that if the board does decide to allow community treatment, I would think there's a pretty good chance that it would be required to be at a halfway house due to the behavior. That's a possibility, but are you willing to do any treatment where and when the board does order that?
Yes. And I figured I'd probably have to go to the halfway house, just because of what happened. Just because I don't figure the board would want to just, release to an address and see what happens from there.
I don't want to predict or speculate about what the board would decide because that, they make a majority vote decision, but certainly just want you to be aware that they'll consider the facts and circumstances in totality as they are. And that was just a thought that I had.
Yeah, thank you.
Those are the questions that I have for you. If you have anything else you'd like the board to know or any other comments about your release plans, please go ahead.
As far as release plans, I think I've got a job that I can get lined. I just need to talk to them really.
That's Associated Foods, is that?
It's at Associated Foods working in their warehouse because I have my girlfriend, one of her friends works in their hiring. So he said he'd give me a shot, let me come in and do an interview as soon as I get out to go and apply for there. And as far as I know, places like that, Associated Foods, their warehousing and everything like that, they tend to let people work there pretty easily. So I don't think that's going to be very much of an issue. I think that's all I've got.
Okay. Well, what I'll do from here is take your case under advisement. I've put together a report of what I reviewed before today. I'll include what you and I talked about today. I'll also include the information regarding that sex offense assessment. As I mentioned before, that really was the reason we had today's hearing. So it's possible the board could say, let's schedule another hearing with a complete assessment. So that's a possibility that they could make that decision after today's hearing, but I'll present them with all the information so that they can make a decision as they see fit. So that usually takes a couple of weeks. I'll submit my report hopefully tomorrow, depending on if we receive anything, but certainly hopefully by tomorrow. The board that makes decisions 2 to 4 weeks. Generally, we'll send it to you in writing once that decision is made, and then it will also be posted to the Board of Pardons website if there's anyone in the community that would like to access it there. So with that, Mr. Weaver, thank you for being here, answer my questions. I wish you the best of luck moving forward, and we'll go ahead and conclude.
All right, thank you.
Can you hear me, Mr. Trujillo?
Yes, sir.
Okay, we'll get on record and they'll let us know from Salt Lake when we're on record and then we'll start.
All right.
On record.
This is a rescission hearing for Kyle Trujillo, number 223819. Is that you, sir?
Yes, sir.
My name's Scott Manning. I'm a hearing officer with the Utah Board of Pardons and Parole. I'll be conducting today. I am going to be taking testimony from you. If you'd raise your right hand, I'll swear you in.
All right.
Do you swear that the testimony you provide today will be truthful and accurate? Excuse me. Do you swear to tell the truth today?
Yes, sir.
Okay, thank you. Did you receive at least 7 days written notice of today's hearing along with your blue disclosure packet?
Yes, sir.
Okay. The purpose of today's hearing, I'm going to kind of go over, I'll let you make any comments. Before we start, I guess, do you have any questions or concerns about that disclosure packet? Any inaccuracies you'd like to mention? Okay.
No, sir.
So the purpose of today's hearing is to discuss why your parole date was rescinded. It looks like the Department of Corrections notified us and they requested that your date be rescinded due to a disciplinary conviction. So I'll just go over it. You had a hearing in July 2024. After that hearing, the board granted parole of August 27th, 2024. On August 12th, 2024, the prison notified us, they requested your date be rescinded because while in Davis County Jail, you quote, produced a positive urinalysis test. I note that this incident occurred prior to your most recent board hearing, the July 16th, 2024 hearing. You know, it wasn't included in the prison's report to us for that hearing, so it was never actually reported at that time. So the board rescinded the date due to the disciplinary violation and scheduled today's hearing so we could discuss that disciplinary violation. So it was an A13, June 27th, 2024. The reports that we have don't state what you tested positive for. It just says you tested positive for something. What did you use at this time?
It said I was positive for amphetamines.
So the test said you were positive for amphetamines. Did you use amphetamines?
Like I said, like I share stuff, and so I mean, I tested positive, so I mean, obviously I was using something. I mean, I can't say that I wasn't if I tested positive, you know what I mean? So I'm not gonna beat around, I'm not gonna lie or anything, so
So you did use amphetamines at that time?
yeah.
Okay. When's the last time you used drugs or alcohol?
That was it.
This was the one and only time. Is that your statement that since you've been back?
Yeah.
I do note, so my records show a pending disciplinary from February 23rd, 2024, or 2024. So that's been a number of months, 8 months that I think it still shows as pending. The report I show says that you had homemade alcohol in your cell. Do you remember this incident? Did you have homemade alcohol, or would you like to make a statement about that?
Yeah, they gave me it was a B11 write-up, I believe.
Mm-hmm.
And that was that was
February.
8 months. Yeah, that was 8 months ago.
Yeah, 8 months ago. So that's what I was saying. It shows as pending. So it's not been a conviction. If you don't want to talk about it, because it hasn't been a conviction, you don't have to, but I'm showing it here. So did you use alcohol? Would you like to make a statement about that?
Yeah, no, there's some alcohol in the cell that I was living in, but I didn't test positive for alcohol or nothing.
It was in your cell. Did you know it was
Yeah.
in your cell?
I told him that it was because the cop came in and he's seen it, and like I said, that's all what happened. And he's like, well, I'm just gonna give you a little write up. He goes, nothing serious because you were honest. And I was like, yeah. He's like, if I would have knew, I would have said, like, wouldn't even have had that. But that was the incident.
So if just to make sure I'm understanding you correctly, there was homemade alcohol in your cell. You knew it was there, but you were not using it.
Yeah.
And you told the officer where it was. So you don't know whose it was or why it was there. It just, you knew it was there.
Yeah.
And you were not using alcohol.
No.
Okay. Well, those are the questions that I have for you. Is there anything else you'd like the Board of Pardons to know?
Yeah, like I said, I had him submit, my dad passed away since I've been down, just back in August, and my grandma's been struggling. So, I mean, I got to do the CCC program at the halfway house, the residential program. And I've been talking to other people from the Haven to try to do that program at Fortitude, and then go to the aftercare at the Safe Haven or some other kind of program, so that way I can hurry up and just try to get immediate release, so that way I could help my grandmother / mother, because there's no one else out there helping her right now. And I got my job and everything still out there. I talked to my boss. I work at the Salt Palace, and she said that she's holding it for me. So, I mean, I know these write-ups. I caught this write-up, and that's what caused my date. But I would like to try to do the best I can and get back to the community and start doing my obligations that my parole is asking me, so that way I could help support and manage my family and help my grandmother / mother.
Okay. Well, thank you for your comments. Just to review, I think your expiration date is September 2025. Obviously, your guideline was November 28th, 2024. The parole that they granted after your last hearing was before the guideline. It did include that condition to complete treatment as recommended while on parole. After today's hearing, what I've done is I put together a report of everything I reviewed before today's hearing. I'll include in that report what you and I talked about today, and then I'll submit that to the members of the board, hopefully by tomorrow. They will then make a decision on the appropriateness of a release, and if so, the timing and conditions of such a release. Usually that process takes between 2 to 4 weeks for a decision to be made. We'll send it to you in writing through the mail, and it will also be posted on the Board of Pardons website. So I'll recommend that the board affirm the prior decision and then get that submitted to them by tomorrow. With that, thank you for being here and answering my questions. I wish you the best of luck moving forward, and we'll go ahead and conclude today's hearing.
All right, thank you.
You're done?
Yeah.
I hate when they do that, when they don't turn on the audio. Hopefully they turn it on soon. I believe this is going to be Heath Wade Anderson. If they're following the list right now, that's who should be up next.
954, is that you, sir?
954, yep.
Yeah, 149954.
My name's Scott Manning. I'm a hearing officer with the Utah Board of Pardons and Parole. I'll be conducting today's hearing. I am going to be taking testimony from you. If you'd raise your right hand, I'll swear you in. Do you swear that the testimony you provide today will be truthful and accurate?
Yes, sir.
Thank you. Excuse me. Did you receive at least 7 days written notice of today's hearing along with your blue disclosure packet?
Yes.
So that information is the new information since your most recent hearing that the board will be considering as they make a decision after today's hearing. Part of the purpose of today's hearing is to allow you to speak about that information, point out any errors or inaccuracies that it contains, and make any comments you'd like to. Are there any errors or inaccuracies you'd like to make before we start with today's hearing?
No.
Okay. And I have some questions prepared. And so what I'd like to do today, I'm going to quickly review what's happened leading up to today's hearing. From there, I have some questions for you that I've prepared. And then at the end of the hearing, I'll give you the final word. And you can state anything else you'd like to on the record.
Okay.
So you returned from your first parole of this commitment in October 2021. The violation was for exposing your the violation probable cause said your 15-year-old daughter to methamphetamine, quote, hoping she would use it and sexually assaulting this victim. You had a parole violation hearing, an original hearing in June of 2024, so about 4 months ago. You admitted to the allegation at this hearing, but you did make the statement and claim that the victim was age 20. And you did, I've reviewed that hearing. You claimed you did not remember anything due to a sleeping medication you had taken. At the time of the hearing, you had been convicted of sexual battery, misdemeanor A, for the incident. The official version of the sexual battery case says the victim was 15. It provides details of the sexual assaults on the night of the incident, and also mentions previous physical assaults of this same victim when she had refused your sexual advances. You had also been convicted, I believe, of an assault by prisoner for an incident that happened after you returned to the prison. So just so we're on the same page of what's happened leading up to today. After the June 2024 hearing, the board revoked your parole and scheduled today's hearing with a sex offender treatment assessment. So the primary purpose of today's hearing is to discuss with you that assessment. I've reviewed your comments from the past hearing. Certainly the board will consider that information as they're making a decision, but I'm not going to primarily focus on things that have already been discussed. Having said that, this hearing is for you to make any statements that you'd like the board to know. So don't let my comments or questions prevent you from stating anything that you'd like to in that regard. Just to review, as things stand, you have an aggregate maximum expiration date of November 13th, 2026. Your parole guideline was 13 months. That guideline passed in October of 2022. I believe about a year passed between filing of the case and then the assault occurred within that guideline. So that is partially why, that guideline happened as it did. Obviously, the board is not bound by the guideline. They really have discretion. They'll consider all relevant factors in your case after today's hearing to determine what's appropriate from there as far as a release, and if so, the timing, conditions, contingencies of any such release. So for this hearing, I have some questions for you really about the sex offense assessment referral form, but did you receive a copy of that document?
So on that, so on June 18th, when I went to the board hearing, my original hearing, the findings was that they wanted, to refer to this day on the grounds that we would do a SOTP evaluation.
Yeah.
And I received in the last 2 weeks or whatever, my blue packet that has the results of that evaluation. Is that what you're talking about?
So what I'm talking about is a document dated September 4th, 2024, entitled, quote, Sex Offender Assessment Referral Form. It is, let me pull up the specifics here.
By a Gregory Grubb or something like that?
Excuse me, 1 second. Yeah, so it was conducted. It's signed by a Gregory Rugg. So
Rugg.
the assessment, so that's the assessment that I'm talking about. So you did receive that document.
Yes,
Have you reviewed that and looked into it? Do you have any thoughts about that? What are your thoughts about the document?
Well, so based on that, it says that I've got assessment was due on the grounds of a sexual nature, and it puts me as 5.1% chance to reoffend.
Yeah, so you fall within the level 3 average risk to reoffend using the static 2002R and the bar 2002R. So yes, as far as sexual reoffense, 5.1%, general reoffense, 28%, and violent, including sexual, 17.8%. That's the standardized risk. You fall within a bucket of individuals. Your demographic and risk factors under those assessments fall within the average risk. That's what that means.
Okay.
Does that make sense? I'm sorry to cut you off if you had more to say about that.
No, I didn't notice that said a violent sexual nature at 17%.
Violent, including sexual offenses. So violent in general, which also includes sexual. So sexual or non-sexual violent offenses, it lists a percentage of 17.8. That's the standard. You're within a group of people that fall into that risk percentage. So that's what that says. But I have some questions about it. I'm planning to review it with you. But if you have other questions or concerns before I do that, please go ahead.
Well, I was unaware that there was multiple statements by the witness stating that I had assaulted her multiple times.
Well, the official version of this new case states,
For sure.
the victim stated she pretended to be asleep and did not verbally refuse due to previous incidents in which he physically assaulted her after she denied other requests he had made. And she was fearful that that would happen again. That's what the official version of the case states. So that's where I'm getting that.
Yeah.
You should have received that official version of the case in your disclosure packet before the hearing you had a few months ago. That should have been received at that time. But I guess I was planning on talking about that case. I can get your statements about that. So is it still your statement that you do not remember the incident at all because you were using a sleeping medication? Is that still your statement?
Yes. Yes, that's the truth.
Okay.
That's why I don't understand why it says that there's multiple.
My understanding is that the victim told officers that she, in the past, you had physically assaulted her. Not that you were convicted of that. That's just what the official version says, of physically assaulting her after she had refused advances. That's what it's saying there. So do you deny that any past assault occurred? So you don't remember any assault at all?
Oh, there was no past assaults. That's
okay.
So I have a lawyer who has been working with me, and I was in Eureka, Nevada at work. I work on the rig, and I was out of town working. And she said that there was a complaint which resembles what you're saying that was filed when I was out of town. So it could be possible.
Well, I'll note that. So your lawyer states that there was a report made while you were out of town?
Yeah.
Okay, well, I'll note that for the board.
And that's the one the one you're telling me about.
I'm reading from the official version of this new case, which we disclosed to you. You reviewed prior to your previous hearing, I assume, and you discussed at this last hearing. So I'm glad we brought it up so we can talk about it. So you deny you don't remember anything due to sleeping medication. You deny, so you do not deny that this current assault happened, but your statement is you don't remember it, but you don't deny that it happened. I just want to understand you correctly. Is that accurate?
So, yeah, and it wasn't in October, it was in September. I was locked up in jail in October. So I came home from Eureka, Nevada on September 11th.
Yeah, that's the date I have. September 11th is when this current offense occurred.
Yes.
So you don't remember it occurring, but you don't.
And this is the truth of it. So like I said, I was working out of town on the rig. I worked the night before. I drove home an 8-hour drive and went to a viewing, my grandmother's viewing, and that evening, I took a sleeping pill or whatever because I had the funeral the next day. And so I took a sleeping pill that night so that I could make sure that I was, got all my sleep and caught up on this. Because at that time I was back on my normal nighttime shift, So I took that sleeping pill and.
Yeah, so that's my understanding is you've said that in the past of you don't remember because you had taken that sleep medication. And you don't deny that the assault occurred, but and so thank you for explaining.
Yeah, I don't want
That's
to
my
deny
understanding of
that.
it. And do you deny that you exposed the victim to methamphetamine? The allegation said you were, quote, hoping that she would use it. Did you expose the victim to methamphetamine?
No.
Okay.
So this is I know what she's referring to.
Okay, what was that?
So I went to she came with me, and we went to my girlfriend's and to eat enchiladas that night. And I called her, my girlfriend. I told her, I said, hey, we're here, whatever. She lived in an apartment. She's like, all right, well, just come in. I got to run down to the neighbors or whatever. And for whatever reason, I don't know what it was. And she's like, the house is unlocked, come in. And I went in, and my daughter, she says, I need to use the bathroom. I'm like, go ahead, go use the bathroom, you know? And so at that point, I had walked into the bathroom I went into the restroom after she had left, and I noticed that, yes, that there was a pipe in the ashtray in the bathroom. It wasn't like some kind of organized effort to expose it. It was a complete accident. That's the one thing that I would never try to interfere with my family life, is to expose any of my family, let alone younger people, to drugs. I would never want to do that, because I know how drugs has affected my life. So that I never did anything purposefully to expose her to it. It was an accident, that event.
Okay. Thank you for your comments. This is, I will note those comments and report those to the Board of Pardons. And your statement is the victim was 20 years old at this time. Do you know why the official version of the case describes her as, quote, underage and 15 at the time? Do you have any insight into that? Or was that discussed at sentencing, the pre-sentence report? Do you remember?
Yeah, she said that night, and I did bring that up at the last one, and that's what I'm saying. Look, I don't know how to say this to make it look like I'm not accepting responsibility, or that or placing blame on somebody else. Okay, but so let me tell you, one time, I'm just going to tell you, and you guys can do whatever you do with it. When my daughter was 14, I'd lost custody of my daughter when she was 2. When she was 14, her foster parents called me back, and they said, hey, do you want Morgan back? She's being a little hellion, whatever you want to say. She beat up Retha, who was the stepmom. She ran away from home. She's been fighting at school, and so she's in this Journeys or Mind Springs in Grand Junction, Colorado, which is for some kind of clinical stuff for juveniles or whatever. And at that point, I'm like, yeah, I'll go take her. And so I went and picked her up. She called me at Walmart in Grand Junction. I go pick her up, and I bring her home, and she's being a knucklehead at 14, thinks she's a Juggalo gang member and trying to act tough with me. And so I found her in the bathroom with a roommate of mine who was a younger. This girl was only 19, and she was my girlfriend's brother's girlfriend, and she was like 19, so they're really in that adolescent age together, so they kind of got along. Well, I went to go in the bathroom. I'm like, what are you doing? And they're like, oh, we're just going pee. And I'm like, well, I said, well, we're leaving. This place is not good for me to be having my kid here with her, so let's go. And she's like, hold on a minute. And so I went to push the door open and tell Jessica, I was like, Jessica, get out. So she said, she got to go to the bathroom. You get out so we can finish our business here and move on. We're going to my parents' house because I don't like what's going on in this situation. So she says, hold on, I'm not leaving. And so it turns out they was in there smoking meth. I didn't know this, but I still wanted that to leave. So I went to push the door in to tell Jessica to leave, and they slammed the door on me, and I put my foot in front of the door so it wouldn't close, and I pushed the door back. And at that time, of course, I'm a man, I'm more stronger. I opened the door, and I told her, Jessica, get out. Morgan, do whatever you got to do, and we're leaving. And so she threw a big fit, and I told her, well, fine, if you don't want to pack your stuff, I will. She went out on the porch. I said, go sit on the porch and wait. I'll be out there in a minute. So at that point, I turned her in. She ran away, and I turned her into juvenile services or whatever. And I just wanted her to sit there over the weekend, so because I couldn't control her. Right? She's throwing a fit. Well, I went to go pick her up on Monday, and they told me that I had charges of. They said that I kicked the door in, wrapped the shower curtain around her neck, pushed her in the bathtub, and beat her, and left bruises on her. That was the official statement. That's what she's referring to as a physical.
Oh, that's the physical. Okay, well,
That's
I'll
what
note
she's saying.
that.
So,
Okay, yeah.
So what I'm getting at here is my daughter has some resentment towards me, and she does stuff out of spite.
Let me see. Eric's writing now. Working and doing things with the family.
So,
Hell yeah. Hey, I'm gonna be in that area.
I mean, that's the real of the situation, but I can't. So that's why I took a Class A sexual assault on this, just because I want to end it. We're never going to get a closure on it between her and me. I mean, if that's the way how she wants to treat me, as I'm trying to be good to her the best I can be, then I have no reason to move forward. She's an adult now, and she can take care of herself. So yes, I have been blamed for several stuff from her.
Okay. Well, I'll note your comments on that. That's why we have the hearing, to get your statement. So thank you for providing that. I will relay that information to the board as they make a decision after today's hearing. We're just about out of time. The assessment goes through various details and past programming, past history, criminal history, past supervisions, which I've reviewed and generally correspond with what I've reviewed prior to the hearing as well. As far as recommendations, it says you could benefit from sex offense specific treatment either while incarcerated or, quote, when you are released and under community supervision as best determined by the Board of Pardons and Parole. So certainly after today's hearing, that is the board's decision. My question, are you willing to do sex offense specific treatment as the board, if and when the board orders that?
Well, so I've already took steps to hire my own therapist through Northeastern Counseling, and they are willing to provide whatever treatment I need. It's been noted in both my blue packets and at the last hearing.
I have that. So Northeastern Counseling, if the board requires it, you'll do it there. And that's up to the board, right? After today's hearing, they could make that decision. You have, about 2 years of jurisdiction remaining. So they'll consider the case as a whole with all relevant factors and determine what's appropriate. So you have a plan for Northeastern Counseling in the community. Would you be willing to do treatment, any portion of sex offense treatment while incarcerated if the board ordered that?
So it looks like that's the way you're leaning.
I'm not.
I can't deny it. I mean, what's going to get me out of here the fastest?
Okay, so you're willing to do what the board requires. Am I understanding that correctly? Yes. Okay.
Yes.
And obviously, my job here is to obtain information, provide information to the board members. There's 5. They make the ultimate decision. So I think getting insight into your thought process is kind of what I'm looking for. So thank you for that.
Yeah.
You don't have any what was that?
Yeah, of course I have to apply myself. And so, I mean, my concern is to be able to get out and take care of my grandmother. She's 85, she turns 85 today. My grandfather died. She got to go through another winter. I mean, if we could throw out maybe like ankle monitor or something and therapy, through Northeastern Counseling. I know that it's ultimately up to the board, but I mean, that's kind of along the lines of my idea of a negotiation. I would like to throw that out there.
Okay, well, I'll note your preference in your statements on that. I definitely will. We're getting close on time. I do want to quickly note, you don't have any disciplinaries. Looks like you have a job in the kitchen you've had for about a year, good rating. Housing staff gives a positive report, describes you as a dependable worker, and they say you seem to not engage in any negative activities. So I'll report that to the board. We are just about out of time. I've gotten quite a bit of statement from you today. Quickly, before we finish, anything else you'd like the board to know?
Yeah, would you please, also along that same note of taking care of my own counseling is, I have recently completed, Mentor Works, which was an outpatient program too. You know, so I mean, I'm capable of completing programs in multiple different environments. That your review already says that, so. I would just really like to express the fact that I would like to, do an outpatient program to where I can be there with my grandmother. I'm sure you should have several letters from her too.
Let me see. You know when they were sent?
They was in at my last. Oh wait, so at the last board hearing they wasn't there, but they did.
Yeah, we've got them. We've got a number of written submissions. I think they were back in 2022, but I do have them summarized in my report, so the board will be aware of those. It's been a bit of time, but we do have those.
Okay.
Well, this time I'm going to take your case under advisement. I've put together a report of what I reviewed prior to today. I'll include in that report what you and I have talked about today. I'm going to hopefully submit that to the members of the board by tomorrow. As you know, there's 5 members of the board. They make the decision by majority vote, as I've previously explained. That usually takes a couple weeks for a decision to be made. It can be quicker than that. It can sometimes take a bit longer than that. Once the decision is made, we'll send it to you in writing through the mail, and it will also be posted to the Board of Pardons website if there's anyone in the community that would like to access it there. So with that, Mr. Anderson, thank you for being here today and discussing these things with me. I wish you the best of luck.
Yeah, what kind of recommendation do you feel like you're going to give them?
Yeah, so I'm instructed to not state my recommendation on the record. Ultimately, we don't want to set any sort of expectation or speculate. I don't have a vote. There's the board member, so I'm not going to say that today, but I do assure you I will provide a thorough summary of all information that we've reviewed and your case, and then the board will make that decision.
Okay.
Okay, well, thanks. Have a good day.
Thank you.
We'll go ahead and conclude today's hearing.
I'm gonna have to make those two disclaimers before I upload those videos.
Two 210-203, is that you, sir?
Yes.
My name's Scott Manning. I'm a hearing officer with the Board of Pardons and Parole. I'll be conducting today. I am going to be taking testimony from you. If you'd raise your right hand, I'll swear you in. Do you swear that the testimony you provide today will be truthful and accurate?
Yes.
Thank you. Did you receive at least 7 days written notice of today's hearing along with your blue disclosure packet?
Yes.
Did you have a chance to review that disclosure? Obviously, that's the new information since your last hearing that the board will be considering. Do you have any questions or concerns about that information?
No.
So, yesterday, the Board of Pardons received a sex offense assessment referral form. It's dated September 24th of 2024. I had that sent to you, to your case manager. Did you get a copy of that document?
He hasn't given it to me yet, no.
What county jail?
Okay, really, that document is the reason we have today's hearing is to discuss that document. You have the right to receive it and review it and prepare to respond to it prior to the hearing. If you would like to, we can postpone today's hearing and reschedule it for a later date so that you can receive that and review it. Or if you're comfortable waiving disclosure of that document, we can proceed today, and I will go over what it says with you if you'd like to. How do you want to proceed?
Let's just go ahead and waive it and continue with the hearing.
Okay. Well, I'm going to give a quick review of what's happened to start, what's happened before today's hearing. From there, I have some questions that I've prepared to ask you, and then I'll let you state anything you'd like to on the record at the end of the hearing. So you returned from your second parole in October 2023. You had a parole violation and original hearing about 3 months ago. I conducted that hearing. You and I discussed what happened on your last parole, the new case, the new conviction, your present and past and future programming, your release plans. We discussed all of that information a few months ago. I'm not going to be focusing on that information again today, but the board obviously will consider that. And if you have any other comments you'd like to make about those things, you certainly can today. But the main purpose of today's hearing, let's see, so after that hearing, the board scheduled today's hearing with the sex offender treatment assessment. So that's the real purpose, is to discuss that. So that's what we'll do. Just to review, you have a maximum expiration date of August 31st, 2028. So that's the longest amount of time that the board can retain jurisdiction over your case. Your guideline called for 12 months of incarceration. That passed last month. Your guideline passed. The board obviously is not bound by that guideline. They will consider your case as a whole after today's hearing to decide what's appropriate. Okay, so the sex offense assessment form, it reviews your criminal history. So it talks about your juvenile offenses for lewdness. It discusses that in one of those cases, it says, quote, you were seen masturbating near 2 children ages 5 and 7 years old. It talks about a 2015 disorderly conduct conviction that it says involved 2 15-year-old females in that case. It discusses your latest parole. So the parole where you went to Seattle that we talked about at the last hearing. It talks about the conviction from that last parole. So the failure to register as a sex offender case where you fled to Oregon, were located and then extradited back to Utah. It discusses your past attempts at probation and parole. It says your past violations have generally been for being charged with failure to register as a sex offender, also for absconding parole. I know that you and I talked about that quite a bit at your last hearing, so we've discussed a lot of that information. This document also discusses your history of sex offense specific treatment. So the treatment that you did at NUC in 2014, the outpatient treatment in 2015, that you successfully completed the sex offender treatment program in San Juan County in 2022 prior to this most recent parole. The document identifies a well above average risk of reoffense using the standard risk assessment tools. So using the static assessment tool, let me just pull up the specifics here. Well above average risk using the static 99R, and then using the stable assessment, they placed you in the high density category for dynamic or changeable risk factors. It talks specifically as your risk factors being significant social influences, capacity for relationship stability, problem-solving skills, and deviant sexual preference. Those were identified as relevant areas of treatment, so areas where treatment would be needed. What are your thoughts about those risk factors?
I think that I definitely have some stuff I need to work on. And I have some classes I'm doing here, so they kind of help out a little bit.
Are you doing what classes are you in?
We have tablets here, and there's a whole list of classes that we have access to, and I've completed several.
Okay. What have you learned? What do you think? What do you plan to change and do differently from what you've learned?
I've definitely noticed that from when I started the classes to now, I've noticed that like a lot of that mindset has switched from a negative look to a positive outlook, and there's not as, I don't think, I know that I still need to make progress, but I have definitely made progress in starting these classes, and like I can just only improve from here.
Okay. Okay. So it gives a summary. It talks about your history of sexually motivated offenses and parole violations. But it does say you're no longer under custody of the state of Utah for a sexually motivated offense. It notes that you are under state custody for only failure to register as a sex offender. It says this speaks to your current problems, which it states are absconding from parole, failing to attend required treatment, and continuing to struggle with rules and regulations. Based on that, the evaluator recommends that you complete the building resilience portion of the sex offender treatment program. I think that's the relapse prevention portion of the class. That is a 12-week program, and it includes group and individual classes within that relapse prevention portion. This person also recommends that you do a class, what it just says, a cognitive skills class, like unlock your thinking or thinking for a change. It recommends that you complete those classes before you are granted parole, before you are released. After completing those classes, it recommends that you parole to a halfway house or another, quote, highly supervised facility where you will be offered, quote, graduated reintroduction into the community. So she recommends, or this individual recommends, transitioning through a halfway house or a similar facility on parole. And she also recommends that you do sex offense specific treatment while you're at the halfway house or that transitional facility. So that's the recommendations that are made by this evaluator. Does that make sense to you?
I think so.
What are your thoughts about that?
The only one that I really have is like just based on past probation and parole history that I have. I don't have a good track record of being on probation or parole. Like I end up running or something like that, and I just like when I'm off of parole, I do good, but for some reason my head when I'm on parole just kind of doesn't process things like it should, and I end up leaving and now.
Okay. Well, I'll note your comments, and at your last hearing, you told me that you wanted a termination, but you're willing to do parole if the board requires you to do that. Is that still what you're thinking?
I've been thinking about that since the last board hearing, and I think, at least from some of the thoughts that have went through my head since the last board hearing, is that if I'm allowed to go back to a place like Portland where I have a job waiting for me and I have housing and I have all this other positive stuff going for me, I feel certain I could do parole there because I have a big support system. I'll have a good job. I'll have stable housing, be around good influences. But it's like I said in my last board hearing, I don't really have anything here, and that's why it's so hard for me to do parole here.
Yeah. And I think we talked about at your last hearing, if you'd like to transfer supervision to another state, that it goes through the interstate compact process. Do you remember us talking about that? So am I understanding correctly that, so let's say the board says they grant parole, they ask you to complete the relapse prevention part of the program. And then they also require you to do sex offense treatment in the community, like at a halfway house. Would you be willing to go to that halfway house, do treatment, and continue to arrange your interstate compact process from there? Would you be willing to do that?
If I knew I could get to where I have positive environment and positive structure, then yes, but outside of that, not really.
Yeah, 'cause the board doesn't decide whether you can go in an interstate compact to another state. That's up to the interstate compact people. So I can't give you a guarantee on that. So, I'm not able to give that to you right now. So if you're stating, if you're not allowed to go to another state, you would say, I don't want to do parole, and you'd reject parole, or would you give it a try?
No, if there was no guarantee that I'd be in that positive structure like I talked about, but not really.
Then you'd say, I'm not going to parole. Okay. Well, after today's hearing, the board will decide on that, and they may very well offer you a chance at parole with those conditions that you go to a halfway house, that you follow up with treatment, and that you seek your interstate compact. At that point, it would be up to you whether you'd like to accept that parole agreement or refuse to sign that, if that's what the board does decide. I do note that you don't have any disciplinary since your last hearing. I'll note that you're doing tablet courses that you've mentioned today as well for the board. Those are the questions that I have for you. Is there anything else you'd like the board to know?
Offhand, no.
I just want to make sure I'm understanding correctly. So you're still willing to do parole, but you really are, you need the guarantee that you'd be able to go to out of state, to Portland?
Supposedly they're supposed to be integrating you guys with the main line. So what have you heard about that, and what are you guys anticipating?
Well, if the board does come back and grant a parole, I would encourage you to commit to what you agree to do. If you're required to go to a halfway house, certainly absconding is not going to result in positive consequences. So I'll note your statements, your semi-willingness to do these things, and from there the board will consider your case as a whole with all those statements and your history. At this point, I'm going to take your case under advisement. I've put together a report of what I reviewed prior to today's hearing. I'll include that, what you and I have talked about at today's hearing, in that report, and then I'll submit that to the members of the board. It usually takes a couple weeks for a decision to be made. Once that decision is made, we'll send it to you in writing through the mail, and it will also be posted to the Board of Pardons website. As of now, you have a maximum expiration date of August 31st, 2028. I think I mentioned that. That's the longest time the board will retain jurisdiction in your case. So the board could grant a release at any point, even up until that date at this time. So with that, Mr. Nyman, thank you for being here and answering my questions at today's hearing. I wish you the best of luck moving forward, and we'll go ahead and conclude today's hearing.
drop a kite? You gonna drop a medical kite? Yeah. Mm-hmm. Yeah. Yeah. Blink your eyes twice. Blink your eyes if you wanna go. Blink your eyes once if no. Yeah. Yeah, yeah. Hey, let me ask you something. So if somebody crosses over and they breathe, are they treated any differently that opposed to somebody that didn't spill their guts? Yeah. Mm. Yeah. Mm-hmm. Yeah. 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 Last year? Damn, and he's been down for a while, no? Yeah. Mm-hmm. Hey, you know what? Like last time when we were talking, when I was telling you that, because before I started talking to you guys, like I never knew what the word inside
For Brad Gale, number 177319. Is that you, sir?
Yes, it is.
My name's Scott Manning. I'm a hearing officer with the Utah Board of Pardons and Parole. I'll be conducting
Okay.
today's hearing. I'm going to be taking testimony from you today. If you'd raise your right hand, I'll swear you in. You swear that the testimony you provide today will be truthful and accurate?
Yes.
Thank you. Did you receive at least 7 days written notice of today's hearing along with your blue disclosure packet?
Yes, I did.
You and I had a hearing just a few months ago, so the new information in that packet is the new documents that we've received and that the board will consider since that most recent hearing. I'm going to go over some of that, but obviously today, the purpose of today's hearing is to allow you to comment about or object to any information in that packet. Are there any comments or questions or concerns you'd like to raise at this time?
Not that I'm aware of, no.
Okay. What I'd like to do, I'm going to give a quick review of what's happened leading up to today's hearing. You and I conducted a full hearing just a few months ago. We, went over almost all details of the case related to the board's dispositional or release decision that they will be making after today's hearing. The scope of this current hearing is really very limited. It's just a new time accounting decision and disclosure, the credit for time served, the guideline calculation, etc. But I'll discuss that. I also have a few, I'll note some letters that we received and some details from those new letters as well. Then at the end of the hearing, I'll let you have the final word, and you can state on the record anything else you'd like to. So your commitment offenses are 2 counts of aggravated sexual abuse of a child, felony 1, sodomy on a child, felony 1, and forcible sodomy, that felony 1. Those are from case 061000254. In 2008, you were sentenced in that case to serve between 10 years and up to life in prison. The 4 sentences of 10 years to life were entered concurrent with each other. At that time, you were serving a federal prison sentence, and the state sentences were entered to be served consecutively to that separate federal prison sentence. That is, consecutive means to start after the federal sentence was served and had expired. In August of 2011, the board conducted an original hearing in absentia, or you were not present for that hearing is what that means. After that hearing, you were in federal custody, of course. The board scheduled a April 2025 rehearing, requested to be notified when you arrived at the Utah State Prison to adjust that date if necessary. After serving your federal sentence, you arrived at the Utah State Prison in February of 2020. On November 5th of 2021, the board scheduled an April 2024 rehearing. You had that rehearing on May 3rd of 2024. Again, I conducted that hearing. At the hearing, the Board of Pardons had not officially decided the issue of toll time or whether the time spent in federal prison counted towards the state sentences. So obviously were entered consecutive to the federal sentence. That is, that you were not to start serving those state sentences until after the federal sentence finished. So you and I discussed this, I believe, at the previous hearing. I noted that I would be presenting that to the board for a decision as part of the hearing. After the hearing, the board scheduled today's rehearing. They entered an order that said they told the time served in federal prison. What that means is they decided that you would not receive credit for the time served in federal prison against the state sentences. Due to that decision, the applicable sentencing guideline would change, etc. This hearing was scheduled to calculate that applicable guideline and to provide those documents to you prior to today's hearing. At this time, the time accounting work has been done and was sent to you. Did you receive that time accounting work?
Yes, I have.
Okay, the guideline for the state sentences remains the same. The 191-month guideline that obviously was using the guideline calculations at the time of sentencing is the guidelines that were used and applicable to create that guideline. With the updated time accounting, your sentencing guideline date calls for a release of January 11th of 2036. Per my calculations, the 10-year minimum legal sentence will pass on February 11th of 2030. Ultimately, the board is not bound by the guidelines or the minimum, even the minimum sentences. In making their decision after today's hearing, they will consider all relevant factors, including the guideline, the minimum and maximum sentences, the nature of your offenses, victim impact, input, your criminal history, your rehabilitative progress, The risk assessments provided by the Department of Corrections and others, I believe some were done prior to sentencing. There was some submitted after you arrived at Utah State Prison. For example, I believe one noting a low risk by the sex offender treatment program folks and stating the recommendation that treatment would be best addressed in a community setting is what they recommended. The board will consider all of that information and your case as a whole after today's hearing to decide the appropriate next steps. Obviously that it could be any number of things. They could set a rehearing at some future time with expectations for behavior treatment leading up to that hearing. They could grant a release if they decided that were appropriate, various different types of release with conditions, contingencies, etc. Does that make sense to you? Do you have any questions or concerns about that information?
No, I understand it all. Thank you.
Okay, I do note at your last hearing, you answered all the questions that I had for you. We discussed the commitment offenses, your criminal history, the sex offender treatment program memos, risk assessments, your programming, your institutional behavior, your release plans, your potential parole conditions, etc. I have thorough notes from that hearing. I feel at this time that you've answered the questions that I have for you at that previous hearing. I do note that since your last hearing, it looks like you started MRT, so I will include that, and the board will be aware of that new programming. You have no disciplinary violations, and housing staff provides a positive report in the new institutional progress report. I think it also notes that any treatment will need to occur in the community is what the prison states in their recommendation for the board, which will be one of many things that the board will consider. I do also note that since the last hearing, the board has received letters of support from a brother, a longtime friend, and a man who states that he's known you for 3 years. I've provided summaries of these letters for the board. I also note your letter in which you also do deny an allegation or a statement made about you having been abused as a child in relation to you're familiar with the contents of that. I've read that and I've summarized that for the board as well. So that's the information that I have, Mr. Gale. Now I'd like to give you the opportunity. You can state anything else that you'd like the board to know, questions or concerns or anything else that you have. Now's the time for that.
I have prepared a letter, if I might read it. Would that be permissible?
Yeah, please.
Thank you. I've sent you a letter also that I've included in those papers, but this one is to the Utah Board of Pardons and Parole, to the honorable member of the board, Mr. Scott Manning, family members, community members, and acquaintances. I would like all listening to these proceedings to know of my deep regrets and remorse that I have in my heart. I'm deeply sorry for the past actions that I perpetrated upon my victim, my son Jerry, as well as my family and friends and community members. My actions and crime was far-reaching. It was an act that no one ever thought I was capable of committing. I disappointed everyone that knew me. I was leading a double life, a life I kept secret. My deviant thoughts and actions were abhorrent. My lustful desires were selfish and wrong. Many lives have been changed forever. The hurt and harm that I caused has lasting effects, and I'm sorry. I stole something from each person affected by my crime, especially my son. No person has the right to come along and change somebody else's life forever just because they want something from them. And that's something that I did. I destroyed Jerry's sense of trust and security he had in me when I acted out in my perverted way. I ache still when I realize all I've done in the past and ask for forgiveness of Jerry, my family, and to all listening to these proceedings. I've changed over the past 18 years of being incarcerated and can prove to all through my actions that I am a better and repentant person. I've made a vow to myself and to my higher power to never again go down that destructive and harmful path. I'm keeping myself far away from the edge of the cliff, the danger area, and never again will I go near that deviant pathway of viewing porn or abusing another person. I know the danger signs and I know my triggers. I'll stay away from them. I've always taken full responsibility for my crime. I have benefited and been successful in learning from the classes that I've been taking, which some include SOTP cognitive restructuring, the SOTP pre-treatment program, relationship skills, communication, family marital, as well as all the life skill classes. Each has helped me become a better person. I've learned from my mistakes. I've taken back control of my thoughts, behavior, and my actions. I have a wonderful, supportive family who love and care about me. I have great friends who are examples to me. I have a church family I know will help me if I needed them. I have an approved house I own to go to. I have plenty of things to keep me busy. Family history work, writing a book, project, gardening, yard work, remodeling, and cooking. I know I can be successful because of my commitment to change and my desire to follow the rules. I can stay in a safe space. I'm a better person now than I was. I've grown a lot through those years of being incarcerated, and I'm grateful for this time to address you as well as to everyone who's listening to these proceedings. Please know again how truly sorry I am for my past actions and for all the hurt and pain I've caused. Please forgive me as I commit to you to be a better person and a changed person. Help and support me as I strive to move forward and to be a success. Thank you for your time.
Thank you for your statement and preparing that for today's hearing. I will provide a summary of that letter to the board members, and they obviously will have access to the letters that you've sent to us here. What I'll do from here is take your case under advisement. I've put together a report, obviously, of what I reviewed prior to today's hearing and our previous hearing. I'll include what has been said today at this hearing. I will then submit that report to the members of the Board of Pardons and Parole. I, again, am not a board member. I'm a hearing officer. There's 5 board members, and they will vote. They make decisions by a majority vote. Usually that decision-making process takes between 2 to 4 weeks for the decision to be made. At that point, we will send it to you in writing through the mail, Mr. Gale, and it will also be posted to the Board of Pardons website if there's anyone in the community that would like to access it there. So with that, thank you for being here today and participating in the hearing. I wish you the best of luck moving forward, and we'll go ahead and conclude.
Thank you, Mr. Manning.
Yeah. Well, they really don't talk about it. Like, you know, when they're on these board hearings, they don't talk about those things. But I could imagine that it's way different than California. I think California is definitely a lot different when it comes to the way things run and operate than other states.
And then we'll start with today's hearing.
On record.
This is a rehearing for Romeo Lucero, number 206317. Is that you, sir?
Yes.
My name's Scott Manning. I'm a hearing officer with the Utah Board of Pardons and Parole. I will be conducting today's hearing. I am going to be taking testimony from you today. If you'd raise your right hand, I'll swear you in. Do you swear that the testimony you provide today will be truthful and accurate?
Yes.
Thank you. Did you receive at least 7 days written notice of today's hearing along with your blue disclosure packet?
Yes.
That disclosure packet contains most of the new information that the board has received and reviewed since your latest hearing. I do note before I ask you about that, we have 2 items of late disclosure. Yesterday, the board, our staff, sent to you, I believe through your case manager, and a physical copy as well, an amended sentence, judgment, and commitment that was entered by the sentencing court in June of 2022. Prior to yesterday, the Board of Pardons and Parole had not received that document, or that document had not been in the Board of Pardons file, the documents that are considered by the board. And it was therefore not in the board's file. It was discovered in preparation for today's hearing and now is included in the board's file and will be considered in the decision after today's hearing, as well as decisions moving forward. Did you receive and review that document?
Yes.
Okay, you do have the right to, generally, we allow up to 7 days of notice to review so that you can respond to any documents that are provided. If you'd like to, we can postpone today's hearing for you to have further time to review that document, or if you're comfortable moving forward with having what you've reviewed as of today, if you're willing to waive that disclosure, we can proceed today. How would you like to proceed with that?
We could proceed.
So you'd like to waive any further disclosure of that document and proceed today? Okay. I also note yesterday we received a letter of support, I believe, from your son. This is in addition to 3 additional support letters that we had received prior to that. Obviously, you have the right to receive all information and documents and review those prior to today's hearing. Did you receive this letter of support?
Yeah, I believe so. For my son.
Okay. It's positive letter towards you. Are you comfortable waiving further disclosure of that and moving forward today?
Yes.
Okay. And then as far as all of the disclosure that you received, so the blue disclosure packet, as well as these 2 items of late disclosure, one of the main purposes of today's hearing is to allow you an opportunity to respond or comment about that information, as is that is what the board will be considering. I have some questions prepared for you to discuss, if you know, that from what I've reviewed. But at this time, are there any errors or inaccuracies that you'd like to discuss, or any other comments you'd like to make about that disclosure?
I mean, yeah, there's like, I read something that said that the family and the victim didn't say anything, and I read that it said that I was threatening them and recording them and following them and stuff like that. And none of that ever happened. I do believe the mother was caught doing that, but me and the mother weren't together. You know, I had nothing to do with any of that.
This is from the sentence, judgment, and commitment, correct?
Yeah.
Did I just understand you correctly? You are claiming that the victim's mother recorded someone or harassed someone? Is that what you just stated?
No. So when we were going through the DCFS, I do remember hearing something about that, but in that disclosure, it's like claiming that it was me.
Yeah, that's certainly what it states. Is it so are you denying that you engaged in that behavior?
Yes.
Okay.
I never threatened any caseworkers or like had any like anything bad with any of them. Not the foster family. Never threatened them. Never followed them. We had a good relationship.
Hey, thank you for answering that one. I got another one. I got 3 more for you.
Well, I'll certainly note your comments about those statements as the board considers this document. I will note the statements that you've made today. Anything else that you'd like to note before we start?
No.
Okay. What I'd like to do today, I'm going to quickly review what's happened leading up to today's hearing. From there, I have some questions that I've prepared to ask you. And at the end of the hearing, I'll allow you to have the final word, and you can state anything further that you'd like to on the record. Your commitment offense is inflict serious physical injury on a child intentionally, felony 2. This case, the facts of this case have been discussed at previous hearings. I'm familiar with what has been said at those hearings. I'm also very familiar with the facts of the case as they are presented in the disclosure that has been sent to you up to this point. My primary focus at today's hearing may be on new information since your last hearing, but really the purpose of today's hearing is for you to make any statements and present all information that the board, that you would like the board to consider. So if you'd like to make statements about the case, the facts of the case, or anything else that has been discussed at past hearings, please feel free to do that. You arrived at the prison in May of 2022. You're serving a maximum aggregate sentence of between 1 year and up to 15 years in prison. That sentence will expire on April 19th of 2037. That's the maximum amount of time that the Board of Pardons at this point will retain jurisdiction, the maximum amount of time that the board could require incarceration as well. Your parole guideline calls for 24 months incarceration. That guideline passed on April 19th of 2024. Of course, the board is not bound by those guidelines, and in making release decisions, they consider all relevant factors, including the minimum and maximum sentence, the guideline, the nature of your offenses, your criminal history, reports and recommendations from the sentencing court, victim impact, letters of support, your rehabilitative progress and programming, various risk assessments, etc. And it looks like in December of 2022, the board scheduled an October 2023 original hearing with a psychological review. At that time, they noted an expectation that you complete all available cognitive behavioral therapy and domestic violence programming and also comply with your case action plan. You had an original hearing in October of 2023. After that hearing, the board scheduled today's hearing requesting a contract psychological assessment. At this time, the board noted an expectation that you complete substance use treatment programming as evaluated to be appropriate and cognitive behavioral therapy. I do note at the time of the original hearing, the Board of Pardons had received a notice of cancellation of the psychological review. It said the psychological review is not completed due to your mental health classification at the facility and because a review of available material led to the conclusion that, quote, no further evaluation appeared warranted. For this hearing, the board has not received the requested contract psychological assessment. I've been notified that we will not be receiving one of those assessments for today's hearing. I note that it is possible that the board could delay its decision on this hearing and request to receive a contract psychological assessment. It's up to them. Obviously, I'm not going to speculate on what the board will decide to do, but that certainly is a possibility as it was requested for today's hearing and has not been provided as of now. I do note in February of 2024, the prison notified the board that of an alleged assault that occurred in February 2024. They were screening potential criminal charges for that. In October of 2024, so 7 days ago, the board received notification that no charges would be filed in relation to that incident. That report said, quote, Romeo Lucero was cleared of all charges and no new criminal charges will be filed on him with regard to this incident. So that leads us up today. That's the procedure leading up to today's hearing. I have some questions for you that I've prepared, but I want to give you an opportunity. Really, the main purpose is for you to provide statements and input for the board. What would you like the Board of Pardons to know as they make a decision in your case after today's hearing?
I would just like you guys to know that, I've really tried to take this time to do everything I can to better myself. On Tuesday, I graduated MRT. I got my certificate here. I didn't have time to send it out, and I forgot when I got my stuff yesterday. I forgot to have my caseworker fax it, and I started high school in December of 2022 with just, I think, a little over 2 credits. On Monday, I turned in my, I believe, my final packet, so I should be graduating high school soon. So yeah, like I'm just really trying to do everything I can to better myself so I could be a better person. This has really opened up my eyes a lot and showed me like the life I was living was, really wrong. And, every day I think about what I did and I regret it every day. I wish I could change things. I know I'll never hurt anybody again. I know I'll never be in this situation again. So yeah, I would just really like to have the opportunity to prove to you guys, from outside of here, I haven't had a single write-up. I know what you were just talking about, this assault that took place. I believe the only reason I was ever being screened for anything was because, it was my cellie and it happened in our cell. So I believe that's the only reason like that they involved me in the investigation.
Yeah, like I said, that we received notice, no charges to be filed. It said you were cleared from, really, it said, cleared of all charges. So, yeah, but I will note your comments on that.
Okay.
Sorry to interrupt. Please continue if anything else you'd like to say.
Um, yeah, so, you know, like I said, I really try to make the most of this to, you know, learn and be a better person. I've tried to do everything available to me. Yeah, like I've been tried to be on my best behavior. I haven't had a single write-up my entire time in prison. I had a job for over a year. I lost the job because I came to the county jail. Yeah, I'm just, you know, want to prove to you guys that I'm gonna conduct myself as a law-abiding citizen if I'm released. And you know, I plan to, you know, if I do get out, like I'll have to go stay with my mom for a little while. But as soon as I'm up on my feet, you know, I plan to move out of Ogden and try to start my life somewhere else. I don't want to be in the same area. And yeah, I'm ready to prove myself. You know, I feel like I've taken this time to do everything in my hands that I can to show that this will never happen again.
Okay. Thanks for your comments. I will note those. I know we do not have documentation as of yet that MRT was completed or high school, but have your case manager upload that or close it out on OTRAC, and that will be considered. Since arriving at the prison in May of 2022, I show that you've successfully completed anger management twice. I note the MRT participation for about 3 months leading up to today's hearing. Your statement that you've completed it, also working on high school. I do note, so your commitment offense involved very concerning abuse of a 5-year-old child over whom you held a position of authority and trust. This abuse occurred over an extended period. Many acts of violence were encapsulated into the plea of 1 count. As described in the official version of the case, certainly supported by what seems to be clear evidence of the behavior involved, it shows extreme cruelty and depravity. And the abuse caused certainly severe physical and likely psychological damage to the victim. I also note that your prior violent offenses, particularly the aggravated cruelty to an animal case, evidenced similar cruelty and depravity by the facts of the case. Have you gained any insight into what led you to engaging in this behavior?
So I just know, like, I was really going down a really dark path, you know, doing a lot of drugs and just filled with anger and you know, for whatever reason, I took it out on my girlfriend's son. Like, we would fight, and I know, like, I was a jealous person. You know, I was kind of jealous he wasn't my son. And I don't know why I did these things, like, just out of rage and jealousy. You know, I was abused as a kid, and I never imagined being an abuser. But yeah, like, I just think I acted out of, you know, not thinking clearly, just in the moment, and just felt
Certainly,
like
this occurred over an extended period of time, correct? So, were you using you said drugs, so substance abuse, were you always under the influence as this abuse occurred?
I believe so. Like, I was break every day. Yeah, I was doing drugs every day. Like, there wasn't a day that I did not get high.
Sorry to cut you off. I heard you say in the moment, and that seems to not correspond with the facts as I understand them. What do you mean by in the moment, if you don't mind expanding on that?
I mean, just like something would, you know, get me angry. Like, I'd get in a fight with my girlfriend, and I would just be angry. You know, there's times I remember, like, that I don't even remember. I know I was taking a lot of Xanax and blacking out and doing things like that I don't really remember. I do remember some things. But yeah, like it was just I kept doing these things. It just became normal, I guess. Like
Okay. I do know that at the SMART scheduling in December of 2022, the board referred the case to the trial court to determine restitution and forward to the Office of State Debt Collection. I've not been able to locate any restitution, so I don't know about that. But are you willing to pay any restitution that you owe or that is ordered?
yes, absolutely.
Okay, I do know after previous decisions, the board has set the express expectation that you complete domestic violence classes or programming and substance use treatment programming as evaluated to be appropriate. I show that on your case action plan, substance use treatment goal has been open since August of 2023 for residential treatment. Have you attempted to get into these programs?
Yeah, I mean, I've tried, but it's never been available like where I've been housed.
And that's, you recently got the override for the county move. Is that, am I understanding that correctly?
Yes,
And that, when did that happen?
it happened in June 19th. I was moved from Antelope.
So about 4 months?
Yeah.
Okay. And prior to that move, the issues related to that override prevented some of this programming. Am I understanding that correctly?
So I never even put in for the county. I don't know, like how all that happened, but so I was like trying to take off my safety so I could go to population, and so I could try to do this program, but they never, they felt like I was a safety risk. So,
That's my review. I read the administrative override. It says that this override was a lot so that you could go to the county, I assume, to get involved in programming that has been stated as an expectation. I just wanted to ask if that was my understanding. Is your understanding the same as mine?
yeah, I believe so. But as far as I know, the county I'm in doesn't have. I don't know if they're bringing it. I heard they were going to bring a substance abuse class. They haven't. Like I've had my mother look into classes that I could do if I were to get released for substance abuse.
Is that you've said, I think in previous statements, Weber Human Services is if you are allowed to parole, that you would want to do those through Weber Human Services. Is that correct?
Yeah, and also I believe one is called Weber Recovery.
Weber Recovery.
That's like a residential.
Okay. Okay. Well, I'll note those things. I mean, so I looked, it looks like, according to our records, you successfully completed an outpatient treatment program through DORA, I think during a successful probation period in 2013. Obviously, after completing that programming, the successful completion of probation, you returned to, very concerning violent behavior. What prevented you from applying what you learned in those past programs at that time? And if you're granted another opportunity, what would be different in the future?
I believe just being young and dumb, like I just think I wasn't fully committed and ready for change. I was still hanging out with the same type of people, and I just know like that young me wasn't ready. I was still immature, still doing things I shouldn't have been doing. And now, like, I know, like, my life's getting shorter. Like, I'm older. I don't have the time to mess around like that anymore. Life is getting, like, I need to make something of my life. Like, my son's a teenager, and just growth, like being here, like I don't want to come back here. I don't want to be here. And I just know like now I'm ready for, full commitment. I'm ready to change my life, to show to you guys that I'm ready to be a law-abiding citizen and conduct myself as one.
Okay. We have about a minute left in the hearing. So I've reviewed your written submissions regarding if the board does decide to grant a parole, what your release plan would look like. Those were quite thorough. I have notes on that, so I'll report those to the Board of Pardons. At this time, want to give you the final word. Anything else that you'd like the board to know or consider as they're making its decision? And certainly, if you have comments, further comments about your release plans or any other topic, please include those in your statements.
You know, just that I'm willing to do anything you guys ask of me. I'm ready to show you guys that I've learned from this, and it will never happen again. I'm going to do everything I can to prove that. And upon my release, like I said, I have work waiting for me. I have a place I can go to, and you know, after that, you guys will never hear from me again. And like I've done everything like available. If there's something that hasn't been done, it's because it hasn't been available to me.
Okay. Thank you for your comments today. What I'll do from here is take your case under advisement. I've put together a report of everything that I've reviewed before today's hearing. I will include what has been said at today's hearing into that report, and then I'll submit that to the members of the Board of Pardons, hopefully by tomorrow. There's 5 members of the board. They make decisions by a majority vote, so 3 out of 5 have to agree. Usually that process takes between 2 to 4 weeks. Sometimes it's quicker than that. Sometimes it does take a bit longer than that. Once a decision is made, we will send it to you, Mr. Lucero, through the mail, and it will also be posted to the Utah Board of Pardons and Parole website if there's anyone in the community that would like to access it there. So that's how we will proceed. With that, thank you for being here and discussing these things with me, Mr. Lucero, and we will go ahead and conclude today's hearing.
Okay, thank you for your time.
We got Albuquerque, Nuevo Mexico. Let me see. We got Liz Gamboa, and she writes, "Hi everyone." Let me see. And Tina writes, "My dad was a lifer there. Rest in peace, Sydney Herrera."
Hello there, can you hear me?
Yeah, thanks for being here, Luis.
Absolutely. Thank you
What
for
was your last name again? Moreno. I've got Luis Moreno.
Yes.
We will just get Mr. Fernandez here, and then we'll get started.
Okay.
So we got a question from
I'm ready.
Isn't this like a 3-way call? It's like
Okay, we'll wait for Mr. Fernandez and then get on record, and we'll go from there.
Sounds good.
60 people.
Ya estoy acá, yo. I heard he said I'm here.
Oh, can you turn your camera on? And is it Summit County?
Encienda su cámara, por favor.
Or I guess if they can't or don't want to, that's also fine, but generally we do.
Normalmente depende de usted si quiere poner la cámara o no.
Sí, ahí está.
Por ahí abajo, ahí está, ahora sí lo vemos.
Okay, we'll get on the record and then we'll start.
Vamos a empezar ya formalmente, ¿ok?
Okay.
On record.
This is a rehearing for Waldo Fernandez.
Esta es una nueva audiencia para Waldo Hernández.
Number 221173.
Número 221173.
Is that you, sir?
¿Es usted? Yes.
I'm Scott Manning. I'll be conducting today.
Mi nombre es Scott Manning y estoy a cargo de llevar esta audiencia.
You'd raise your right hand. I'll swear you in.
Levante la mano derecha para tomarle su juramento.
Do you swear that the testimony you provide today will be truthful and accurate?
¿Jura que el testimonio que va a dar será la verdad y preciso?
Yes.
Thank you.
Yes. Gracias.
Did you receive at least 7 days written notice of today's hearing?
¿Le han notificado al menos con 7 días de anticipación acerca de esta audiencia?
Sí.
Yes.
Did you receive your blue disclosure packet?
Yes.
¿Ha recibido un paquete en un folder azul?
Yes.
That's the new information the board has received since your last hearing.
Are you saying that, are you stating that that is the newest information we have received?
That is all new information that the board has received since his last hearing, which was in 2015.
La información que contiene ese paquete es información actualizada desde la última fecha que tuvo su audiencia en el 2015.
Sí, me mandaron el Blue Packet viejo y el nuevo, pero hay algunos errores, por ejemplo, cursos que yo tomé que no figuran como que no lo hice, pero yo tengo los certificados acá de los cursos que hice.
Un momentito para interpretar esa parte, ¿ok? I have received the old and the new files, and while comparing them, the new file does not show a course that I took, and I have the certificate with me.
So I have all of those certificates, and I've put them in my report so the board will know about that.
So yo he añadido toda esa información en mi reporte para que el panel lo vea.
Okay.
We've received many certificates that do not show on the system, and I will notify the board of that.
Nos hace falta recibimos muchos certificados que no aparecen en el sistema. Necesitamos hacerle saber al panel acerca de ello.
Yeah, I've done that. Okay. Is there anything else you'd like, any errors or inaccuracies, any further errors or inaccuracies you'd like to mention?
¿Hay alguna otra imprecisión o algo faltante o algo tergiversado en los documentos que usted ha recibido?
Sí, también el otro es que figura como que yo no tuve apoyo familiar y cuando sí lo tuve, incluso mis hijos le enviaron a ellos cartas ahora, la semana pasada.
Yes, there is a statement that I didn't have family support during this process, when the fact is that I did. As a matter of fact, I understand that my children send you some letters.
I read those letters, and I've included a summary of those in my report for the board.
He leído esas cartas y he incluido un resumen de las mismas al panel.
While we're on that topic,
Lo que pienso de ese tema,
just one thing, in some of the letters, those individuals request that you be allowed to remain in the United States.
En algunas de esas cartas, algunas de las personas solicitan que se le permita permanecer en los Estados Unidos.
I just want to clarify that the Board of Pardons does not make any decisions in that regard.
Solamente quiero hacerles saber que el panel de libertad condicional no toma decisiones acerca de ese tipo de cosas.
Entiendo eso.
I understand that.
Okay. Anything else you'd like to note or errors you'd like to discuss?
¿Hay algo más o algún error del cual quisiera usted conversar?
No. Eso eran los dos puntos que quería.
No. Those are the two items that I wanted to talk about.
So what I want to do, I'm going to give a quick review of what's happened before today's hearing to start.
Voy a hacer una rápida revisión de lo ocurrido desde la última sesión.
Then I have some questions for you.
Y voy a hacer algunas preguntas.
Then at the end of the hearing, I'll let you have the final word.
Y al final de la audiencia voy a dejar que usted diga lo que tenga que decir.
Okay.
Thank you.
Your commitment offenses are aggravated robbery, felony 1.
Usted ha cometido ofensa de robo agravado, que es una felonía 1.
And obstruction of justice, felony 2.
Obstrucción de la justicia, felonía 2.
These cases were discussed at length at your previous hearing.
Estas acusaciones se han conversado mucho en su última audiencia.
And the facts of that case, as well as your comments about that case, will be considered by the board as they make a decision.
Y los hechos de esa reunión y además su testimonio van a ser considerados por el panel al momento de tomar una decisión.
Today, I plan to generally focus on new information since your last hearing.
Hoy día quiero enfocarme mayormente en información nueva que usted haya obtenido desde su última audiencia.
Purpose of this hearing is to allow you to speak on any of the information in your case.
El propósito de esta audiencia es permitirle hablar acerca de cualquiera de estos eventos.
Even if I don't ask about something, please make any comments that you'd like to.
Aunque yo no le pregunte nada acerca de algo específico, haga los comentarios que usted quiera hacer.
You arrived at the prison in February of 2015.
Usted llegó a la prisión en febrero del 2015.
You are serving a maximum aggregate sentence of between 6 years and up to life in prison.
Está enfrentando la posibilidad de enfrentar un conjunto de sentencias, una combinación de sentencias de entre 6 años y prisión de por vida.
Your parole guideline called for 78 months incarceration.
Las normas de su posibilidad de libertad condicional hablan primero de un encarcelamiento de 78 meses.
That guideline passed in December of 2020.
Esa fecha se venció en diciembre del 2020.
Of course, the board is not bound by that guideline and will consider your case as a whole to determine a potential release.
El panel no va a tomar en consideración eso, va a tomar en consideración todo su caso para considerar la posibilidad de autorizar su salida.
So note that there is an immigration detainer on file.
Tiene que saber que hay un hall de migraciones.
So any release will be to the federal authorities for deportation proceedings.
Así que cualquier liberación suya va a ser a las autoridades de migraciones para su trámite de deportación.
It looks like you had an original hearing in March 2018.
Parece que tuvo una audiencia original en marzo del 2018.
After that hearing, the board scheduled today's hearing.
Y en esa fecha se programó esta audiencia.
So I have questions about what's happened since your last hearing, but I want to give you.
Tengo algunas preguntas respecto a de lo que pasó desde su última audiencia y quiero permitirle la posibilidad de hablar primero.
What would you like the board to know?
¿Qué quisiera usted que el directorio supiese, el panel?
Como lo dije en el 2018, estoy totalmente arrepentido del delito que cometí.
As I said back in 2018, I'm completely repented for the crime that I committed back then.
Yo ya pasaron más de 10 años desde que estoy encarcelado y pido por favor que me den una oportunidad de reintegrarme a la sociedad. Yo sé que voy a ser deportado a mi país, pero tengo 8 hijos. Lamentablemente este tiempo mis padres fallecieron.
Déjeme interpretar esta parte. It's been about 10 years of incarceration that I've gone through, and I want to request, I want to please ask to be considered for release, so I can spend time with my family. ¿Qué más?
Tengo 8 hijos que me esperan.
I have 8 children.
Lamentablemente este tiempo de encarcelación, mis padres fallecieron.
That wait for me. Unfortunately, my parents passed during my incarceration time.
Y realmente quisiera pasar tiempo con mi familia.
And I really would like to spend time with my family.
Ya tengo 52 años y no sé cuánto tiempo más me quede, pero sí me
I'm
gustaría.
already 52 years, and I don't know how much time I have left, but I really would like to.
Para pasar tiempo con mi familia, mis hijos, mis nietos. Tengo nietos que no conozco.
Spend time with my children and with my grandkids. I have grandkids that I haven't met yet.
I've noted I think it looks like you've worked on high school and done many tablet classes that we received in your IPR.
Vemos en su IPR que ha tomado usted varias clases.
I'm not going to repeat all of them because there's quite a few of them specifically.
No voy a repetirlas todas porque hay algunas que son muy específicas.
But what have you learned?
Pero ¿qué ha aprendido usted?
Sinceramente aprendí que lo que hice estuvo mal.
Sincerely, I learned that what I did was wrong.
Ellos saben que anteriormente a esto yo jamás tuve problemas con la ley. Mi récord estaba limpio.
You know that before this situation, my record was absolutely clean. I've never had an issue.
You've had one disciplinary violation in June of 2018.
En junio del 2018 usted tuvo una violación disciplinaria.
It's been about 6 years. It was about 3 months after your previous hearing.
Sorry, could you repeat that?
So it's been about 6 years, and it happened 3 months after your last board hearing.
Han pasado ya 6 años y esto ocurrió 3 meses después de su audiencia.
The report says you had contraband in your cell.
El reporte dice que usted tenía productos de contrabando en su celda.
What contraband did you have? Do you remember?
¿Qué contrabando tenía? ¿Recuerda?
Sí, fue un MP3.
Yes, it was an MP3.
Like someone else's MP3 player?
¿Era el MP3 de alguien más?
Uno de mis sobrinos cuando llegó del condado me lo regaló porque a él lo enviaron para otro condado. Entonces no se lo llevó y me lo dejó a mí, pero era de mi sobrino.
Solo para clarificar, su sobrino era prisionero también.
Es prisionero y está en el mismo
Llegó transferido. Okay. I asked for clarification on his statement. Mr. Hernandez said that the MP3 belonged to his nephew that was being transferred to another county jail, and he passed it to me.
One of the co-defendants?
Yes.
But housing staff provides a generally positive report of your behavior and attitude.
I'm sorry, I couldn't hear well.
The housing staff, prison staff, provides a generally positive report of his behavior and attitude.
El personal de la cárcel generaron un reporte de comportamiento general bueno para usted.
I'll note that for the board.
Voy a hacer mención de eso para el panel.
Thank you.
The cases, about $58,000 in restitution was ordered.
En el caso también se ordenaron $58,000 de restitución.
It was entered joint and several with the co-defendants.
I'm sorry, could you repeat that?
It was entered joint and several with the co-defendants, so all co-defendants are equally responsible for the restitution.
Todos los participantes en este evento son responsables para el pago de esta restitución.
This has been converted to a civil judgment and sent to the Office of State Debt Collection.
Así que se convierte en un asunto estatal y es enviado a la Oficina de Cobranzas del Estado.
Have you paid any restitution?
¿Ha pagado parte de esto?
No pude pagar nada, institución. Sí me llegó una carta que lo enviaron a collection.
Yeah, I received a letter that it was sent to collection, but I didn't get to pay any of that.
You willing to pay restitution?
¿Está dispuesto a pagar la restitución?
Estoy dispuesto, o sea, sí, claro que sí tengo la posibilidad de estar trabajando y pagarla, sí, claro que sí.
Yes, if I can work and generate, will pay.
Okay. And it looks like if you are granted a release, you plan to return to Argentina. Is that correct?
Si es que le otorgan la libertad y es usted deportado, piensa regresar a Argentina, ¿verdad?
No, porque me envían a Argentina, o sea, mi país de nacimiento.
Yes, they will be sending me over.
Okay. And what would your release plan, what would your plan look like in Argentina? What would you be doing and engaging in behavior or work, and where would you live and treatment or any other plans you have?
¿Qué planes tiene para cuando llegue a la Argentina? ¿Dónde va a vivir? ¿Se va a someter a alguna terapia? ¿Va a hacer algo? ¿Va a trabajar?
Vivir en mi casa, tengo una casa, bueno, tengo mis hijas, 2 hijas que viven ahí, y trabajar, yo todo este tiempo, bueno, acá en este país trabajé en construcción, en remodelación de casas.
I have a home where 2 of my daughters live, so I'm going to be living there, and I'm planning on finding a job, most likely in construction, which is what I have been doing here, what I have done here.
Okay. If you are granted parole, that parole will include immigration conditions.
Si le dan libertad condicional, eso va a incluir condiciones de migraciones.
That includes submitting to federal authorities for deportation proceedings.
Eso significa presentarse al llamado de las autoridades federales para procedimientos de deportación.
If you are deported, do not remain in or return to the United States without lawful permission.
Si es deportado, no puede regresar a los Estados Unidos sin permiso.
If you are not deported, report to adult probation and parole within 48 hours to determine additional parole conditions.
Si es que no es deportado, tiene que reportarse a la Oficina de Libertad Condicional para determinar otras condiciones.
Are you willing to abide by those conditions?
¿Está dispuesto a acatar esas disposiciones?
Sí, por supuesto que sí.
Yes, of course.
At the 2018 hearing, you told the hearing officer that you were involved in 2 robberies, but no more robberies.
Durante la audiencia en el 2018, usted declaró que había participado en 2 robos, pero no más de 2.
Sí.
Is that still your statement? 2 robberies, but no additional robberies?
¿Sigue siendo esa su declaración? ¿No ha cometido otros robos adicionales?
No, yo he cometido los 2 robos y eso es lo que...
No.
Por lo que estoy acá.
Those 2 thefts are the only ones I committed.
The official version speaks of many robberies. It notes the convictions that you had, so I just wanted to clarify. So thank you for answering.
Gracias por responder. Su declaración original habla de varios incidentes.
And your statement is you were the driver at both of these robberies?
¿Usted declaró que había sido el conductor en ambos robos?
Sí.
Yes.
That, but you were involved in planning the robberies and knew what was going to happen inside those robberies?
¿Y usted participó en planear el robo y en determinar lo que iba a ocurrir durante ellos?
No, eso yo dije en la primera audiencia que no se planeó nada, o sea, los 4 necesitábamos dinero y lo hicimos, pero no fue nada planeado.
So, as I stated during that first audience in 2018, what I said was that there was no planning, previous planning to committing this robbery. We all needed the money, so we just went ahead and did it with no planning.
Okay. In my review, it says that the co-defendants stated at their previous hearings that you were the quote mastermind to the incident.
Lo que estoy revisando acá es que dice que las declaraciones principales hablan de que usted era la persona que planeó esto.
Do you have any other further comment on that? I want to have a clear statement today to understand also what you said at the past hearing. So any further comment on that?
¿Algún comentario adicional para poder entender lo que usted dijo en esa audiencia?
Sí, lo que pasa, yo creo que todos los que, o sea, participamos, cada uno dijo, o sea, algo como para hacer menos tiempo, pero la verdad es que los 4 participamos, yo no obligué a nadie, los 4 ya éramos adultos y pasó así.
So the truth is that we were 4, and the 4 of us had talks about what we were going to do, and I didn't force anybody. They were all adults, and they made the decision to participate, and we did what we did.
Y yo nunca entré a ningún negocio y como siempre dije fui el driver, porque si yo hubiera organizado algo, yo entro al banco, a la tienda y lo hago yo, pero o sea, yo estaba afuera, yo no sé qué es lo que puede pasar adentro o qué pasó adentro.
As the driver, I stayed outside waiting while they went into the bank. If I would have been the planning mind of this, I would have probably had a more active participation on it.
Thank you for your statements. I just wanted to get a statement today so that I could report that to the board as they make a decision on your case.
Gracias por dar su declaración. Quería registrar esta declaración suya antes de poder enviar mi reporte al panel de libertad condicional.
Okay. Those are the questions I have for you. Is there anything else you'd like the board to know?
¿Hay algo más que usted quiera que el panel sepa?
Sí, que por favor me den la oportunidad, ya pasaron más de 10 años, la vida en la prisión no es vida. Vi cómo mataron a una persona.
Yes, I mean, I've been already incarcerated for 10 years, and I would like to have the opportunity. I mean, the life in prison is not really life. I witnessed the assassination or killing of someone.
Después, al día siguiente, como yo era el janitor, el de la limpieza,
because I was the janitor, and the morning after,
me llevaron a esa sección a limpiar sangre de la persona que yo vi morir. Y
I had to go back to that place to clean blood traces of the person that I witnessed dying.
Y eso es un momento que no le deseo a nadie, ver cómo lo matan y después tener que hacer eso. Es algo que jamás en mi vida pasé.
Having to do that was an experience that I really don't wish to anybody. Witnessing an event like that and then having to go and clean this blood, I don't wish that to anybody.
Eso pasó en el 2016 en el Ocra 1.
That happened in 2016 at Okra 1.
Okay. What I'll do from here is take your case under advisement.
A partir de este momento voy a tomar su caso bajo revisión.
I'll include what we've talked about today in a report that I've prepared in preparing for today's hearing.
Voy a incluirlo en el reporte que voy a preparar a raíz de esta reunión.
I'll submit that report to the members of the board, hopefully by tomorrow.
Voy a enviar esto a los miembros del panel, esperemos que mañana.
Board generally takes between 2 to 4 weeks for them to make a decision.
Normalmente se tardan entre 4 o 5 semanas en tomar una decisión.
Once a decision is made, we'll send it to you in the mail.
Una vez que tomen una decisión, se la vamos a enviar a usted por correo.
And it will also be posted to the Board of Pardons website if there's anyone in the community that would like to access it there.
También va a estar publicada en la página web de la comunidad penal.
With that, thank you for being here, Mr. Fernandez, and answering my questions. I wish you the best of luck, and we'll go ahead and conclude today's hearing.
Le agradezco mucho por estar aquí con nosotros, señor Fernández, y le deseo mucha suerte.
Gracias.
Luis, thank you for translating today.
You're very welcome. Thank you very much, Scott. Mucha suerte.
Gracias.
Hasta luego.